Wyden.
Thank you very much, Mr. Chairman. Before I begin my questions, I'd like to start by entering into the record a letter the committee received from Ambassador Carolyn Kennedy outlining what she believes is Mr. Kennedy's lack of personal fitness for the office.
Without objection.
Mr. Kennedy, you have spent years pushing conflicting stories about vaccines. You say one thing and then you say another. In your testimony today under oath, you denied that you were anti-vaccine. But during a podcast interview in July of 2023, you said, quote, "No vaccine is safe and effective." In your testimony today, in order to prove you're not anti-vax, you note that all your kids are vaccinated. But in a podcast in 2020, you said, and I quote, "You would do anything, pay anything to go back in time and not vaccinate your kids." Mr. Kennedy, all of these things cannot be true. So, are you lying to Congress today when you say you are pro-vaccine, or did you lie on all those podcasts? We have all of this on tape, by the way.
Yeah, Senator, as you know, because it's been repeatedly debunked, that statement that I made on the Lex Friedman podcast was a fragment of the statement. He asked me, and anybody who actually goes and looks at that podcast and will see this. He asked me, are there vaccines that are safe and effective? And I said to him, some of the live virus vaccines are. And I said, there are no vaccines that are safe and effective. And I was going to continue for every person. Every medicine has people who are sensitive to them, including vaccines.
Right. So
he interrupted me at that point. I've corrected it many times, including on national TV. You know about this, Senator Wyden. So bringing this up right now is dishonest.
Let's be clear about what you've actually done then, since you want to deny your statements. For example, you have a history of trying to take vaccines away from people. In May of 2021, you petitioned the Food and Drug Administration to not only block Americans from having access to the COVID vaccine, but to prevent any future access to the life-saving vaccine. Are you denying that? Your name is on the petition.
We brought that petition after CDC recommended the COVID vaccine without any scientific basis for 6-year-old children. Most experts agree today, even the people who did it back then, that COVID vaccines are inappropriate for 6-year-old children who basically have a zero risk from COVID. That's why I brought that lawsuit. I don't want to. I want to emphasize
Mr. Kennedy, the facts.
The committee will be in order. And to the audience.
Senator, I'm not against vaccine.
If you'll hold off for a second, Mr. Kennedy. To the audience. Comments from the audience are inappropriate and out of order. And if there are any further disruptions, the committee will recess until the police can restore order. Please follow the rules of the committee. Mr. Kennedy, you may proceed.
I also want to point out that your recitation of what happened in Samoa is absolutely wrong, and you know it's wrong.
We'll get to that in a moment. Right now, we're talking about the petition that you filed to block Americans from having access to the vaccine and to prevent any future access to the vaccine. Those facts are on the record. My third question to you is, you made almost $5 million from book deals, mostly promoting junk science. In 2021, in a book called The Measles Book, you wrote that parents had been, quote, misled into believing that measles is a deadly disease and that measles vaccines are necessary, safe, and effective. The reality is measles are, in fact, deadly and highly contagious, something that you should have learned after your lives contributed to the deaths of 83 people, most of them children, in a measles outbreak in Samoa. So my question here is, Mr. Kennedy, is measles deadly, yes or no?
The death rate from measles historically in this country in 1963, the year before the introduction of the vaccine, was 1 in 10,000. Let me explain what happened in Samoa. In Samoa, in 2017 or 2015, there were 2 kids who died following the MMR vaccine. And the vaccination rates in Samoa dropped precipitously from about 63% to the mid-30s, so they've never been very high. And in 2018, 2 more kids died following the MMR vaccine, and the government of Samoa banned the MMR vaccine. I arrived a year later when vaccination rates were already below any previous level. I went there, nothing to do with vaccines. I went there to introduce a medical informatics system that would digitalize records in Samoa and make health delivery much more efficient. I never gave any public statement about vaccines. You cannot find a single Samoan who will say, I didn't get a vaccine because of Bobby Kennedy. I went in June of 2019. The measles outbreak started in August. Oh, clearly I had nothing to do with the measles. Not only that,
Mr. Kennedy,
Senator, if you let me finish, Senator.
You have had some time.
If you let me finish, Senator. If you let me finish. There are 83 people died when the tissue samples were sent to New Zealand. Most of those people did not have measles. We don't know what was killing them. The same outbreak occurred in Tonga and Fiji, and no extra people died. There were 7 measles outbreaks in the 13 years prior to my arrival.
I just would like to get my time back. The nominee wrote a book saying that people had been misled into believing that measles is a deadly disease. He's trying now to play down his role in Samoa. That's not what the parents say. That's not what Governor Green says. It's time to make sure that we blow the whistle on actually what your views are. At least we're starting.
We need to move
Senator,
on.
I support the measles vaccine. I support the polio vaccine. I will do nothing as HHS Secretary that makes it difficult or discourages people from taking either of those
Anybody
vaccines.
who believes that ought to look at the measles book you wrote saying parents have been misled into believing that measles is a deadly disease. That's not true.
We need to move on. Senator Grassley.
Welcome. I'm going to do like I did.
Mr. Kennedy, welcome to you and your family, and congratulations. I appreciate Senator Grassley raising the issue of the Office of Refugee Resettlement within the auspices of Health and Human Services. I think this may surprise people, but that's actually the responsibility of HHS, the Office of Resettlement Relocation. Under the previous administration, as Senator Grassley alluded, there were roughly 500,000 children, unaccompanied minors, that were placed with sponsors in the interior of the United States. The previous administration took the position that it was not the federal government's responsibility once these children were placed with these sponsors. But the New York Times and a series of investigative stories pointed out that tens of thousands of these children, when they tried to follow up and find out how they were doing, whether they were going to school, whether they were being trafficked or abused, there was no answer, and they took the position it was not their responsibility. So I look forward to working with you to find those children and to make sure that they're not being abused. Millions of Americans are experiencing mild to moderate mental health and substance abuse issues, yet many struggle with timely and effective access. Primary care physicians are most likely to be seeing these individuals as opposed to a specialist, and it makes it important that these individuals, primary care physicians, be trained in patient-centered care, which would strengthen the integration of behavioral health care with primary care services. Is this something that you are concerned about, something you'd be willing to work with us on in order to implement?
Yes, Senator. Let me just reassure you that President Trump has personally spoken to me about locating those 300,000 children who disappeared over the last 4 years.
I don't think anybody has a fully accurate number, but it's hundreds of thousands, I agree.
And many of them we know have been sex trafficked and childhood slavery, and it is a blight on America's moral authority, and we need to find those kids. In terms of addiction services and substance abuse services, this is a priority for me. It was a priority for me when I was running for president during my campaign. I was a heroin addict for 14 years. I've been 42 years in recovery. I go to 12-step meetings every day, so I hear the stories every day. And I hear the many stories about denial of, or the barriers to access to care. And we need to improve that. And answer specifically to your question, I think we can do that through GME, which is a program that is funded by HHS, that is the largest funder for medical school students. And that's one of the things for primary care physicians should understand addiction care. Addicts almost always go through a cycle where there is a moment where they hit periodic bottoms where they're ready to go into treatment. But it's fleeting and it's momentary. And we have that opportunity to save their lives. And then if we miss that little short window, they're off to the races again.
I appreciate your answer. Our time is short. Let me get to one more question that I think is very important. Under the first Trump administration, the number of people receiving HIV treatment in Africa through the President's Emergency Plan for AIDS Relief, otherwise known as PEPFAR, it increased, this is during the first Trump administration, from 13 million people to 18 million people across 50 countries, primarily in Africa. Africa has about 1.3 billion people today, or in 2021. It's projected to have 2.5 billion people by 2050, or 25% of the global population. In 2020, PEPFAR reported that 2.8 million babies were born without HIV. That was something that would not have happened but for the PEPFAR program. So it has simply been one of the most successful public health programs in the world and saved approximately 26 million lives. Failure to continue this program, in my view, would risk ceding that leadership to adversaries like China. And I'd like to know whether you support the objectives and goals of PEPFAR, and would you work with me and my colleagues to make sure that this program continues to provide life-saving antiviral drugs to people who are most in need?
I absolutely support PEPFAR, and I will happily work with you to strengthen the program.
Thank you. Senator Bennett.
Thank you, Mr. Chairman.
We do need to move on. Senator Warner.
Well, I got to tell you, for literally hundreds of thousands of Virginians, Medicaid is what prevents them from health crises on a daily and weekly basis. And some imaginary new plan, and if there was a new plan that was to be the basis of what Trump was going to do in repealing Obamacare, I would have thought by now we'd have seen it. I got to tell you, listen,
Senator, can I reply to that?
Senator, Mr. Kennedy, I got questions. I appreciate our visit. I know you take your views seriously, and I don't reflexively vote. I voted for 4 of President Trump's nominees already. Got a lot of grief from folks on this panel. But I got to tell you, I saw an email that you put out Monday night, or your campaign did, in a fundraising email. Your presidential campaign celebrated that the freeze on all new regulations, guidance, and announcements is a way to protect unelected bureaucrats from further undermining our health freedom. Then you ask your donors to help pay for your campaign debt. Did your campaign and you put out that?
I don't think my campaign exists anymore.
All right, well, listen, I got to tell you this. Somebody's out there soliciting money for it. Maybe you ought to find out who is. So the fact that you celebrate this freeze, do you think that was a good idea to put all of this on hold for 90 days? Funding and any kind of further work? NIH research?
As Chairman Crapo pointed out.
I'm not asking for, I love Mike Crapo. I'm asking you. You're up for a very important position.
As he pointed out, Senator, the portals that were closed were not closed as a result of the Trump administration.
Let me just tell you. I'd like you to explain, excuse me, sir. I'd like you to explain to a domestic violence center in Richmond that's saying because this freeze they may have to close down, where are those battered women to go? Or a rural nonprofit I've got in the Shenandoah Valley who's saying that freeze is going to potentially shut down their ability to operate. So I guess if you deny or don't know what your campaign's sending out, you don't know if you raised a lot of money Monday night.
I'm saying that the Trump administration
you don't know if you raised a lot of money.
The Trump administration has made clear that it does not want to freeze benefits for any Americans under Medicaid or Medicare, and I do not want to dismantle Medicaid.
The freeze is affecting beyond Medicare and Social Security. I would hope you would have known that to be able to answer some of this. Now, you've said publicly you want to immediately get rid of 600 NIH workers on job one, on day one. When we had our meeting, you said you'd actually like to get rid of 2,200 people from HHS. Which offices are you going to start cutting and riffing these 2,200 workers from?
Senator, there's 200 political appointees that are changed during every administration.
So if you got rid of those 200 political appointees, you're not going to replace them with your political appointees?
Well, President Biden this year changed 3,000 employees at HHS, 3,750 at NIH.
You're 2,200. What departments are you going to pick them from?
Well, the same as President Biden did when he changed 3,000 out.
Let me just, I'm down to a minute 30. The chairman's been generous with colleagues on both sides. I may have to go a couple minutes over. But let me just say, so let's just answer, this would be, I hope, since you're asking to become the top healthcare official in the United States in terms of HHS, huge ramifications, and part of this job is to be the senior advisor to the president on health issues. So when we're looking at this purge and we're looking at laying off workers, when we're looking at potentially the president's illegal offer to try to buy out federal employees, which I would say to any federal employees, think twice. Has this individual in his business world ever fulfilled his contracts or obligations to any workers in the past? But if you are in this position, will you pledge that you will not fire federal employees who work on food safety, work on trying to preventing things like salmonella?
Senator, there are 91,000 employees.
So that, I take that as that's a simple yes. And I'm going to take that as a no.
Run that
I take that as a no. Will you actually? We talked about protecting Americans from cyber criminals. Something we need to do a lot more on. Will you commit not to fire anyone in the health arena who currently works on protecting Americans from cyber attacks in their healthcare files?
I will commit to not firing anybody who's doing their job.
Based on your opinion, based upon your opinion, or your political agenda, or Mr. Trump's political agenda?
Based upon my opinion.
So I guess that means a lot of the folks who've had any type of views on vaccines will be out of work. Will you freeze grant funding for community health centers? Will you freeze federal funds for community health centers, the way the current administration has done?
The White House has made clear that no funds are going to be denied to any American for benefits in any program.
Do you know what happens at community health centers? Those are direct.
Are you talking about the Indian health centers?
No, I'm talking about community health centers across the country.
I understand that. I mean, I strongly
So you're going to excuse Indian health centers, which is good, but others are not. They're going to get their funds frozen.
I strongly support community health centers, as does the president.
So does that mean you're not going to freeze the funding that is currently frozen?
The White House has made clear that none of that funding is supposed to be frozen.
Sir, the direct payments are different than how the government operates. We fund the federal government down to community health centers. As a former governor, there's lots and lots of state programs that are related to health care that come from the federal government. They come down to the state, then it goes to local programs. All of those don't directly pay out $1 at a time, but they come from federal funding. They are all, even though they keep changing the guidance on a minute-by-minute basis, based upon 9:45 or 10:30 or 10:45, whatever time it is today, those funds are still frozen. Sir, I just honestly, I want to give you a fair shot, but I don't feel like you approach this job with the knowledge and candidly, your willingness not to commit, try to recommend to the president to make sure these funds are unfrozen and that people's lives are at stake is a very disappointing answer. Thank you, Mr. Chairman.
Senator Warren.
Thank you, Mr. Chairman. So, Mr. Kennedy, I want to start with something that I think you and I agree on, and that is that Big Pharma has too much power in Washington. You've said that President Trump asked you to, quote, clean up corruption and conflicts. Sounds great. You've said that you will, quote, slam shut the revolving door between government agencies and the companies they regulate. That also sounds great. So here's an easy question. Will you commit that when you leave this job, you will not accept compensation from a drug company, a medical device company, a hospital system, or a health insurer for at least 4 years, including as a lobbyist or a board member?
Can you just repeat the last part of the question? Can I commit
You're
to
not
what?
going to take money from drug companies in any way, shape, or form.
Who? Me?
Yes, you.
Oh. Yeah, I'm happy to commit to that.
Okay, good. That's what I figured. I said it's an easy question to start with. And I think you're right on this question.
I don't think any of them want to give me money, by the way.
Let's keep going. You're right because to say yes, because every American has the right to know that every decision you make as our #1 health officer is to help them and not to make money for yourself in the future. So I want to talk more about money. I'm looking at your paperwork right now. In the past 2 years, you've raked in $2.5 million from a law firm called Wisner Baum. You go online, you do commercials to encourage people to sign up with Wisner Baum to join lawsuits against vaccine makers. And for everyone who signs up, you personally get paid. And if they win their case, you get 10% of what they win. So if you bring in somebody who gets $10 million, you walk away with $1 million. Now, you just said that you want the American people to know you can't be bought. Your decisions won't depend on how much money you could make in the future. You won't go to work for a drug company after you leave HHS. But you and I both know there's another way to make money. So, Mr. Kennedy, will you also agree that you won't take any compensation from any lawsuits against drug companies while you are secretary and for 4 years afterwards?
Well, I'll certainly commit to that while I'm secretary. But I do want to clarify something because you're making me sound like a shill. I put together that case. I did the Science Day presentation to the judge on that case to get it into court.
Mr. Kennedy, it's just a really simple question.
Yeah,
You've taken in $2.5 million. I want to know if you will commit right now that not only will you not go to work for drug companies, you won't go to work suing the drug companies and taking your rake out of that while you're a secretary and for 4 years after. It's just
I'll commit to not taking any fees from drug companies while I'm secretary.
No, I'm asking about fees from suing drug companies. Will you agree not to do that?
You're asking me to not sue drug companies,
no,
and I'm not going to agree to that,
drug
Senator.
Companies as much as you want.
I'm not going to agree to not sue drug companies or anybody.
So let's do a quick count here of how, as Secretary of HHS, if you get confirmed, you could influence every one of those lawsuits. Well, let me start the list. You could publish your anti-vaccine conspiracies, but this time on U.S. government letterhead, something a jury might be impressed by. You could appoint people to the CDC vaccine panel who share your anti-vax views and let them do your dirty work. You could tell the CDC vaccine panel to remove a particular vaccine from the vaccine schedule. You could remove vaccines from special compensation programs, which would open up manufacturers to mass torts. You could make more injuries eligible for compensation even if there is no causal evidence. You could change vaccine court processes to make it easier to bring junk lawsuits. You could turn over FDA data to your friends at the law firm, and they could use it however it benefited them. You could change vaccine labeling. You could change vaccine information rules. You could change which claims are compensated in the vaccine injury compensation program. There's a lot of ways that you can influence those future lawsuits and pending lawsuits while you are Secretary of HHS. And I'm asking you to commit right now that you will not take a financial stake in every one of those lawsuits so that what you do as Secretary will also benefit you financially down the line.
I'll comply with all the ethical guidelines.
That's not the question. You and I, you have said
You're asking me, Senator, you're asking me not to sue vaccine pharmaceutical companies. Yeah, you are. That's exactly what you're doing.
Look, no one should be fooled here. As Secretary of HHS, Robert Kennedy will have the power to undercut vaccines and vaccine manufacturing across our country. And for all of his talk about follow the science and his promise that he won't interfere with those of us who want to vaccinate his kids, the bottom line is the same. Kennedy can kill off access to vaccines and make millions of dollars while he does it. Kids might die, but Robert Kennedy can keep cashing in.
Senator, I support vaccines. I support the childhood schedule. I will do that. The only thing I want is good science, and that's it.
How about then say you won't make money off what you do as Secretary of HHS?
Before we go to Senator Tillis, I think it would be important for me to make it very clear that Mr. Kennedy has gone through the same Office of Government Ethics process as every single other nominee in the Finance Committee this year and in previous administrations. In addition to listing his assets, including the items that you've identified, he has signed an ethics letter that has been reviewed by the Office of Government Ethics concerning any possible conflict in light of its functions and the nominee's proposed duties. And we have a letter from the Office of Government Ethics that he hasn't complied completely with all applicable laws and regulations governing conflicts of interest.
Mr. Chairman, point of information here. Have we had a single nominee come through who's made $2.5 million off suing one of the entities that it would be regulating and plans to keep getting a take of every lawsuit in the future? Have we had that before?
I haven't reviewed the past documentation of every other nominee's financial interests, and so no. But I know that every single time we get a nominee, their financial interests are attacked. That's why we have the Office of Government Ethics. That's why they've reviewed everything that's in his record, and that's why he has even, I think, and I don't know that I want to ask him to get into it, but he has listed his assets and has gone through a discussion of the responsibilities under our ethics laws and has complied with all of those requirements. Senator Tillis.
Thank you, Mr. Chairman. Mr. Kennedy,
Senator Lujan will be next, followed by Senator Marshall, Senator Warnock, Senator Smith, Senator Young, and Senator Welch.
And let me say again, Mr. Chairman, this is a matter of such importance. A number of my colleagues would like a second round, and I think it would be important to offer, say, a modest amount of additional time to get into this on both sides. I know I have some questions, but I want my colleagues to have the opportunity to raise their concerns as well.
Well, I've said, as I have indicated to you, Senator Wyden, I'm not going to do a second round. I have been very generous with the senators. I think almost every single senator has had 7 minutes at least. And I will give you a second, as is our practice between the two of us.
I'll then divide my time up with my colleagues.
Okay, you are welcome to do that.
Thank you.
Senator Lujan.
Thank you, Mr. Chairman. Mr. Kennedy, when we met, you stated to me that it is not your goal to take away programs that work for Americans. Do you stand by that statement?
Yes, Senator.
Mr. Kennedy, do you know how many Americans rely on Medicaid?
About 72 million plus the 7 million kids who are on chips.
Appreciate that, 72 million. Yes or no, is it important that expectant mothers and newborns have access to health coverage? Is it important that expectant mothers and newborns have access to health coverage?
Absolutely, Senator.
Mr. Kennedy, do you know how many babies born in this country are covered through Medicaid?
I would guess, I don't know the answer, I would guess about 30 million.
I have it, Mr. Kennedy. About 41% or 1.4 million babies births are financed by Medicaid, according to the National Center for Health Statistics. Yes or no, do you believe that Medicaid is a critical program?
I believe that Medicaid is a critical program, but that it's not working as well as it ought to be. And President Trump has asked me to make it work better, that most Americans are not happy with it. The premiums are too high, the deductibles are too high, and everybody's getting sicker. Too much money is going to the insurance industry.
I have a series of yes or no questions. They're pretty simple. Because you heard we're not going to get a second round of questions, I ask for your indulgence to be able to get through them yes or no. In New Mexico, as you know, Medicaid is often measured state by state. It might surprise you if you look at some of those surveys. In New Mexico, the response was 90% of New Mexicans on Medicaid report satisfaction getting care, 80% getting specialist care, 85% getting urgent care, 95% ease of filings out of focus. Not to pick on any one of my colleagues, but in Louisiana, 86% of people on Medicaid are satisfied with their interactions. 83% are satisfied getting care. 85% are satisfied getting specialized care. 82% getting urgent care. I can go on state by state, but we don't have the time today. Yes or no, do you support cutting Medicaid or reducing, and especially in an area where you and I spoke about with the federal investment in Medicaid, which is known as FMAP?
President Trump has not told me to that he wants to cut Medicaid. He's told me to make it better.
Do you support cutting, yes or no? Let me ask you this way, since it's only about President Trump.
I support making it better, Senator.
If President Trump asked you to cut Medicaid, will you do it?
Oh, it's not up to me to cut Medicaid. It would be up to Congress. And
you don't
I'm going to work. I'm going to work.
Mr. Kennedy, you don't want to answer? I'll move on. Do you know how many states will end? Mr. Chairman, if I may pause my time. So I understand that people are getting asked to leave if they stand up with signs, but there's a lot of other as well, Mr. Chairman. So it needs to be extended to everyone. As Mr. Kennedy said, we should respect each other when we have a difference of opinion. We're just trying to do our jobs here and trying to ask questions. That's all. And that's all I'm doing with Mr. Kennedy, folks. So I just hope that we can
Senator Lujan, you are right, and I ask the audience to please be respectful.
Thank you, Mr. Chairman. I appreciate that very much. Mr. Kennedy, do you know how many states will end their Medicaid expansion if the federal share of Medicaid drops?
Well, there's 40 states that have signed on to the expansion. So,
it's a smaller number. So it's 9 states would quickly have to end their expansion because of the laws that they have. That's about 4 million folks across the country. And in New Mexico, Iowa, and Idaho, they have triggers that it would immediately have to go into effect if, in fact, that gets cut. The reason I'm asking those questions is there's been a lot of chatter and conversations around Medicaid. Now, I agree we can always do better, and we must be doing better in America. But Medicaid has been shown to improve health outcomes, including mortality, quality of life, and access to preventative care as well. And there's some areas, Mr. Kennedy, that you and I touched on specific to Native American communities. One of the concerns that I have are these programs matter to folks. You shared your passion about caring for folks. I believed that passion. My question in this area is, as you know, when folks are doing research and they're going to check to see if medicine works on someone, if they're not included in that trial, it often doesn't help them. That's what all the evidence shows. So what are you going to do when programs are eliminated to require the inclusion of Native Americans in clinical trials when it comes to life-saving medicine?
I'm going to do everything I can to make sure that there's Native Americans in clinical trials. As I said to you when I visited your office, I spent 20% of my career working on Native issues. My family's been deeply involved with them. My father and uncle were big critics of the Indian Health Service, the failure to deliver good health results or health care on the reservations. I'm going to bring a Native in for the first time in history into my central office, that all the major decisions in my office will be that he will have it. We've already interviewed a candidate, a very, very good candidate, will have direct impact on all the major offices. One of my priorities is to improve.
I appreciate that. I have a follow-up in that space specifically. Will you commit to finalizing the congressionally mandated FDA guidance to increase clinical trial diversity?
Just repeat that again. I'm sorry.
Will you commit to finalizing the congressionally mandated FDA guidance to increasing clinical trial diversity?
Yes.
I appreciate that. Will you commit to reinstating all of the pages that were eliminated and people that were fired from this administration that have this responsibility?
I cannot commit to that because I don't know who they are.
Well, there's
I'll
some
commit
folks out
to
there
working with you to make sure
Kennedy,
those positions are adequately staffed.
I will follow up in writing in those specific areas because I think there's some commonality here, but answers matter. And so I'd like to get those as timely as possible. The last thing, Mr. Chairman, that I'll say is one of the conversations I had last before this hearing was with a family that I've been working with to work with my Republican colleagues when it comes to autism and federal programs and making a difference in these families' lives and this little girl's life. What I'm asking now, Mr. Chairman, is unanimous consent to enter into the record an article from Autism Speaks titled, quote, "Do Vaccines Cause Autism?" End quote. And I'll note that the first sentence states, quote, "Vaccines do not cause autism," end quote. Thank you. I yield back.
Without objection. And before we move on, we've had a request from several quarters for a quick restroom break. We will take a 5-minute recess. I'm sorry to those remaining 5 or 6 senators who must wait a few minutes. Senator Warnock.
Thank you so much, Chairman Crapo and Ranking Member Wyden. It's great to be here. Mr. Kennedy, welcome. Welcome to you and to your family. Thank you for meeting with me a few days ago. I'd like to follow up, if I might, with some of the issues that we discussed in my office. I want to talk to you first about the CDC, or the Centers for Disease Control and Prevention. I'm proud of the work that the CDC does, proud that it's located in Georgia with more than 10,000 employees in my state. If confirmed, you would be the cabinet secretary over the CDC. Representing HHS, it's about 29% of the federal budget. CDC is a part of that. Do you agree that the CDC's work is critical to Georgia, critical for our country, and the health of the entire world?
Yes, Senator.
Senator Isaacson, my Republican predecessor, would have agreed with that. Bless his memory. He was a fierce advocate for the CDC, as am I. The CDC is an agency filled with hard-working, dedicated public health servants. They wake up every single day working to keep us safe. I think we don't think often enough about their work because it's easy not to celebrate the folks who are protecting you from that which doesn't appear because of the work that they're doing. So grateful for the work that the CDC employees do. Some of them are members of my church. I saw that deep commitment firsthand when I visited the CDC just last summer. Mr. Kennedy, you have compared the CDC's work to Nazi death camps. You've compared it to sexual abusers in the Catholic Church. You've also said that many of them belong, this is a direct quote, many of them belong in jail. For me, those are disturbing characterizations of the CDC workers that I know who are trying to keep the American public safe every single day. And as you are presented as the nominee for this position, I need to know, do you stand by those statements that you made in the past, or do you retract those previous statements?
Senator, I don't believe that I ever compared the CDC to Nazi death camps. I support the CDC. My job is not to dismantle or harm the CDC. My job is to empower the scientists if I'm privileged to be confirmed.
So you retract those statements?
I'm not retracting it. I never said it.
Well, actually, I have a transcript
of me saying that it's a Nazi death camp.
Yeah, let me read your words. It says that the institution CDC and the vaccine program, is your description of their work, is more important than the children that it's supposed to protect. And you know, it's the same reason we had a pedophile scandal in the Catholic Church. It's because people were able to convince themselves that the institution of the church was more important than these little boys and girls who were being raped. That's pretty provocative language. You said in another statement to me, this is like Nazi death camp. I mean, let me finish. I'm just reading your words. I mean, what happened to these kids? 1 in 31 boys in this country, their minds are being robbed from them.
Yeah, I was not comparing the CDC to Nazi death camps. I was comparing the injury rate to our children to other atrocities. And I wouldn't compare, of course, the CDC to Nazi death camps to the extent that any statement that I made has been interpreted that way. Yeah, I don't agree with that. In 2003, the United States Congress Government Oversight Committee ended an over a year investigation of the CDC and used almost that same language. They said that the CDC, just one division, one branch, the Immunization Safety Office, had put institutional self-interest and pharmaceutical profits ahead of the welfare and the health of American children. So that was a conclusion by Congress. And I repeated that.
I'm asking you because you're the nominee for HHS. It sounds like you stand by those statements.
Senator, my objective is to support the CDC. There's nothing I'm going to do that is going to harm CDC. I want to make sure that our science is gold standard science, and it's free from that same Government Oversight Investigation Committee found that the panels, the ACIP panel within CDC, I think 97% of the people on it had conflicts. I don't believe that that's right. I think we need to end those conflicts and make sure that scientists are doing unobstructed science.
So I want to enter this statement, by the way, into the record without objection.
Without objection.
Last week, the White House gagged HHS and the CDC, preventing them from communicating all important public health information to anyone, including all of our allies, including our allies in the United States and global disease prevention. Can you just answer yes or no, because I'm running out of time? Do you agree with that action?
I was not consulted on it, but that's pretty much standard operating procedure for incoming administration.
So you agree with the action that gagged HHS and CDC from communicating important public health information to the public?
That directive made sure that no public health, that only non-essential travel and mass communications were temporarily suspended pending the confirmation of a new HHS secretary. This is standard operating procedure for every administration.
I get it. I don't think what we've seen over the last several days is standard operation for new administrations. I think we're seeing some unprecedented actions, but you agree with it. Last night, members of the CDC, along with other federal employees, were actually invited to resign, these buyouts. And I got text messages and folks I know work from the CDC, for the CDC, that do this important work. who got that note. And it's really important because my experience is that when you send out that kind of note, the folks who resign are the folks who you least likely want to see resign. They got other options. They're gifted folks. They got a lot of expertise. They have options. A lot of them are doing this work because of their patriotism, because of their commitment. Do you agree with the buyouts that were presented to CDC employees just last night?
I agree. At the vast majority of the scientists and experts at CDC are patriots and good government servants.
Can you tell me yes or no?
I don't think anybody's going to resign who's committed to making America healthy
again. Can you just answer yes? Okay, you agree with the buyouts. In our meeting, I asked you to confirm your support for the Affordable Care Act. You also mentioned that you and President Trump want to fix the ACA by making premiums more affordable. Can you answer me yes or no, as I don't have a lot of time? Did you know that tax credits that help families afford health insurance and save Georgians an average of $531 per month per person are set to expire at the end of the year? Did you know that?
I do.
We need to move on.
Do you support Congress extending these tax credits so that Americans can continue to afford health care?
Congress has to make its own decisions about that. My instructions from President
Chairman,
Trump
you're saying I'm running out of time, but I'm having a lot of trouble getting the witness to answer yes or no to a yes or no question.
Well,
and I've got one more question.
You're almost at 9 minutes, sir.
Well, I need him to answer yes or no. Yes or no?
I'm not going to answer yes or no to a question that's not susceptible to an honest yes or no answer.
Okay,
we need to move on.
I think that the fact that you find it difficult to answer basic questions is deeply troubling for me as you present yourself as a nominee to run HHS. Thank you so very much.
Senator Smith.
I've been in courts all over the country. And prosecutors.
Mr. Chairman, you told me I'm out of time, and the witness continues to filibuster even after I said I'm done.
Senator Smith.
Mr. Chair, thank you. Thank you, Mr. Chair and Ranking Member, and welcome, Mr. Kennedy. So, Mr. Kennedy, I don't.
It's all over the country. And prosecutors.
Mr. Chairman, you told me I'm out of time, and the witness continues to filibuster even after I said I'm done.
Senator Smith.
Mr. Chair, thank you. Thank you, Mr. Chair and Ranking Member, and welcome, Mr. Kennedy. So, Mr. Kennedy, I don't have a question for you on abortion. I think that my colleagues on both sides of the aisle have covered this, but I want to say I can respect people who have different views than mine on this issue, but it's hard for me to respect people who won't give a straight answer to what they think on this issue in particular. Mr. Chair, I just want to note that I understand that anti-choice advocates have said that in these hearings they were looking to hear Mr. Kennedy provide some reassurance that he is on their side, and I'm not hearing that. And I think most Americans are looking for some hint that the decisions that people make about abortion should be personal and private, and they should be free to make those decisions without government interference, and I'm not hearing that either. To make it worse, the answers that you have given tell me that the Trump administration is more than willing to restrict or even ban medication abortion without a single act of Congress, and even in states where abortion is legal. And what is clear to me is that you and President Trump are dangerous to women's access to mifepristone. So having said that, I want to move to a different topic. Mr. Kennedy, I appreciate Senator Cornyn's questions about mental and behavioral health, something that I care a lot about. I know that you and your family have had personal experience with mental health challenges, as have I. And I agree that the mental health crisis in this country is a crisis. So let me ask you, in an interview in 2023 and again in 2024, you blamed school shootings on antidepressants. You said, and this is a quote, "There is no time in American history or human history that kids were going to shoot schools and shooting their classmates. It really started happening coterminous with the introduction of these drugs, with Prozac and with other drugs." So do you believe, as you've said, that antidepressants caused school shootings? This should be a simple question.
I don't think anybody can answer that question, and I didn't answer that question. I said it should be studied. I said it should be studied along with other potential culprits like
so they may cause
social media But I don't know. I would never make, because there's no science on that.
Well,
Senator.
there is, Senator. I mean, excuse me. There is, Mr. Kennedy.
Thank you for the promotion.
The science shows that there is no link between school shootings and antidepressants, and in fact, most school shooters were not even treated with antidepressants, and of those that were, there was no evidence of association. You know,
I don't think you
my
can
question
say that,
is,
Senator, because of HIPAA rules, nobody knows.
well, that is, Mr. Kennedy. Do you think that people who take antidepressants are dangerous?
I think, listen, I'm not going into HHS if I'm privileged to be confirmed with any.
So you can't say that people
to impose any preconceived ideas that I may have. I just want to have good science.
So you're not saying that they aren't dangerous, which means that they could be dangerous. Let me ask you this.
That's not true.
You've described Americans who take mental health medications as addicts who need to be sent to wellness farms to recover. Is that what you believe?
No, of course I didn't say that anybody should be compelled to do anything.
No, but you said they should be sent.
I said they should be available to them. I didn't say they should be sent.
You said that folks that take antidepressants are like addicts. That I can provide that,
Oh, I think
Chair.
they should have the availability. Listen, I know people, including members of my family, who've had a much worse time getting off of SSRIs than they did than people have getting off of heroin. It's the withdrawal period is, I mean, and it's written on the label.
I have some experience with this myself, Mr. Kennedy. This is personal for me. When I was a young woman and I was struggling with depression, thankfully, I had the resources to help me get through it, including a new generation of SSRI uptake inhibitors, which helped to clear my mind, get me back on track to being a mom and a wife and a productive, happy person. And I'm really grateful for that therapy. So I have some experience with this, and I think that everyone should have access to that care. And your job as secretary is to expand access to care, not to spread lies and misinformation. And, you know, the things that you say, Mr. Kennedy, they live on. They have impact. And, you know, we're having this conversation at the same moment that my Republican colleagues are looking to try to figure out how to save money any way they can. And so they want to cut Medicaid. Let's just think about this for a minute, because you're going to be, should you be confirmed, you would be responsible for CMS, which provides mental and behavioral health care to millions of Americans. Close to 40% of folks on Medicaid have a behavioral health condition. And you would be part of this administration that would be looking to cut Medicaid. So, Mr. Kennedy, these statements that you've made linking antidepressants to school shootings, they reinforce the stigma that people who experience mental health every day face every single day. And I'm very concerned that this is another example of your record of sharing false and misleading information that actually really hurts people.
Senator, you're mischaracterizing my statements.
I am only putting into the record what you have said, Mr. Kennedy.
You're mischaracterizing my statements, and I'm happy that you had a good experience on SSRIs. Many Americans have very good experience on it. Others have not.
That would be an issue between them and their physicians, and not for the future head of HHS to be putting out misinformation about the dangers of SSRIs and other antidepressant medication, spreading the stigma and the fear that we're actually trying to overcome.
Do you think physicians, when they make that prescription, ought to have access to good science?
Of course they do. And
that's all I believe, too. And you and I are in agreement, Senator.
And to your point that you made when you made these statements, it was not based on good science. I don't know what it was based on.
I was saying the science needed to be done. I was saying these are potential culprits. We're coterminous, and I named other things. I said video games. I said social media. I said SSRIs. SSRIs have a black box warning of homicidal behavior.
Mr. Chair, I will submit to the chair the information that I have about what Mr. Kennedy has said of linking antidepressants to school shootings. Thank you.
Senator Whitehouse.
Thank you, Chairman. Mr. Kennedy, I only have 5 minutes with you, and I've got a lot of experience with CMS, so you're just going to have to listen. 2 things. One, if you want to move from advocacy to public responsibility, Americans are going to need to hear a clear and trustworthy recantation of what you have said on vaccinations, including a promise from you never to say vaccines aren't medically safe when they in fact are, and making indisputably clear that you support mandatory vaccinations against diseases where that will keep people safe. You're in that hole pretty deep. We've just had a measles case in Rhode Island, the first since 2013, and frankly, you frighten people. 2, I want to air harms that Rhode Island has experienced from a remorseless, senseless CMS bureaucracy. CMS has for years maintained a reimbursement system that the bureaucracy could never explain, never justify, that persistently pays Rhode Island providers less than neighboring Massachusetts and Connecticut providers, a differential of 23 and 26% in our regional healthcare market. The Pending Ahead program can begin to remedy this, at least for value-based care, and it must. There has to be payment parity in the region. Rhode Island's healthcare system is bleeding out because we aren't paid what neighboring hospitals and doctors are paid, and the one act CMS took on this years ago was to make it worse. The CMS bureaucracy has also attacked one of the best accountable care organizations in the country, Rhode Island's Integra Family Doctors. Tried to throw them off the shared savings program because they said Integra years ago briefly fell 137 patients short of the 5,000 patients that ACOs need. CMS wouldn't listen until a court found that to be unjustified, likely illegal, irreparable harm to this high-performing ACO and its patients, and contrary to the public interest. That must stop. Last, CMS has refused to approve waivers granted elsewhere for Rhode Island from rules that are stupid for Medicare patients who are nearing the end of their days. Here's what families see. Granny is home dying. She needs to transfer to a nursing home, and Medicare insists on putting her 3 days and 2 nights in a hospital. Expensive, frightening to Granny and the family, and stupid. Granny's home dying and can't get palliative and curative care together. Inhumane and stupid. Granny's home dying and can't get home care if she can still get out into the yard or be driven to see the shore, to see Narragansett Beach, say, one more time, to recall childhood memories before she dies. Inhumane and stupid. Granny's home dying and the family's exhausted. And the respite care benefit is not to send a nurse or a caregiver, but to stuff Granny in an ambulance and haul her off to a hospital. Some respite. It's all expensive, frightening, inhumane, and stupid. But the insensate CMS bureaucracy takes a court order to be awakened to the harm they cause. I have had enough. CMS should let Rhode Island try humane end-of-life care through CMMI. Let's see if it works at a state. I bet it will save money, serve families better at a very, very delicate time, and perhaps even make a model for better health care everywhere. I've said a lot. My time is out. You're welcome to respond in writing. I ask unanimous consent that the order declaring CMS's actions to constitute irreparable and illegal harm be put into the record.
Without objection.
Let me just respond very briefly, Senator Whitehouse. I'm an implacable enemy of tyrannical, insensate bureaucracies and stupid rules, and I will work with you to make CMS responsive to the needs of Rhode Island and to remedy those disparities that you talk about. I am familiar with the Integra Health plan, and it is the template for what we ought to be doing is a value-based plan. And I look forward to you to making sure that we create pilot programs like this.
Unfortunately, Mr. Chairman,
around the country.
Unfortunately, Mr. Chairman, one of the things I've learned in my tenure in the Senate is that a nominee saying that they're willing to work with me amounts to exactly zero. We need to get this fixed. Thank you.
Well, I guess at that point, then we will move on to Senator Daines.
Mr. Chairman.
Wyden, 5 more minutes?
To be divided 1 minute with my colleagues getting 1 minute.
And then if we can do that, we can get over to vote before they call the vote on the floor.
Thank you very much. Thank you, Mr. Kennedy. And as you know, I'm have great reverence for your family from Massachusetts. When I got out of college, I was in the first class of Robert Kennedy Fellows, the memorial created by your family to honor the service of your father. I do community organizing in the west side of Chicago. And I certainly admire your energy in your effort here and desire to serve. You know, there's a couple of things that are really important here. This is not just about a debate on vaccines. It's a debate about the qualifications, experience, and priorities as to the person that will head Health and Human Services. And it's not just about what your answers are today or what the questions are. It obviously has a lot to do with your whole record and your whole history. You know, your sister in her letter, or pardon me, your cousin in her letter said, you've always been charismatic, able to attract others through the strength of your personality, willingness to take risk and break rules. That's, I guess, an attribute, but it can be a danger. The question I fundamentally have is whether your willingness to disrupt and maybe break rules is going to be dangerous and destructive. The character questions we didn't go into here, but there's some sketchy things you've acknowledged. Your history with heroin, you've gotten over that. But there's incidents that do, I think, concern the question of whether the stability is there to be in charge of this major organization. And that's compounded by my concern that you don't have any experience managing a large organization, that you don't have any experience in government. So those are things that have to be taken into account. But the issue for me is also priorities. A lot of your engagement in health has been on vaccines, big important issue. You actually disagreed, as I understand it, with President Trump about Operation Warp Speed. I think President Trump deserves a lot of credit for Operation Warp Speed. He knew we had to get a vaccine. And these other issues about a mask and whether you should wear it, whether when you got your groceries, the bag had to be left outside, remember that in the very beginning? Those are incidental to the core question that the president believed we had to have a vaccine, and you contested that. That worries me. That really deeply worries me. The other questions, Senator Cassidy asked you some questions about our healthcare system. I happen to believe that our healthcare system is profoundly broken, and it's not just about the chronic illnesses. That's about our diet, that's about our exercise. But we are getting premium increases in Vermont of 20% a year, 25% a year. And it's busting the bank for taxpayers. It's busting the bank for our wonderful Vermont employers who care about having health insurance that they can provide to their employees. Senator Cassidy asked you a couple of questions about how you would reform Medicaid. And I didn't hear an answer. You mentioned that you thought Medicare Advantage was good. You have a good plan. No focus on what an incredible ripoff was reported in the Wall Street Journal by United Healthcare, which was marketing Medicare Advantage and then paying doctors and nurses where they had assignments essentially to diagnose illnesses that didn't exist. So they made billions and billions of dollars. And I've seen nothing coming out of the Trump administration, and I've seen nothing coming out of your advocacy that is going after what is a rampant abuse by the insurance companies and overcharging people and not doing the job. And by the way, the United Healthcare people, when they did that, they overdiagnosed. When the person really got sick, they dumped them. They dumped them. Go to the nursing home on your own. That's a broken healthcare system. We spend the most and get the least. And I think there should be collective anger about this on both sides, because all of our people are dependent on that healthcare system. And you're going to be working for a president who's on a lawless rampage right now, okay? He has done something reckless with the pardons to these cop beaters. I'm appalled by that. But that's just reckless. That's not illegal. He's impounded money. So right now, the Medicaid website went down. He's impounded money. So the community health centers that Senator Warner was talking about are up in the air as to what they can do. Do you believe that a president can impound money that has been appropriated by Congress?
Senator, let me answer the question about Medicare first. I have never defended that program or the rapacious behavior by insurance companies or the PBMs. I understand that's a huge problem. And
all right, I don't have time. We've got to get over to vote. So we can do this.
But you've asked me 5 questions. You got to give me a chance to answer one of them.
Please be brief.
Yeah, I brought in, if I get confirmed, I've already appointed a general counsel. The first time in history, he's a former prosecutor who prosecuted the biggest Medicare fraud in the case in the state of West Virginia. I brought in a prosecutor for that job instead of a bureaucrat, precisely to address the important issues that you raised here. The only reason I didn't talk about these before is because I wasn't asked about them.
What about,
I agree with you 100%.
Right, what about impounding, a president impounding money that, among other things, goes to health care?
And you're saying that that's illegal?
That's correct.
Well, my job is to uphold the Constitution. I'm going to take an oath to uphold the Constitution, and I will administer the law and uphold the Constitution.
Mr. Chairman, I believe under what we've discussed, I control 5 minutes. I'm going to take one and give one to.
Let me just say this in conclusion, Chairman Cassidy. President Trump and Mr. Kennedy are quite right when they say that our system is broken. They're right. Our economic system today is broken. 3 people own more wealth than the bottom half of American society. Wages have been stagnant for American workers for 50 years. The economy is broken. You know what? Our political system is broken and corrupt. You have a handful of billionaires in both political parties who contribute huge amounts of money to elect candidates in this room throughout the United States Congress. That is a broken political system and a real threat to democracy. Our healthcare system is broken. And it's broken for some of the reasons that Mr. Kennedy indicated. We have not paid attention to the fact that we have massive amounts of chronic disease. We have not answered the question why in the richest country in the history of the world, our life expectancy is lower than it is in countries far poorer than we are. So I think in many ways, President Trump and Mr. Kennedy have asked some of the right questions. Problem is their answers will only make a bad situation worse. So let me ask Mr. Kennedy again. If we want to make America healthy, will you assure the American people that you will fight to do what every other major country on earth does, guarantee health care to every single American?
I'm going to make America healthier than other countries in the world right now.
Will you guarantee do what every other major country does? That's a simple question.
And by the way, Bernie, The problem of corruption is not just in the federal agencies, it's in Congress too. Almost all the members of this panel are accepting, including yourself, are accepting millions of dollars from the pharmaceutical industry.
Oh, no,
and
no,
protecting
no, no,
their
no.
interests.
Oh, I thought that would come. No. I ran for president like you. I got millions and millions of contributions. They did not come from the executives, not one nickel of PAC money from the pharmaceutical industry. They came from workers.
In 2020, you were the single largest
because I had
receiver of pharmaceutical money.
Contributions from workers all over this country. Workers,
you were the
not a nickel from corporate PACs.
You were the single largest acceptor of pharmaceutical dollars.
No, from workers in the industry.
1.5 million.
Yeah, out of 200 million. All right, but you have not answered, last question. You have not answered my question.
Mr. Chairman, we're 3 minutes.
How do
we make America healthy if you don't guarantee health care?
Chairman, we're literally 3 minutes over here now.
Well,
how long does it keep going? At some time, you're just battering the witness, Bernie.
Not battering the witness.
Yes, you are. And you're getting upset at him. You're going at him just like anybody else would.
We'll come to order. Bernie's going over.
Brooks.
Sorry. Good morning. Thank you, Mr. Chair. Mr. Kennedy, I was struck by your comments during our meeting last week.
What?
I was struck by your comments in our meeting last week where you made it abundantly clear to me that you intended to clean house of the professional scientist at the National Institutes of Health, which you know is headquartered in the state of Maryland and employs thousands of hardworking Marylanders. I, for the record, believe in scientists and I believe in doctors and I trust them over politicians without medical degrees. You talked about bad science and bad scientists, and in fact, you specifically said to me in response to my question that you intend to replace the bad scientist with the good scientist. And so I want to ask you, in your opinion, what makes a scientist or a doctor qualified to serve at the National Institutes of Health?
A scientist who's devoted to empirical methodology, to evidence-based science, scientists who understand the importance of replication, the importance of publishing raw data and being open and transparent about it, the importance of publishing peer review. We have, NIH has overseen over the past several years the precipitous decline in American health. There's 91,000 people at HHS. And are you suggesting that some of them should not be held responsible for that decline? They were in charge of protecting our health.
Let me just insert here.
Let me just finish.
But let me just say this, because I only have 3 minutes left. I don't set the rules here, but I ask the questions. And the question is really whether you intend, as you said, to substitute essentially your judgment for the judgment of these professional scientists. And
I'm not going to substitute my judgment for science. Of course, I'm not going to do that. What I'm going to do, listen, the New York Times just did an article last week talking about the fraud, the 20-year fraud, 800 fraudulent studies produced by NIH on amyloid plaques and not allowing any other hypothesis about the cause of Alzheimer's.
Well, how will you decide, Mr. Kennedy, which scientists are bad scientists? Are they the ones who disagree with you?
The ones who are corrupt, the ones who have been doing science like the amyloid plaque studies that were fraudulent.
Well, these doctors, let me ask you a question. Do you have a medical degree?
Do I? No.
Okay, let me go to the next question. The Heritage Fund has compiled a watch list of federal employees to go after federal staff. Is there a watch list for federal staff at HHS?
Not that I know of.
Have you or has anyone in the administration developed a list of career scientists or federal staff that you would target for termination?
Not that I know of.
And let me just ask you another question. Now, your failed presidential campaign has been raising money to try and cover your debts. And you were questioned about this yesterday and failed to answer a question that Senator Warren asked you. And so I want to ask you again regarding these emails that you have sent to raise money. How much has your presidential campaign made fundraising off of this administration's complete disregard for the workforce at HHS?
Excuse me? I didn't hear the question. The last part.
How much money has your presidential campaign made off of fundraising, off of this administration's complete disregard for the workforce at HHS?
Zero.
Okay, Mr. Chair, I'd like to ask unanimous consent to enter into the record 2 emails from this week and the week before regarding fundraising that you are currently doing through your presidential campaign.
Without objection.
And finally, I want to ask you, I have you said you were on a show on February 26, 2021, an interview with Dr. Judy Mikovits, where you said the following, and I quote, "We should not be giving Black people the same vaccine schedule that's given to whites because their immune system is better than ours." Can you please explain what you meant?
There's a series of studies, I think most of them by Poland, that show that to particular antigens that Blacks have a much stronger reaction. There's differences in reaction to different products by different races.
So I have 17 seconds left. Let me just ask you then. So what different vaccine schedule would you say I should have received? What different vaccine schedule should I have received?
I mean, the Poland article suggests that Blacks need fewer antigens than...
This is
so
dangerous.
You get the same measles vaccine.
Mr. Kennedy, with all due respect, that is so dangerous. Your voice would be a voice that parents would listen to. That is so dangerous. I will be voting against your nomination because your views are dangerous to our state and to our country.
I mean, do you think science is dangerous, Senator? This is published, peer-reviewed studies.
I yield.
Senator King.
Thank you, Mr. Chair, and congratulations on your nomination, Mr. Kennedy. I enjoyed our conversation. Thank you for starting off today acknowledging the pain felt by people in this region from this horrible air tragedy last night. Senator Marshall and Senator Moran, a lot of folks from Kansas, a lot of folks from Virginia, D.C., Maryland, but also when that passenger list comes out and when the 3 soldiers' names are revealed, every office here is going to have some connection to them because you have your staffs who live here, and we kind of dread seeing that list of names. I drove to the airport at 6:30 this morning and went across the bridge over the Potomac and saw the operation, the recovery operation, kind of underway in daylight hours. And I thought about the last big aviation disaster in Richmond when on 9/11 a plane slammed into the Pentagon. And Virginia got hurt very bad that day, and so did the nation. Just a couple of months ago, you posted this on your X account. On 9/11, it's hard to tell what is conspiracy theory and what isn't. I'd like to introduce that for the record, Mr. Chair. We take that kind of stuff pretty personally. Virginians know what happened on 9/11. We don't need folks giving oxygen to conspiracy theories about 9/11. Now, one thing I noticed about this post is it was in July of 2024. It was 23 years after 9/11. You had a lot going on in your life. You were running for president then. What made you decide in the midst of everything going on in this country, in this world in July of 2024 and your own candidacy for president, that now was the time to say it's hard to tell what is conspiracy and what isn't about 9/11? What was so important about making this point in July of 2024?
Senator, the dramatic drop in trust in our government, and this is particularly one of the templates for that is what happened at CDC.
Yeah, no, I want to move aside from that. Because you say, you go on to say, I won't take sides. As president, I won't take sides on 9/11. Wow. I won't take sides on 9/11. Let me ask you this. As a general matter, do you find it hard to tell what is a conspiracy theory and what isn't? Is that kind of a general deficit that you find in your own analytical abilities?
My father told me when I was 13 years old, he said, people in authority lie, and that the job of a citizen in every democracy is to maintain a fierce skepticism.
Okay, I get it.
Government authority.
And you're an authority, but you wouldn't take sides on 9/11, and you're admitting, I have a hard time telling what is a conspiracy theory and what isn't.
Senator, I haven't investigated it. If the things that I investigate, I take sides on. People are allowed to hold that opinion. I'm not going to tell them they're crazy for holding that opinion. I'm going to say, what is your evidence? And if I hear the evidence, I'm going to say that doesn't make any sense.
So you won't take sides on 9/11. Wow. Senator Murray asked you some questions about Gardasil, and this is a vaccine that's manufactured in Virginia. There's other HPV vaccines. I'm going to enter into the record a whole series of studies from many, many nations that talk about the dramatic positive effect of Gardasil. Could I introduce those into the record, Mr. Chair?
Without objection. And those studies are on trial
let me ask
right
a question.
now.
Let me ask a question. These are studies from Scotland, Sweden, the UK, Australia, the United States, multiple studies. And then I'm going to introduce in the record, I guess it's a blog post of yours. The verdict is now inescapable. Gardasil is killing girls. And I'd like to introduce that into the record as well.
Without objection.
You have a pretty significant financial interest in litigation against Gardasil. You have received contingency fees and payments for referring people to lawyers suing the manufacturer. And in your ethics vetting...
I've never received any money from any Gardasil or any other vaccine lawsuit.
Let me read a quote. This is your words. In your ethics vetting for this nomination, you said, quote, "Pursuant to the referral agreement, I'm entitled to receive 10% of fees awarded in contingency cases referred to the firm. How can folks who need to have confidence in federal vaccine programs trust you to be independent and science-based when you stand to gain significant funding if lawsuits against vaccine manufacturers are successful?"
I have given away all of my rights to any fees in that lawsuit.
I yield back.
Next is Senator Scott.
Thank you, Mr. Chairman. Mr. Kennedy, good to see you again. Thank you for being here before the committee. Yeah. One of the beauties of our country is we have foundational documents that point us in the right direction. I think it's the compass that shows us due north, true north. The Declaration of Independence mentions life, liberty, and the pursuit of happiness as unalienable rights. You and I had a serious conversation about the importance of life, and I'm a pro-life Christian, as you know. And you said that you assured me that your deputies were going to be pro-life. Is that still the case?
I will implement President Trump's policies. I serve at his pleasure, but I share President Trump's view that every abortion is a tragedy.
Now, my question was, are you having deputies within at HHS that will be pro-life?
As I said, I can tell you exactly what I'm going to do, so there's no mistake. I'm going to implement President Trump's policies. President Trump has told me he wants to end late-term abortion.
Are you hiring people who are pro-life at HHS?
Yes, I am.
Thank you. During the first Trump administration, HHS began investing in policies to support individuals living with sickle cell anemia. This has continued. A career staff person has dedicated time to coordinate sickle cell disease-related activities across HHS and other government agencies. Will you commit to continuing to have an individual serve in this coordinating role for sickle cell?
Yes, and I think I've worked on sickle cell for many, many years. I told you I have many friends who have sickle cell. Several of them, I've seen the suffering that they endure. 1 out of every 365 blacks in our country has sickle cell. There are now promising gene therapies. They're very, very expensive. But it's something that NIH should be enthusiastically supporting that kind of research.
Well, you answered my second question, so that's great, which was today you noticed the FDA gene therapies are really breakthrough evolutions in science that are really one-time cures. So you support the continuation of the research that makes that more available?
Absolutely, Senator.
Thank you. That's great news. This past fall, due to one facility making the majority of our IV drugs in the U.S., it was devastated by Hurricane Helene. Hospitals and healthcare facilities across the country faced IV shortages. Nephron Pharmaceuticals in Columbia, South Carolina, tried to shore up IV support in South Carolina hospitals by creating the Palmetto line in its facility to help make IVs for hospitals across the state. We must do more proactively to address the shortages and the shortage risks, as well as to provide and promote the production of medical products here in the U.S. If confirmed, how will you prioritize efforts to prevent and reduce drug shortages, including for essential medicines?
Including?
Essential medicines.
President Trump has told me it's his priority to bring essential medicine manufacturing back to this country. It's a national security threat, and so much of it has been exported abroad, and particularly to China. And it's a priority for him, so it's a priority for me as well.
Very good. Will you commit to fostering productive public-private partnerships that can provide the government with key information on pharmaceutical supply chains, help direct shortages, and improve the long-term security and resiliency of the U.S. drug supply?
Absolutely, Senator.
Thank you very much. And one of the things that we study, I had two opportunities to question you. Once yesterday at the Finance Committee, I opted, as opposed to seeing you twice, just see you one time and spend my time doing some other things with that time. But I think it's important for us to recognize that we are in a critical place as a nation. We're so dependent on other countries for the essentials, from healthcare and beyond. And we ought to work on a strategy of resilience across this nation in all of the essential areas that we need to become less dependent on the rest of the world and more dependent on ourselves. And I hope that as your term at the HHS, you will spend a lot of time thinking through and all the layers and complexity that is under HHS, how we become more and more resilient as a nation.
That's absolutely critical for our national security and for our economy. And President Trump is doing that through HHS, but also, more importantly, through the Commerce Department, and meeting directly with pharmaceutical industry leaders to figure out what kind of incentives that they need to bring manufacturing home.
Perfect. Thank you, Mr. Chairman. I yield back my 8 seconds.
Senator Blunt, Rochester.
Thank you, Chairman Cassidy and Ranking Member Sanders. Mr. Kennedy, during our meeting, you shared your vision for the department, and we discussed priorities important to my home state of Delaware. But I must say, as a former cabinet secretary and a health official in my state, and listening to your answers today in this hearing, I am deeply concerned and shocked by your apparent lack of understanding of, frankly, some of the basic responsibilities of the department. It's one of the largest, most complex, and it is vitally important. And yesterday, during your finance hearing, and today, you confused details about Medicare and Medicaid. You didn't know what authorities you have under the Emergency Medical Treatment and Labor Act, known as EMTALA, and you made false claims about the safety of mifepristone. However, what concerns me the most as a mom and a first-time grandmother is your decades-long track record of promoting vaccine misinformation and profiting from it, despite the harms that it may cause to American children. And with that, I'll turn to my questions. In yesterday's hearing, you did not seem to know anything about EMTALA, even though I raised it with you during our meeting last week. So I'll give you another opportunity. Yes or no, do you believe that a person presenting to an emergency room with a severe illness should have any type of emergency care needed to save their life?
Any American who the
yes
law
or no?
says.
Yes.
I'm answering the question. Any
yes
American,
or no was the direction.
Under the law, every American who presents to an emergency room must be treated, and I can enforce that law, and I believe that's the right thing to do.
Do you agree that a person who is experiencing severe pregnancy complications should be able to receive emergency care to save their life if that care is an abortion?
My understanding of President Trump's policy is that
I'm not asking you President Trump's policy. I'm asking you, what do you believe?
If it's necessary to save the life of the mother.
Okay, so you do believe, yes, they should. Do you commit to ensuring that pregnant women will have access to all necessary emergency care, including an abortion, if it is required to save their life or preserve their life?
If it's required to save their life.
And would you agree that the ability to provide quality emergency care for pregnant women is essential to preventing maternal mortality?
Providing care for pregnant women, we should be providing care for pregnant women. President Trump wants to do that.
Bottom line for me, women should not be forced to rely on emergency airlifts to other states for life-saving care. And to be blunt, in our meeting, your lack of understanding really, again, was very concerning. In a 2023 interview, you described yourself saying, "I'm a Kennedy Democrat. I believe in labor unions. I believe in a strong, robust middle class. I believe in racial justice." And just yesterday and today, during this hearing and the hearing yesterday, you said we need to respect diversity. Mr. Kennedy, the Trump administration recently issued an executive order that directs the federal government to eliminate grants, contracts, policies, programs, and activities that include diversity, equity, inclusion, and accessibility. This executive order has already caused widespread confusion, fear, and uncertainty for healthcare providers, researchers, public health professionals, and service providers across the country. You said in our meeting that you understand that health disparities exist. So yes or no, do you, in your view, do the following programs count as health DEI programs? Programs that target Black women to address the maternal mortality crisis?
Senator, there are 7.
Yes or no?
I'm not going to answer that yes or no. If you want an answer, I'm happy to give it to you, but it's not a yes or no.
I just want a yes or no.
It's not susceptible to yes or no answer.
Well,
if you want to hear an answer, Senator.
Let me shift this because I only have 36.
If you want to hear an answer, Senator, I'm very happy to give you one.
I've got now 33 seconds. And there are people out here who want to understand that if they are at a pride parade and they're a healthcare provider, can they give out a brochure?
If you want people to understand, let me answer the question.
If they are trying to have a program in a Black church that is on Martin Luther King Day, will they be able to have that program? Will it be funded? Will they get in trouble? Will they be fired? That's the cause and concern. We all know that it is important that we have a healthy country.
But you want me to answer the question, Senator?
I think I got my answer.
Okay.
Thank you, and I yield back.
I will allow the witness to answer.
There are 7 departments at NIH that protect minority health and that seek to eliminate the shocking and unacceptable disparities in minority health. I believe in helping all people who are vulnerable. The DEI programs that President Trump eliminated have spent $63 million with no discernible positive impact on human health in this country. There's institutions already that existed before President Biden, whose job it is to do just that.
Will you cut those programs that you just referenced?
That decision is up to Congress, not to the HHS Secretary.
Thank you. I yield back.
For the record, treating a miscarriage or ectopic pregnancy is not an abortion. It's just false. And so I would ask that not be, since I'm not into misinformation, I would ask that misinformation not continually be repeated. That said, at the end, taking the ranking member and the chairman's privilege, we will have a chance, the two of us will have a chance to ask a little bit more. And that's what you get for being a chair. So that said, let's begin. Bobby, if I may, because you said I could, you had once described yourself as pro-vaccine to me. Now, the context of what I'm about to ask is that there's multiple studies establishing the safety of measles and hepatitis B vaccine, and specifically that they are not a cause of autism. In this position, and you have previously said yes, but if you are approved to this decision, to this position, will you say unequivocally, will you reassure mothers unequivocally and without qualification that the measles and hepatitis B vaccines do not cause autism?
Senator, I am not going into the agency with any.
Well, that's kind of a yes or no question, because so if you're, because the data is there, and that's kind of a yes or no. And I don't mean to cut you off, but that really is a yes or no.
If the data is there, I will absolutely do that.
Now there is the data, just because I used to do hepatitis B, as I've said. I know the data's there.
Well, then I will be the first person. If you show me data, I will be the first person to assure the American people that they need to take those vaccines.
Now, what concerns me is that you've cast doubt on some of these vaccines recently, I mean, like the last few years, but the data, and I can quote some of it, the data has been there for a long time. I've been out of the game, I've been in Congress for 16 years, and this data was in large measure generated before I came to Congress. So my concern is that if you were making those claims and being so influential, I mean, your bully pulpit is incredible. With that responsibility, that you never acquainted yourself with anything that might contradict that what you were previously saying. So let me ask once more. If the data is brought to you, and these studies that have been out there for quite some time and have been peer-reviewed, and it shows that these two vaccines are not associated with autism, will you ask, no, I need even more? Or will you say, no, I see this, it's stood the test of time, and I unequivocally and without qualification say that this does not cause autism?
Not only will I do that, but I will apologize for any statements that misled people otherwise.
Thank you. Next.
And I just want to pledge to you that I will never stick on a point if somebody shows me data that says I'm wrong. I know that's an interpretation people have, but it's absolutely wrong. I am science-driven and evidence-driven.
I think the concern is how persuadable people are. But let me go on because I have limited time. I'm going to hold myself to the same 5 minutes. Yesterday, Senator Bennett in Finance asked you if you had once previously made statements that Lyme disease was created as a military bioweapon, and you said you may have said that once. Do you still believe that Lyme disease was created as a military bioweapon?
I've never believed that, Senator. What I said is that we should always follow the evidence. There were 3 books suggesting that. I have not read them through. What I've said is we should always follow evidence, no matter what it says. So I never have said that definitively Lyme disease was created in a biolab.
Okay. Next, again, this will be kind of a yes or no. Do you commit that you will revise any CDC recommendations only based on peer review, consensus-based, widely accepted science, in other words, not personal beliefs or the beliefs of any single person that you or your department may identify?
Absolutely, Senator. I am not going to go into HHS and impose my preordained opinions on anybody at HHS. I'm going to empower the scientists at HHS to do their job and make sure that we have good science that's evidence-based, that's replicatable, where the raw data is published.
I'm almost out of time, so let me get to another question.
All right.
Do you promise that FDA will not deprioritize or delay review and or approval of new vaccines, and that vaccine review standards will not change from historical norms?
Well, we will have the best vaccine standards with safety studies, and I will not, if the
That's a little bit of a different answer than the question I asked, because what is the best could be in the eyes of the beholder. So let me read again. Promise that the FDA will not deprioritize or delay review and or approval of new vaccines, and that vaccine review standards will not change from historical norms.
Yes.
Great. With that, I will set a good example, and I yield my time to Senator Baldwin.
Thank you, Mr. Chairman. Mr. Kennedy, I've been listening to the back and forth and questions, and when people have tried to pin you down, you have said...
Can you speak up, Senator Baldwin?
Yes, I've been listening to the back and forth, the questions, and when people tried to pin you down on a point, you said, show me the data, or bring me the studies. And I want to suggest that data is out there, and those studies are out there. And if you're going to review all the studies and the data, you're going to be doing that, if confirmed, for your first year of being secretary. When we talked, we were talking a bit about vaccines at the end of our meeting, And you said really to me that there's no post-approval safety monitoring. And that led me to believe that you're not aware of the significant and ongoing safety monitoring that occurs after years of rigorous studies showing vaccines to be safe and effective. And so I want to give you the opportunity to set the record straight here. Are you aware of the measures in place throughout Health and Human Services to ensure vaccine safety after approval? Yes or no?
I'm aware of the FAIR system, which CDC admits it captures fewer than 1% of vaccine injuries.
So you are aware of the CDC monitoring? Are you aware of the FDA post-approval monitoring?
I'm aware of only 2 systems.
Are you aware of the vaccine safety data link?
Oh, yeah, I'm very aware of that.
Are you aware of the vaccine adverse event reporting system?
I'm aware of the vaccine safety data link that CDC keeps under a lockbox and will not let independent scientists look at it.
Are you aware of the clinical immunization safety assessment project?
As I said.
Are you aware of VSafe?
I'm aware that they're broken, and I can explain to you how each one of those is broken if you're interested. What I want to do is make sure we have gold standard science. We get the conflicts off the panels so that people, you know, there's Congress.
What I listed right now are just some of the guardrails that are in place to ensure that life-saving vaccines are safe and effective. And this is after numerous clinical trials, rigorous studies, and review by an independent panel of experts that show vaccines are safe and effective, which is available to all the public. If you want to take a second look at the science, like you have said, well, it's here, it's available, and it's conclusive. And saying anything else is undermining vaccines. To a different
and by the way, repeating what Congress found in the 2003 investigation.
Kennedy, I want to move to what I hope it will be pretty simple stuff. In general, for a drug to be considered safe, would you say that 97, 98% of people taking that drug and having no complications is generally safe?
It would completely depend on what the drug is. If it's a drug given to a healthy population, that would not be an acceptable.
Again, this is as high a level as it gets. Would you say that when 99 out of 100 people experience minimal or no complications, that that drug is safe?
It depends what the risk is from the disease. It depends what the benefit from the drug is. If you're dying of cancer, you will take a drug with that kind of risk profile.
And if we were to
if you're a
talk
healthy
about
individual with zero,
peer-reviewed,
if you're a healthy individual with zero
I'm talking
risk,
about mifepristone, but if we were to talk about peer-reviewed, replicable studies of a medication, would you say that you needed 10 trusted studies to get the same conclusion?
it
15,
depends what the
20 trusted studies?
It depends what the
What's your number?
It completely depends on the kind of study. You're talking about randomized studies or observational studies.
Is it safe to assume that 100 studies that are replicable and peer-reviewed is enough?
Well, it could be one study if it was a powerful enough study.
The most widely used medication, abortion drug, mifepristone, has been FDA approved for nearly 25 years. More than 100 studies have confirmed that 99% of patients who took the abortion pill had no complications. So with all of that, I can only conclude that you would commit to keep this science-backed and proven medication on the market and accessible for women. Is that correct?
I'm going to, with mifepristone, President Trump has not chosen a policy, and I will implement his policy.
So regardless of the studies, regardless of the data, regardless of the science, you've been talking about, show me the data, show me the studies.
Well, if you
would have that policy
Senator,
regardless of what the science says.
Senator, the devil is in the details. If you're telling me 99% of women did okay, but 1% died, I would say that is not a beneficial risk profile. That is not what the
studies show.
I know, but you're not showing me. I need those details from the study before I can't buy a pig in a poke. Show me what the study says.
So let's move on. Banks.
Thank you, Mr. Chairman. Mr. Kennedy, President Trump just won a historic election victory, and you were a big part of it. At the outset of the hearing, you talked about those Maha Moms, that coalition that You led that movement that was behind you that supported President Trump on Election Day, giving him one of the biggest electoral college votes in my lifetime. You were a part of that. The voters voted for President Trump. And President Trump, by the way, is a man of his word. He always follows through on what he says he's going to do. And one of the things that he said he was going to do was put you front and center in this administration to make America healthy again. And that's why, at the end of the day, a lot of those moms have been here yesterday and today from Indiana to support you in this movement. And that's why you have my full support. And anything other than voting for you to confirm you would be thumbing my nose at that movement, the millions of people in this country who want us to focus on making America healthy again. One of the things I've thought a lot about, I serve on the Armed Services Committee as well. I just left another hearing with the nominee to be our new Secretary of the Army, is the national security risk of an obese nation. 70% of our kids are not eligible today to serve in the United States military. And the Army 2 years ago was 25% off of its recruitment goals, and obesity among our kids is one of the reasons why. And I think you would agree, my first question for you, this epidemic in this country is as much of a public health risk as it is a national security risk. Would you agree with that?
Absolutely, Senator. And like I said, well, I didn't say this. When my uncle was president, 3% of Americans were obese. And today, 74% are obese or overweight. In Japan, 3% are obese. So other nations, what we're seeing here is not happening elsewhere. And American kids did not suddenly get gluttonous and lazy. Something is poisoning them. And we need to figure that out. And then we need to end those exposures. We need to do gold standard science. And all of these moms recognize that we now have a unique opportunity in history, where history now is at an inflection point, where we have a unique opportunity to reverse this epidemic. And we know what we have to do. We have to study the additives. We have to end the conflicts of interest on the nutrition panels and on the drug panels that are loaded with people who have corrupt entanglements with the industries they're supposed to regulate, that have turned these agencies into sock puppets for the industries they're supposed to regulate. We need somebody who can come in, who can break that inertia. We are attracting the most talented group of people who work in NIH and CDC and FDA in modern history. And people who are not coming there for jobs, they're innovators, they're disruptors, they're entrepreneurs, and they're coming in not because they want position, but because they actually want to change things and give us gold standard science and make America healthy.
And I know you agree that fitness is a part of that, a major part of that.
Absolutely. My uncle started the Presidential Council on Physical Fitness. I won a contest when I was in school. I got an award for it, and it was a piece of pride for me. And for many people in my generation, I'm sure Coach, won his presidential.
I want to move on. I want to move on to another national security threat. The biggest existential threat to America is the Chinese Communist Party. And right now we're importing 1/3 of our medicines from China. And even more of our generic drugs come from China. It's a public health risk and a national security risk. What can you do as HHS Secretary to reduce our reliance on China and help our domestic manufacturers?
This is a huge priority for President Trump. He sees this as perhaps our greatest national security vulnerability. And over the past few years, so much of our essential medicines, the production of them and the supply chains have been exported to China. And it's a crisis now in our country. If there is a pandemic, if there is a war, if there's any conflicts, China will now be able to ransom American health. And that is not a good situation. We need to bring that production home, and President Trump is committed to doing just that.
Well, sir, I think you're going to have a tough job. You have my full support, but you've got lawmakers against you. You're going to have bureaucrats against you. You're going to be working with the limits of the administrative state at the department. But I'll have your back, and I want to work with you to get it done.
Thank you, Senator.
This movement. Thank you. I yield back.
For Hawley.
Thank you very much, Mr. Chairman. Mr. Kennedy, welcome. I enjoyed our conversation last month in our office. And thank you for remembering, as you did again today, my uncles who we talked about, Morris and Lauren and Jean, who all have recently passed away from Parkinson's, grew up in a farm family. That was kind of you to remember them. So thank you for that. Let me start by asking you a question about children and the safety of children. President Biden's administration, his HHS, issued a rule, so it's binding, requiring that every doctor in America, including pediatricians who receive any kind of federal funding, so that's anybody who takes ACA funding, anybody who takes CHIP funding, this is almost every health provider in America, requiring them to conduct gender transition and gender so-called affirming procedures. So that means hormones, that means puberty blockers, that means surgeries in some cases. They imposed that rule on doctors across the country. This has been litigated, and it has been actually stopped by a couple of courts who found that it was way outside of HHS's jurisdiction. My question to you is, will you rescind this rule that imposes this radical policy, and talk about being anti-science, this radical policy on just about every pediatrician in the United States of America?
Yes, I will. And by the way, that rule is anti-science. The most thorough meta review on gender affirming care has come out in the Cass report, which reports really catastrophic impacts on children. And that is science. It's a meta review of all the existing scientific studies. But even more just from a common sense, if you're a patient, do you really want somebody performing surgery on you who is morally opposed to that surgery? It doesn't make any sense. We need to embrace diversity in this country. There are people who believe that's important. I respect them. We should hear them out. We should debate. We should have a congenial conversation. There are also people who believe that it is an atrocity, and they need to be listened to too. And we need to embrace diversity and make room for diversity in this country and not force people to do things that are against their conscience.
And let me just point out that on this rule, what's particularly pernicious about it is we're talking about gender transition surgeries, gender transition care on minor children. This rule purported to preempt all state law. So in states like mine and many others, where the voters have said, we don't want gender transition procedures performed on minors, the Biden administration attempted to use federal money and force pediatricians to do it anyway. So I'm glad to hear you say you'll rescind that rule. I think it's terrific for the safety of children.
And Senator, I would add that we don't let children drink. We don't let them drive an automobile because they have bad judgment. They are flooded with hormones. Their brains are still in formation. Their sexuality is still in formation. To allow them to make judgments about that are going to have life-changing, forever implications for the rest of their life at that age is unconscionable, particularly in light of the Cass report.
I'm glad to hear you say that. Let me ask you a question about NIH research, if I may. I know this is something that you care a lot about. Under the first Trump presidency...
And I do want to add that people who have gender differences should be respected. They should be loved. But loving them does not sometimes love means saying no to people.
Let me, on NIH, under the first Trump presidency, HHS stopped new NIH research that involved human fetal tissue from elective abortions. Now, you were asked about this sort of tangentially yesterday by Senator Cantwell, and I want to get your quote right. You said to her correctly, you said stem cell research today can be done on umbilical cords and you don't need any fetal tissue, which is correct. My question to you is, will you reinstate President Trump's policy that ensures that no federal research and no federal tax dollars is conducted on fetal tissue taken from elective abortions?
Yes.
Fantastic. Let me ask you just about Title X. You were asked about this yesterday too, and I think I understand your answer. I just want to be sure I've got it crystal clear. Title X, which prohibits the funding of the use of federal taxpayer funding for abortions or to flow to entities like Planned Parenthood that perform abortions or refer people to abortions. You were asked yesterday if you would support President Trump's rule that says no Title X funding for those who perform abortions or refer people to abortions. I think your answer was yes, you would reinstate that rule. I just want to be sure I'm right about that.
Yes.
Fantastic. Last point that I have for you, on mifepristone, the chemical abortion drug, you said yesterday that you would study its safety. I think that's good. I want to make an additional point here just about how the Biden administration changed the rules on mifepristone that I hope that you'll take into consideration, because you pointed out, I'm almost done, Mr. Chairman, you pointed out that we need to honor the wishes of voters and states and their right to set life policy. I just point out that the Biden administration's rule on mifepristone, which they did after the Dobbs decision, means that in any state, including ones like mine, where voters or state legislators say we don't want abortion performed after a certain point, if the Biden administration rule on chemical abortion stands and you can mail in these abortion drugs without a doctor visit or referral, that means no state ban, no state decision, no voter decision is going to matter. We're going to have a one-size-fits-all policy set here in Washington. I hope you'll take that into consideration.
I will implement President Trump's policies.
Out of order, we're going to go to Senator Marshall. He would like to be able to view the press conference regarding the tragedy on the plane from Wichita. Senator Marshall.
Well, thank you, Mr. Chairman, and thank you, Mr. Kennedy, for your kind words this morning, for your caring text last night, and I'm grateful for all my colleagues, most everybody reaching out to us, and it's certainly it's a tough day for Kansans and many others who lost loved ones, and we will look forward meeting with the president later today and those loved ones, and just want everyone back home to know that we're wrapping our arms around them, that we're mourning with them, and we'll get through this together. So thank you. Mr. Kennedy, take a second and just describe why fighting chronic disease is so important to you. Who are we fighting for? What is your role as HHS Secretary, and is there anything that's a bigger priority to you than this? As you go into this role.
Thank you, Senator. When I was a 10-year-old boy, my uncle was in the White House. The chronic disease among American children was 2%. Today it's 66%. The cost of chronic disease to our country when my uncle was president was zero. There were not even treatments for chronic disease at that time. Today, the cost is $4.45 trillion. Is bankrupting our country. 77% of American kids can't qualify for military service. 38% of teens, according to NIH's last report, which was 3 weeks ago, 38% are diabetic or pre-diabetic. When my uncle was president, the typical pediatrician would 1 or 2 cases of diabetes in his lifetime, juvenile diabetes. Today, it's more than a third of the kids who walk through his door or her door is diabetic or pre-diabetic. Autism rates have gone from 1 in 10,000 or 1 in 1,500 to 1 in 10,000, depending on what study you look at. In my generation, as a 70-year-old man today, in our children, it's 1 in 34. The explosion, I had 11 siblings. I had dozens of first cousins.
Mr. Kennedy, I'm sorry. So, who are we? What's your role as HHS Secretary to fight that disease?
There's never been an HHS Secretary who came in to do this. It was all about the typical partisan debate about how we allocate the cost, whether insurers pay it or whether hospitals, providers, or families pay it. And the costs continue to rise. All the things we're debating on, our kids are getting sicker and sicker.
Yeah, just to quote you from yesterday, it's like we're moving the chairs on the Titanic.
Yeah, and the ship is sinking, and nobody's paying attention to it. And yesterday, I got question after question from the Democrats about measles. In 1963, the year before the measles epidemic, or the measles vaccine was introduced, 500 American kids died from measles, almost all of them extremely poor and malnourished. We have 252 million Americans who are suffering from chronic disease, and none of them mentioned diabetes, they didn't mention heart disease, they didn't mention cancers yesterday. We need to refocus if we're gonna save our country. This is existential. Our country's not gonna be destroyed because we get the marginal tax rate wrong.
Right.
It is gonna be destroyed if we get this issue wrong. And I am in a unique position to be able to stop this epidemic.
Mr. Kennedy, I want to just contribute as one of the 3 physicians on here, and even as I listen to my friends across the aisle, My conclusion is that we have to guard the physician-patient relationship and give those parents of these kids the information. All three of us are going to disagree on exactly who should and shouldn't get a particular vaccine. We all recognize the incredible successes of different vaccines as well, but we have to give the American public the best information, non-biased information, and I'd love to get you to respond to that, but I have an important question for folks back home. And this will be my last question. I've never seen a person whose words, written and spoken, have been so misattributed, exaggerated, sensationalized, and taken out of context. Will you just speak to my farmers and ranchers back home and tell me about your, where do they fit in this role of MAHA and how we're going to work with them and just your compassion towards these farmers and ranchers?
Yeah, I mean, MAHA will not succeed without the cooperation and partnership of agricultural producers, of farmers and ranchers across this country. I was a 4-H kid. I grew up working on ranches. And I've worked for years representing farmers in various forms of litigation. Thomas Jefferson said that American democracy is rooted in tens of thousands of independent freeholds owned by farmers. We are losing farmers today, and we can't afford to lose a single farmer. And on my watch, I do not want to lose a single farmer. We have to offer farmers an off-ramp from chemically intensive agriculture, which they don't want to do, which even the chemical industry is ready to change, so that they can grow crops that they can sell in Europe. They can grow crops. Senator Hawley told me during our meeting that 4 out of 5 of his brother-in-laws have Parkinson's. There's illness all over the farm community, and it's undoubtedly related to the intensity of chemical pesticides.
Mr. Kennedy.
We need to reduce that, but I'm not going to do anything coerce the farmer. President Trump was the best president in modern American history for the American farmer. The first one to see farm prices go up. He has instructed me to take care of the farmers and make sure they're full partners.
Thank you.
And thank you for holding what is a very critically important hearing on President Trump's disastrous budget request for the Department of Health and Human Services. Secretary Kennedy, good morning to you. We welcome you to the House Appropriations Committee for your first budget hearing. However, I cannot thank you for the Trump administration's budget request to cut funding for important health programs by $33 billion. Quite frankly, I view it as a disgrace. Under your budget proposal, Americans would die of needless and preventable deaths. But before we talk about the request to cut tens of billions of dollars next year, I would like to talk about what is happening right now. The American people are demanding health with a cost of living, but President Trump is not laser focused on the cost of living crisis. He is actually making it worse. He promised to fight for the working class, but instead put Elon Musk and billionaires in charge of the government, and you to destroy everything we know about good public health. Mr. Secretary, this administration is recklessly and unlawfully freezing and stealing congressionally appropriated funds from a wide swath of agencies, programs, and services across the government that serve the American people. And recall that this is a violation of the Constitution. The power of the purse resides with the Congress. It's Article 1. Section 9, Clause 7. Yourself and President Trump and Elon Musk are attacking health programs to pay for tax cuts for billionaires. And by promoting quackery, we are endangering the health of the American people with pseudoscience, fear-mongering, and misinformation. Government should fight for the middle class, the working class, and the vulnerable, not the interests of billionaires like Elon Musk. Instead, with you at the helm, the Trump administration and Republicans in the Congress are destroying the crown jewels of our health system. The National Institutes of Health, the Centers for Disease Control and Prevention, and the Food and Drug Administration. At the NIH, the world's largest funder of life-saving biomedical research, you and Elon Musk have fired or driven out nearly 5,000 personnel, including some of the world's most preeminent scientists, frozen billions of dollars in research to develop cures for cancer, Alzheimer's disease, women's health, and the list goes on. China and Europe are taking advantage of this disaster by recruiting American scientists away from the United States. China wants to overtake us as a global leader in health research and innovation. You and President Trump are aiding and abetting them. 2 weeks ago, I called a hearing on the cuts to CDC because the Republican majority is refusing to hold this administration accountable for its wanton destruction. As part of your drastic and haphazard purge of CDC, you and Elon Musk eliminated entire divisions without consideration of what is being lost. More than 70% of CDC's funding is provided to state and local jurisdictions. These cuts affect families and communities in every one of our districts. These cuts are dangerous. Dr. Peter Marks, the country's top vaccine regulator at the Food and Drug Administration, helped to develop the COVID vaccines at record speed under the first Trump administration. Dr. Marks was told to resign or be fired. In his resignation letter, Dr. Marks wrote that, and I quote, "It has become clear that truth and transparency are not desired by the Secretary, but rather he wishes subservient confirmation of his misinformation and lies," end quote. Mr. Secretary, Dr. Marks was talking about your misinformation. He was talking about your lies about vaccines. Mr. Secretary, you are gutting the life-saving work of the Department of Health and Human Services and its key agencies, while the Republicans in this Congress say and do nothing. But the destruction of HHS is not limited to NIH, CDC, and the FDA. Mr. Secretary, you are eliminating entire agencies that have saved the lives of someone near and dear to each and every one of us. Because of these cuts, people will die. Substance Abuse and Mental Health Services Administration, SAMHSA, eliminated. Health Resources and Services Administration, HRSA, which, as you know, is responsible for ensuring access to health care for the uninsured, isolated, and vulnerable people, eliminated. The Administration for Strategic Preparedness and Response, ASPR, which was created to prepare for and respond to public health emergencies, eliminated. The Administration for Community Living, ACL, eliminated, hurting seniors and people with disabilities. You can make the baseless claim that you are simply reorganizing these functions of HHS all you want. It is simply a matter of fact that you cannot cut the department's budget and maintain all of its life-saving programs and services. HHS has closed half of its regional offices, which serve 22 states and 5 territories. 20,000 HHS employees are gone. And Republicans have set the stage to cut Medicaid benefits from people who rely on that program to see a doctor, including roughly half of our nation's children. HHS has terminated more than $12 billion in funding for state and local health departments, including funding for mental health, substance use programs, treatment, sabotaging our progress in addressing the opioid crisis. Mr. Secretary, you are eliminating scores of CDC prevention programs, including HIV, tobacco, drowning, asthma, lead poisoning, and gun violence. Why on earth are these the places you are terminating for so-called waste? The life of a teenager that does not become addicted to cigarettes or injured by a firearm is not waste. Last month, you wrote in the New York Post, and I quote, "America has the highest rates of chronic disease in the world. We rank last in terms of health among developed nations, and life expectancy is declining for many groups of Americans." Mr. Secretary, much of what you wrote is true, but it is confounding and incomprehensible to then turn around and eliminate the CDC Center for Chronic Disease Prevention and Health Promotion. And with respect to views on vaccine, quite frankly, I believe you are promoting quackery. Under your watch, our country is now failing to contain vaccine-preventable diseases. Measles, a disease eliminated in the United States just decades ago, has now claimed the lives of 3 Americans, including 2 children who died needlessly, and over 1,000 are confirmed to have contracted the disease. All while you peddle unfounded and dangerous vaccine skepticism, spread lies and misinformation about people living with autism. Vaccine programs for millions of Americans, including children. We do that so that they do not get these diseases, like measles. This is not a waste. The thousands of experts and experienced staff who help keep Americans safe from global infectious diseases like measles, polio, HIV, tuberculosis, and Ebola are not waste. These programs help to save the lives of men, women, and children from all walks of life in this country. And you have decimated the Food and Drug Administration by firing 3,500 employees, taking a wrecking ball to FDA's food safety mandate. You talk about making our food supply healthier while gutting the support staff for critical inspections of things like baby formula. You talk about closing the generally recognized as safe or GRAS loophole, which allows food companies to determine the safety of their own ingredients, something that I have advocated for years, but while firing staff in charge of food and chemical reassessment. The former deputy commissioner of the Human Foods Program resigned in February, writing, and I quote, "I was looking forward to working to pursue the department's agenda of improving the health of Americans by reducing diet-related chronic disease and risks from chemicals in food. It has been increasingly clear that with the Trump administration's disdain for the very people necessary to implement your agenda, however, it would have been fruitless for me to continue in this role." End quote. That's a damning indictment of your work on food safety. I'm worried about a future public health crisis that emerges once the Trump administration has fully dismantled the nation's public health system. We are currently in the midst of an outbreak of avian influenza, and this administration is woefully unprepared to protect Americans and mitigate its impacts if it transforms to be transmittable from person to person. This is all happening today, right now. We are not talking about hypotheticals or what-ifs or worst-case scenarios. This destruction has happened and is happening today, right now. Even though we received President Trump's concept of a budget plan on Friday, we are now into May without a real budget from the White House. Mr. Secretary, in the budget outline, you are asking Congress to cut funding for health programs by $33 billion, a cut of more than 25%. You are asking Congress to cut CDC by nearly $4 billion, NIH research by $18 billion, and you claim to be reorganizing the NIH. Any reorganizing of NIH must go through the Congress. We need to hold public hearings, engage in a thoughtful process to incorporate the best ideas to advance NIH as a crown jewel of biomedical research. Mr. Secretary, you have no lawful authority to undertake this by yourself. These are vital institutions built up over decades that protect Americans' health and the health of people around the world. I do not believe the American people want less cancer research, fewer people tracking infectious diseases, but that is exactly what this budget will deliver. We are in the middle of a cost of living crisis, driven in part by skyrocketing healthcare costs, and you and Elon Musk and President Trump are making it worse. You are wreaking havoc at every level of our most critical health institutions. You are jeopardizing our families' health for the sake of billionaire tax cuts, but we are seeing pushback at every level. The public is outraged at the enormous harms you have wrought. Dozens of courts have put restraining orders on the administration's actions, but the courts can only play defense. Republicans in this Congress could stop the mayhem, the chaos, and the destruction today if they had the courage. But they remain silent, petrified of the president's scorn, revenge, and retaliation. Those of us who serve in elected office, we are blessed, and we have the power to do something. We know what's right, and we know what's wrong, and we understand the harm being wrought on the American people. We need to stand up, not be afraid. This is the time to meet the moment. As a top Democrat on the Appropriations Committee, I will never stop fighting against this dangerous dismantling of Health and Human Services and its agencies, which is jeopardizing the health, the safety, and the well-being of millions of America's families. Thank you. I look forward to your testimony and to the important conversations we will have in this hearing this morning. I yield back, Mr. Chairman.
Ms. Watson-Coleman.
Thank you, Chairman. Mr. Secretary, few things enrage me more than the racist attacks I see this administration carrying out by embarking on an ignorant crusade to rid the government of any programs that are working to improve the lives of Black Americans. The administration has moved to ban the words Black, race, bias, minority, oppression, prejudice, discrimination, disparity, and racism. Any grant application on federal programs that include these words had them immediately stripped. It is painfully clear to me that in doing this administration that you work with and work for is attempting to legitimize racial discrimination, and that, sir, is a moral disgrace. It is not woke to improve the health and well-being of Black people who are disparingly impacted by just about every health issue. It should not be controversial to make right a healthcare system that was not built to help people like me, to take my concerns, my pain, my health very seriously in this country. Black women die from childbirth complications at a higher rate in this country than any other high-income country. And last year, where there was overall maternal deaths dropping in this country, well, Black women maternal deaths rose. This sickens me, and it tells me that our government has so much more that we must do to focus on improving the lives of Black women, not less. Your decision and justifications are damning and troubling, particularly for destructive impacts your choices and benefits will have on poor minority people. So tell me, sir, how will eliminating minority health offices, how will eliminating initiatives and programs across the department that were created to look at the disparity in healthcare and the need to give greater attention to the fact that Black folks' experience in healthcare was very damaging, was very different. How exactly will HHS banning the words that we use to describe ourselves make us healthier?
Congressman, President Trump's vision of this country is the same as Martin Luther King's, that we should have a colorblind administration. President Trump is deeply concerned about the maternal health crisis and the fact that Black mothers are more likely to die in childbirth 2.6 times, 260%.
So
more
how
likely
will
to
you
die.
explain, excuse me, sir, let me claim my time because I don't need this rhetoric about Donald Trump and the lie that he cares about me and Black people. What I want to know is the proposals. I'm claiming my time, sir, reclaiming it. I want to know specifically, how do you intend to address those disparities and to overcome those disparities as it relates to Black health in this country with the changes that you've decided are important, or someone has decided for you, I don't know, with your department? Specifically, sir.
I've spent a lifetime working on those priorities, and I continue to do so. We have 8 divisions, 8 programs for minority health at HHS. We've closed one of those offices. We're maintaining the other 7. We have 42 programs for maternal health. We're going to close a couple of them and consolidate them. We're going to still spend $1.7 billion a year. The commitment is there. We're just reorganizing.
Okay, you know what?
And
the impact of reorganization is something that I shall continually ask you to show me. So please let me warn you now.
I welcome those inquiries.
And I don't want rhetoric, I want numbers. The other thing that really troubles me, sir, is LIHEAP. It is a program specifically to address the needs of low-income and minority families as it relates to heating and even air conditioning. Why? And what is your rationale for eliminating that program specifically? Why?
I'm very committed to LIHEAP. My brother ran a low...
I don't care about your past. I care about your functioning in this department, in this administration right now in response to this question.
My time has expired.
Oh, well then so has your legitimacy. I yield back.
Thank you. Welcome, Mr. Secretary. Before I ask my questions, I just want to make this statement. Draconian abortion restrictions are killing and maiming women, and that is a tragedy. You don't need to respond to that. I want to thank you for being here. I'm going to try to ask my questions as kindly as possible. Do not take them personally. In the past, I've believed...
I won't take your kindness personally.
Okay, well, whatever. You know, they say if you can't take a joke, don't go into politics. So let me start by saying in the past, I have believed very strongly in the mission of the Department of Health and Human Services. Funding this department should be one of our highest priorities because if it's run correctly, it has the power to save lives, advance life-changing research, and protect the health and well-being of our families, especially our most vulnerable, our children, our seniors. But to be straightforward, as my colleagues know, in other words, I am deeply wary of giving $1 to this administration under the current leadership, especially because it seems to be a disregard of science and, most importantly, ignoring the body of government that appropriates funding. That's us, the Congress. In just a few short months, we've seen a level of chaos and destruction. I compare it to a tornado hitting a populated community. Without the consent of Congress, which appropriated funds with Elon Musk's chainsaw, medical research has been gutted, clinical trials have been halted, billions of research grants have been yanked without warning, preventative health programs, those that keep people healthy and out of hospitals, have been slashed to the bone. And I'm from Florida, where we have one of the largest senior populations in the country, and I'm particularly alarmed. Alzheimer's, cancer, heart disease, these are not abstract concerns. Research has been stopped. These are everyday fears of millions of Americans, including my own constituents. And so we've seen the firing of thousands of scientists and other professionals. All this to give tax breaks to our healthiest or wealthiest citizens, who are also probably our healthiest citizens. And to me, that is unconscionable and dumb. So this should not be a partisan issue, really, because it doesn't matter what political party you are. People want to and should be healthy, but the Trump administration, ideological dismantling of our public infrastructure must go in a different direction for me to vote for your budget. Now I have a few questions for you. I think you said that the decision for all these cuts was done by a varied amount of people. Were any of the cuts made before you were sworn into office? Were you handed? Do you remember that? Were people fired before you was? All right. Well, what did you say?
I think so, but I can't tell you.
Okay. Let me ask you this: was any member of Congress or anyone on this committee consulted before the cuts were made? And could you tell me who you talked to here?
I mean, I stayed pretty close touch with Bill Cassidy during.
Okay, well, I'm asking if anybody here, because you're here. You're asking us for money. We appropriated the funds. Did you talk to any of us, Democrat, Republican? You know what? There are actually some very bright Republicans, I will say that, on both sides of the aisle. So the answer to that question is no. So your decisions, were they based on merit or generated by an algorithm? Did somebody get Elon Musk's computer and say, okay, just make 20% cuts? You know,
I mean, I disagree with your entire characterization. It was like the recitation of a narrative that, you know, everybody knows out there, and it's the Democratic Party narrative.
I'm just asking you a question.
But it's just not true. We weren't cutting thousands of scientists. We weren't cutting clinical trial. I mean, everything you said was essentially dishonest.
All right, that's my point.
And don't take that personally.
So don't take it personally. Mr. Secretary, how many employees have been let go so far?
Excuse me?
How many employees have been let go so far from your?
About 10,000 left, took the fork in the road, about 10,000 more.
And how many are on administrative leave now, waiting to be fired in June?
Well, that would be the second 10,000.
Okay, so and are they currently being paid?
Yes.
Yeah, so they're being paid to do nothing.
Well, there's a lot of them are supposed to be coming in still.
But they're coming in to do nothing because they're not allowed to work.
Oh, no, we want them working.
Are you empowered to reverse these decisions?
Yes.
You are, okay. And How was the 15% indirect research cost cap decided?
15%.
Research, there's now a 15%.
That's pretty much about 2 to 3 points above industry standards. So we were just, I mean, if you're the Gates Foundation and you give a scientific grant to Stanford, you're giving them a 10% indirect research.
So you base this on the Gates Foundation?
All of the Rockefeller Foundation, all of the other foundations that give to biomedical research.
One more question.
You're asking me a question, but you won't let me answer it, Congress.
You've done very well, very, very well. I just want to know, are you going to, can we trust you? If we put money into the budget for you, you're going to spend it the way we've directed it?
Yes, that's what the law requires.
Okay, thank you. I yield back.
Thank you, Mr. Chairman. Let me stop going back to prescription drugs. Mr. Secretary, did I hear you correctly to state that your goal is to have Americans pay the lowest prices in the world or equivalent to what is paid in other major countries? That is my goal, that you are prepared to work with us on legislation to achieve that goal.
Absolutely.
All right, and I believe there's bipartisan support for it. I believe that if the leadership here prioritizes that, we can do that in a very short period of time. Look forward to that. Let me ask you this, as Secretary of HHS. We have in America today some 85 million Americans who are uninsured or underinsured. We spend more per capita, as you've indicated, than any other country. Is healthcare a human right? Are we making America healthy when so many people cannot afford to go to a doctor, when 68,000 people a year die because they don't get to a doctor when they should? Is healthcare a human right? Will you work with us to guarantee healthcare to every man, woman, and child in America?
Well, I think you're asking two different questions. You're asking a philosophical question about whether it is a human right, like a constitutional right. As an attorney, I would say that it's not a right of a kind that we otherwise enshrine in the Constitution, because healthcare costs your neighbor money. If I smoke cigarettes for 20 years, I make that choice, which is my choice.
I don't mean to, I don't have a lot of time, so but I am here.
If you're asking me a philosophical question, I gotta, give you a thoughtful answer.
Within 30 seconds.
Yeah.
It's probably.
So, it's not like freedom of speech, which costs, everybody.
But every other country, Mr. Secretary, every other country guarantees health care to all people as a right. Should we, as Americans?
The objective is to get Americans the level of health care that they want, the choice which Americans want. Americans
they don't want the choice to be uninsured.
Well, but
they don't want the choice to die because they don't get to a doctor on time.
Americans prefer private insurance to other insurance sources.
Do you believe? Okay.
And what I would say is, I want to find a solution to this. I want every American to have insurance. President Trump wants every American to be insured and have access to health care. The question is, how do we get there? Obamacare is not working. It is not working. And this is the...
Sorry to interrupt you. All right. The reconciliation...
My job is to try to make it work.
All right. I have limited time. The reconciliation bill that is now being worked on in the House will come to the Senate. As it stands right now, cuts Medicaid in the Affordable Care Act by more than $715 billion, which the CBO has estimated would eliminate health insurance for 13.7 million Americans, and also raise co-payments for millions of others, is throwing 13 million Americans off of the health care they have, poor and working class people, keeping America healthy.
Well, I haven't seen that number. I've seen the number 8 million. And here the people, the cuts are not true cuts. The cuts are eliminations of waste, abuse, and fraud. And I can go through. I can go through the people who will lose it. There are a million people,
I really don't mean to be rude, but as you know, I have a very limited amount of time.
You ask a question, I'm going to answer it.
Well, yeah, I've got a bunch of questions that I would like you to answer as well. All right, we talk about austerity, doing more with less. But in that very same bill that is being worked on in the House right now, there are $235 billion in tax breaks for the top 0.2%. Do you think that makes sense when that same bill would throw 13 million people off of Medicaid? Should we give tax breaks to billionaires and throw kids and others off of Medicaid?
You're conflating the congressional bills with the proposals from the president. The president
No, I'm talking
is
about
not
the
making
congressional bill. I'm talking about the bill, the reconciliation bill.
I mean, the president is not trying to do tax cuts for billionaires. He's trying to have no tax on tips and no tax for
$235 billion by
how
the
many
estate
people,
tax.
how many billionaires do you know that are making overtime or making any part of the
$235 billion. Look, it's a big bill. There are a lot of provisions in it, but you cannot deny the top 0.2% will get $235 billion in tax breaks while we cut Medicaid.
Okay. Senator Paul.
Thank you. I want to commend Secretary Kennedy and the administration for putting forward less spending. And one of the reasons I think we need to look at NIH and other grant-making organizations is if you keep giving them the same amount, you'll keep getting the same frivolous grants. And I'll recite a couple of them so people can remember. $660,000 was given to study the impact of microaggressions on obesity-related eating in Latinx Americans. You know, really, maybe heart disease, diabetes, obesity, but eating disorders in Latinx Americans. Here's another one, $419,000 to study if lonely rats seek cocaine more than happy rats. Maybe we could eliminate that, and that could go to a real disease. Most recently, NIH recorded a $620,000 grant for LGBTQ plus inclusive teen pregnancy prevention program for transgender boys. And what they discovered was that girls who think they are boys are at least as likely to get pregnant as girls who think they are girls. Amazing, the science. But we should all agree that that's just left-wing ideology. That's not science. We should study obesity and cancer and diabetes. I commend you for shifting the balance. I have a specific question about closing down Fort Detrick recently. My understanding is that a contractor intentionally slashed the hazmat suit or the biosafety suit of someone who's handling Ebola. You were immediately attacked in the press by saying, oh, he's just anti-science, once and then shutting down science. Was this a serious breach, and is it being investigated?
We brought in the FBI to investigate it. As you say, it appears like it was a deliberate criminal act to try to, that was a kind that is equivalent to attempted murder because the kind of microbe, the pathogens that they were handling have a very, very high case fatality rate, up to 50%. The disturbing thing about it is that there are 3 leaks a week globally from BSL-4 labs. And any of those could be cataclysmic for humanity. And as a result, we not only closed Fort Detrick, and we brought the FBI in to investigate that, we also declared the end of gain-of-function studies that will allow those kind of leaks to continue.
I commend you for that. I think ultimately legislation will be needed because the next administration could reverse it. I think there is bipartisan support for some controls on gain of function. As you shut down gain of function, though, you have to decide what it is, and then you have to look for it. So I would suggest that at both Fort Detrick and at the NBAC lab that's nearby, run by the DHS, that we look at experiments involving Ebola, avian flu, Marburg virus, to determine, one, whether they gain of function, but also just determine whether the experiments are wise. I am told in public records that they are doing experiments or have done experiments to aerosolize Ebola at the NBAC lab. That's the DHS lab nearby to Fort Detrick. My hope is that when you investigate whether to do gain of function or what is gain of function, what is being done, that you'll compile that and at least give us a report in Congress, and we're going to ask for it, but so there can be public scrutiny of these things. You will help to scrutinize it, but the whole public needs to know how dangerous some of these things are and whether we should be doing them. The idea of aerosolizing Ebola, I think, is or training Ebola to be aerosolized is incredibly dangerous, probably goes against the Biological Weapons Convention. And I'd like to hear a little bit about whether or not, as you investigate this, you plan on bringing information back to Congress or to the public.
Yeah, we're going to be absolutely transparent. I have a trip planned to Fort Detrick with Christy Nome, the director of DHS, and with Jay Bhattacharya and other people in my agency who are experts on bioweapons, who are experts on gain-of-function research, and we are going to be absolutely transparent. We've also proposed a methodology for regulating and for determining what is dangerous gain-of-function and what is legitimate scientific investigation, and how to bring the public into that debate, which I think, as you point out, is absolutely critical. That is where we messed up last time. And as you know, we have some of the Democrats here who are, talking about the great science from NIH, but now we have the major agencies, intelligence agencies, the CIA, the FBI, the DOE, and the State Department have all agreed that NIH research almost certainly led to the pandemic, the COVID pandemic. So that's not the kind of the result that we should be allowing or enabling, and we're going to end that now.
If possible, the trip to Fort Detrick and to NBAC, we'd like to be included or invited on that trip if possible.
Absolutely.
Thank you, Mr. Chairman.
The ranking member, Mr. Lauro.
Thank you very much, Mr. Chairman. Let me just one area of correction, which has to do with the measles issue, Mr. Secretary. You keep comparing the U.S. to other countries. You compare us to Europe, but the Europe you are referring to is the WHO European region. That's 53 countries in Europe and in Asia, including those with low vaccination rates like Romania, that has never eliminated measles. If you compare us to Western Europe countries that we often compare ourselves to, like Great Britain, they have seen no measles death this year. Let me move to the NIH. In your testimony, you say you want to quote, and I quote, rescale our biomedical research budget, unquote. Excuse me, but that's BS. You are not rescaling NIH research. You are proposing to cut it by $20 billion. And according to our colleagues in the Senate, NIH has effectively cut research funding by $2.7 billion this year in comparison to the same period last year. That's a cut of 35% during that period. That includes cutting cancer research by 31%. This is the report put out by the Senate, Trump's War on Science, which goes into detail about how we are, in fact, dealing with cutting scientific research. Mr. Secretary, are you freezing or withholding funding that Congress appropriated in 2025 for life-saving NIH research?
Let me address your first issue first, because I want to correct you. We have about 1,100 measles cases in this country. The growth rate last year was 15 additional, so we have plateaued. Mexico has roughly the same number with a third of our population, and they got 300 extra cases last week. Canada has more measles, 1,500. They have 1/8 of our population. Western Europe has about 6,000, which is 10 times the number that we have.
Well,
you are wrong about what you said earlier.
We can discuss that, but I think one has to consider whether or not we're dealing with decades of data proving how effective and safe the measles vaccine is. I want to move to that. I want my questions answered on, are you freezing and withholding funding that Congress appropriated in 2025 for life-saving NIH research?
We are not withholding any funding for life-saving research.
Okay. Do you commit to following the law?
Of course.
Fully obligating funding that Congress appropriated. We appropriated, it is the law of the land for NIH research, and to obligate those funds by September 30th of this year. Or are you planning to break the law by impounding congressionally appropriated funds?
If you appropriate me the funds, I'm going to spend them.
We have. In the bill, you are cutting the NIH by $18 billion, or you're proposing to cut it by $20 billion. The Congress appropriated those funds. It passed into law. It's part of the 2024 budget, and we are under a continuing resolution that has adopted the 2024 numbers. How then can you justify cutting $20 billion from the biomedical research budget?
If you appropriate the money to me, I'm going to spend that money.
We have appropriated, Mr. Secretary.
Then I'm going to spend it.
Then you're going to spend it. You're not going to cut $20 billion from the NIH.
The White House proposal is to do very, very large cuts at NIH.
Well, that is contrary to the money appropriated.
Ranking member.
Yes.
If Congress appropriates me the money, I'm going to spend the money. You have the power of the purse here.
Thank you.
You know that.
Thank you for reiterating that, but I think that I'm not sure the administration really has internalized that, particularly Mr. Vogt hasn't internalized that when he says that we can in fact, impound money. The money is there. The 2024 budget includes the funding for the NIH. Will you commit to spending the money that is in 2024 in that budget?
As I said, Ranking Member, if you appropriate the money, I'm going to spend that money.
The money has been appropriated. So the answer to that is if you're not willing to accept the funds that have been lawfully voted by members of the House and Senate on the money for the National Institutes of Health. We're going to hold you to your word that that funding is there. It should be transferred from 24 to 25, and you've cut already $20 billion. Let's get that money back. Let's get that money back. You have an obligation to carry out the law and to implement what the Congress has done. Unbelievable. Unbelievable. Chronic disease and tobacco. Tobacco use is a major contributor to chronic disease and is a leading preventable cause of death in our nation. Each year, killing nearly 500,000 Americans, costing the nation nearly $250 billion in healthcare costs. CDC's tips from former smokers' media campaign alone is estimated to have saved more than $7 billion in healthcare costs by helping more than 1 million smokers quit. Why did you eliminate CDC's Office of Smoking and Health, an office that reduces the number of kids using tobacco products, helps audit tobacco users to quit, and saves taxpayers dollars?
We have, under the reorganization, and I'm going to talk very, very broadly, because as of 4 o'clock yesterday afternoon, we are under a court order not to do any further planning on the reorganization. And I've been advised by my attorneys and not to talk about it. But I will just say broadly, many of the programs that the Democrats are now saying were cut at CDC were not cut at all. Those programs were transferred to the Administration for Healthy America. But I'm not permitted to talk in any more detail because of a court order.
I know we're just dealing with words. You transfer it here, there's less money overall for the agency, therefore there's less money for the programs. In both 2024, 2025, Congress, again, power of the purse resides here, appropriated $246 million for CDC's tobacco prevention programs. Do you commit to following the law again, fully obligating those funds so that we can help adults who want to quit using tobacco and prevent teens from becoming addicted?
Allow me to answer that by pointing out the absolute cataclysmic disorganization of this agency under your oversight for 40 years. We had 9 separate offices of women's health. When we consolidate them, the Democrats say we're eliminating them. We're not. We're still appropriating the $3.7 billion, but we're not keeping all 9. We had 8 separate offices for minority health. We eliminated 1. We had 27 HIV offices.
Okay, let me just, I'm going to
We had 59 behavioral health
right.
programs.
I'm well over time. If you could just get us what has been eliminated, why you're doing it, and the criteria by which the elimination has occurred. That is information that this committee needs in order to be able to do our job in terms of appropriating funds. Thank you
And
for
we
your
will gladly provide that to you, but right now we're under a court order that prohibits us from doing so.
Okay.
Thank you, Mr. Chairman. Secretary Kennedy, you run a department that touches the lives of almost every American. Yet for this budget hearing, these are the 6 pages that we have gotten in terms of your budget request. We are also 7.5 months into this fiscal year, and yet you are not telling the American public anything about how you are spending the billions in taxpayer dollars right now. You had to submit an operating plan to the Congress, and this is just a sample page, but 530 programs simply have asterisks. Secretary Kennedy, this isn't about your hiding information from me. This is about your hiding information from the American public. And if you're going to cut cancer research or gut mental health support, at least stand by your work and explain it to the American people. Now, Secretary Kennedy, I want to start with what I hope is an easy question for you. Do you think lead poisoning in children is a significant concern?
Is lead poisoning
in children a significant concern?
It's a extremely significant concern.
Thank you. Then I would like to know why your department has effectively shut down the very program to address lead poisoning in children. The city of Milwaukee requested assistance from the CDC to help the city respond to lead poisoning cases tied to public schools. 6 schools have been closed, displacing more than 1,800 school children. The request for federal assistance was denied because of lack of staff. The entire childhood lead poisoning branch has been fired. In the words of a Milwaukee mom, it really sends a message of, you don't matter. I don't know what you would say to parents who must now test their children for lead and deal with school closures. But do you intend to eliminate this branch at CDC, yes or no?
No, we do not.
Okay. Because you cannot tell us that you want to make America healthy again when you are willfully destroying programs that keep children safe and healthy from lead poisoning. Congress dedicated $51 million in funding for this particular program. But when a community asks for help to prevent lifelong complications for children, and there is no one there to pick up the phone, and it's not because this program is ineffective, it's because you fired the entire team whose job it is to support communities like Milwaukee.
If that money has been appropriated, we will spend that money. If it's been appropriated to Milwaukee, we will spend it in Milwaukee. I've spent a lot of time in Milwaukee
It's to
working on
provide
that.
expert, and the entire staff has been fired. Secretary Kennedy, I did note in your opening testimony, although we wouldn't know it from the skinny budget that we have, that you plan on funding the Head Start program. But I want to tell you about the ramifications of what has happened to date with regard to Head Start. I've heard from families across the state, people who are terrified about the uncertainty and instability surrounding Head Start. Just 1 week into President Trump's administration, Head Start programs in Wisconsin suddenly couldn't access their grant funding. It forced one Head Start in Waukesha, Wisconsin, to temporarily close, leaving 250 families without care. Over the last 4 months, HHS has provided roughly $1 billion less to Head Start programs across the country than during the same period last year. The delays in funding have exacerbated uncertainty for programs needing to make payroll. And in some instances, like the one I cited in Waukesha, programs have had to shut their doors until the payments came through. Now, I don't know what you would say to a parent who is unable to drop their child off at preschool because you failed to get already appropriated money out the door. Or maybe I should ask you, what would you say to a parent who shows up for child care or for Head Start and the doors are closed?
I would be very sad if somebody showed up. I fought very, very hard to make sure that there be
What
no
is
cuts.
causing the delays in
As I
Head Start
said,
funding?
I fought very hard to make sure that Head Start gets all of its funding next year.
Well, we need it this year, and why are there delays now?
I don't know that there are, Senator, and I will look into it, but I don't know. There should not be any delays. The funding is there. We are spending it. It's allocated. I don't know why there would be those kind of problems. I can tell you that within the agency, there were, there were people who wanted to make the Trump administration look bad, and that there were checks held up that shouldn't have been. I will have to look into that, Senator.
Thank you very much, Madam Chair. Secretary Kennedy, I want to talk to you about your relationship with this committee and this Congress. I want to talk to you about the statements that you made to the chairman of this committee and to members of this committee during your confirmation hearing about vaccines. You didn't tell the truth. I find that to be really dangerous for our relationship. If I were the chairman who believes in vaccines and voted for you because he believed what you said about supporting vaccines, my head would be exploding. In the hearing, you told us, quote, "I will not work to impound, divert, or otherwise reduce any funding appropriated by Congress for the purpose of vaccination programs." That's not the truth. You've done exactly. Let me finish my question.
Yeah, I didn't hear what you said. I'm just asking you to repeat it so I can understand your question.
During the hearing, I'll repeat it. During the hearing, you said to this committee and to the Finance Committee, "I will not work to impound, divert, or otherwise reduce funding appropriated by Congress for the purpose of vaccination programs." That is not what happened. You've done the opposite. You canceled $12 billion in grants to the states, including my state, that are used to administer and track vaccines. You promised Chairman Cassidy.
When did I do that?
Madam Chair, would you allow me to finish my question?
When did I do that?
Let me finish my question.
Accusation. Just tell me when I did it so I can understand what the question is.
You have canceled $12 billion in public health grants to states, whether you know this or not. That funding is used by the states in part to be able to administer and dispense information about vaccines. Mr. Secretary, let me give you the full panoply of
accusations,
the things you said before this committee that didn't turn out to be true. You also promised Chairman Cassidy that the FDA would not change vaccine standards from, quote, historical norms. But what happened as soon as you were sworn in? You announced new standards for vaccine approvals that you proudly referred to in your own press release as a radical departure from current practice. And experts say that that departure will delay approvals. You also said, specific to the measles vaccine, that you support the measles vaccine. But you have consistently been undermining the measles vaccine. You told the public that the vaccine wanes very quickly. You went on the Dr. Phil show and said that the measles vaccine was never fully tested for safety. You said there's fetal debris in the measles vaccine. And this morning—
All true.
This morning in front of—
Do you want me to lie to the public?
That's not— none of that is—
Of course it's true. Of course it's true, Senator. Senator, begging your progress, you do not know what you're talking about.
For the record—
Let's have a little bit of order so that you can get
Madam
your
Chair,
question and we can get
I didn't ask for a response yet.
I understand
I'd like
that.
to lay out the predicate of my question before I'm interrupted by the witness. He should
Go
have
ahead.
some respect for this committee.
Go ahead.
Just this morning in front of the House of Representatives, you also said that you, in fact, would not recommend that kids get vaccinated for measles. You said you would just lay out the pros and cons. Okay, so this is the summation of everything that you have said to compromise people's faith in the measles vaccine in particular is contrary to what you said before this committee. You said you support the measles vaccine, but then you have laid out a set of facts that are contested, and I will submit information for the record from experts who contest what you've said about the vaccine, and the result is to undermine faith in the vaccine. It's kind of like saying, listen, I think you should swim in that lake, but the lake is probably toxic and there's probably a ton of snakes and alligators in that lake, but I think you should swim in it. Nobody's going to swim in that lake if that's what you say. And so I want you to acknowledge that when you say you support the measles vaccine and then go out and repeatedly undermine the vaccine with information that is contested by public health experts, that is not supporting the vaccine. And so I guess I have two simple questions for you. One is, can you clarify what you said in the House this morning? Are you or are you not recommending that families get their children vaccinated, or are you just giving people the pros and cons? And do you understand that when you say these things about the measles vaccine, what ends up happening is less people get the vaccine? That may be what you want, but do you understand that the result of constantly questioning the efficacy or safety of the vaccine results in less people getting the vaccine? So I don't necessarily want to spend the remaining 20 seconds in an argument over the science, but do you at least understand that that's the consequence of what you're saying? And are you actually still recommending people get the vaccine, or are you not?
Senator, if I advised you to swim in a lake that I knew there to be alligators in, wouldn't you want me to tell you there were alligators in it?
So are you recommending the measles vaccine or not?
What I've said and what I said in...
Doesn't sound like you are, if that's...
Are you going to let me answer? Are you going to keep interrupting?
Are you or are you not?
Are you going to let me answer? What I pledged before this committee during my confirmation is that I would tell the truth, that I would have radical transparency. I'm going to tell the truth about everything we know and we don't know about vaccines.
Are you recommending the measles vaccine or not?
I am not going to just tell people everything is safe and effective if I know that there's issues. I need to respect people's intelligence.
I think you're answering the question. I think you're answering
the reason
the question. That's really dangerous for the American public and for families.
The reason people have lost faith in this program is because they've been lied to by public officials for year after year after year.
No longer recommending the measles vaccine.
Senator Marshall.
Senator also Brooks.
Thank you so much, Mr. Chairman. Mr. Secretary, I'm over here. I've been sitting through this hearing all day today and have noted that you've been unable, in most instances, to answer any specific questions relating to your agency.
Because I haven't been given time.
Well, no, you have been given time, but the point of the matter is you've been unable to answer specific questions. Sir, you are the wrong person for this job. And you had in this hearing today the unmitigated gall to say at the beginning of your testimony that China is ahead of the United States in healthcare because China does not have DEI.
I didn't say that.
Well, we can roll back the tape. You absolutely did say that.
And you will find I didn't say that.
That is absolutely what you said.
I was talking about science, and I didn't say they're ahead of us. They're ahead of us in some forms of science, certainly not in healthcare.
Well, we can roll back the tape, but nonetheless, let me go on with my questions and ask you this. You just heard about the Safe to Sleep campaign, and you have made cuts. You made it very clear here today. You have no knowledge whatsoever of the absolutely amazing scientists and researchers who you have callously fired. You know nothing about the cuts.
You didn't fire any working scientists, Senator.
That, sir, is not true either. But nonetheless,
but it is true.
It is not true. Let me ask you another specific question. The Safe to Sleep campaign, well, then can you name, sir, which office the Safe to Sleep campaign operates out of?
The which campaign?
Well, that's the one that the senator just asked you about 2 minutes ago that prevents babies from dying in their sleep. A 30-year program inside your agency. You would agree that it's important.
I think it's part of HRSA or ACF. It's ACF.
No, actually, it's in Health and Human Services. Yeah. And I think, and again,
no, they're all within Health and Human Services, but the subdivision is ACF.
No, actually, the name of the
Administration of Children and Families.
No, let me tell you what it is. The National Institute of Child Health and Human Development. This is actually the one that your aunt, Eunice Kennedy Shriver, is the person who it's named after. And you noted just a moment ago, the senator reminded you that although this is a very important agency, prevents babies from dying, this is the same one you fired every single person in this office as of April the 1st. It is also—
As I said, there were no working scientists fired during the RIF.
We can bring you that information later, but because what you just said is not true. Well, then the question also is, in addition to firing the individuals who make sure babies don't die in their sleep, Why did you cut funding and staff from the CDC's National Center on Birth Defects and Developmental Disabilities, which supports the Special Olympics? Was that a mistake? I've heard you say you've made some mistakes today. Was that also a mistake?
We switched those programs to the Administration for Healthy America. They have not been cut.
Well, the funding has been cut, and this is one that oversaw the Special Olympics. Are you aware of that?
We have not cut the Special Olympics.
You've cut the funding, and you also dismantled the Division of Reproductive Health and Women's Health and Fertility. You're aware of that, right?
We have, right now, we have 42 divisions that do maternal health, and we're consolidating them. And the mainstream media has portrayed those as cuts, but they're not cuts, they're consolidations. It's ridiculous to have 42 divisions that are all supposed to be doing the same thing with their own administrators.
Well, let me ask you a question. So that doesn't exist right now, it's been dismantled. That is a fact, that particular division, what you plan to do in the—
There's 42 divisions on maternal health we consolidated.
Sir, let me finish what I'm saying here. The fact of the matter is you have dismantled it as we speak. And are you aware, what does the assisted reproductive technology mean to you? Are you familiar with that?
Are you talking about IVF?
Well, it's assisted reproductive technology. It's a division. Do you know what it does?
Is it part of NIH?
No, it's actually a part of your agency. It's a
NIH is part of my agency, Senator. You should know that.
I do know that, but it's actually a part of, it's the CDC is where it is.
Okay, then it's CDC.
Right, okay. Let me just ask you, and again, these are all of the things you seem unfamiliar with, the programs that you've cut.
You're unfamiliar with my agency, that NIH and CDC are part of HHS.
Oh, I absolutely know. NIH is in my county. I was there this past weekend with the researchers that you have fired. So I absolutely know where NIH is, sir, and don't need any help from you in knowing that. I see the time. Thank you.
Senator Blunt. I'm not going to ask questions about specific issues about which I'm very concerned. I subscribe, frankly, to the remarks that Mr. Lauro, our ranking member, made, however, Mr. Secretary, with reference to my concerns about what is happening. First of all, let me ask you this. Sorry about that. You submit a budget, it goes to OMB, the president will submit it to us, and Congress passes a budget, sends it to the president, presumably the president signs it. Once that happens, do you consider that budget that Congress passes to be a suggestion or directive?
Well, as far as I'm concerned, it's the president's budget, and my duty is to defend it. It's Congress's choice about whether or not they're going to fund. The Congress appropriates the funding. Congressman, there's no agency head that I know of that wants to see his agency gutted or his budget lowered. There's tremendous waste in my agency. It grew by 38% during the Biden administration, and public health went down.
Okay, I got 5 minutes.
But I just say this. President Trump has a broader vision than me, which is that the $2 trillion we're spending a year that we don't have is landing on our children. That is a health crisis for them.
Mr. Secretary, my question to you respectfully was, do you believe it is a suggestion or a mandate? This is a very important issue, which we differ greatly with the administration and with Mr. Musk, that willy-nilly, without Congress's approval, they can remove things, take things away, defund things, fire people. That is not my proposition. I want to know whether it is your proposition. You've answered in the sense that once the budget is adopted, you need to carry it out. Now, whether that was President Trump that signed that budget or President Biden that signed that budget, I presume your premise is the same. Is that correct?
I don't know whether you're asking me a rhetorical question, because I think it's self-evident.
It's not a rhetorical question. It's whether or not you think once the Congress says we're going to spend X number of dollars on X objective, Y objective, that you will follow that.
Yes.
Okay, that's the answer I wanted.
Incidentally, that happens throughout history. The Republican
Throughout history, Mr. Secretary, with all due respect, you and I know this, Mr. Nixon said that was not the law, that he could take whatever and he took it as a suggestion, and he wanted to impound. And he did impound in the early 70s. And we passed an act that said you can't do that. Then the Supreme Court heard that case. And very frankly, one of the most conservative judges, Justice Scalia, said President Nixon, the Mahatma Gandhi of all impounders, asserted at a press conference in 1973 that his constitutional right to impound appropriated funds was absolutely clear. Scalia went on to say, our decision 2 years later in Train versus City of New York proved him wrong. That opinion has been reiterated by the Supreme Court subsequent to that decision. This is a critically important issue because there are conflicting opinions. We will try to come to consensus on that. The president has to sign the budget unless we override his veto of the budget. That becomes the law. We think, and a lot of courts over the last 2 months have decided that that law is not being followed. So that was my point. Now, let me ask you something. You've reduced the department by 20,000 people, as I understand it. You've been quoted as saying some of those firings were mistakes. In fact, of course, Musk fired 70% of the people when he bought Twitter and then brought a large number of them back because he found out, as you point out, not that with respect to that, but with respect to these 20,000 people, there were mistakes. My question to you is, have you had an analysis prior to making those decisions, or Mr. Musk making those decisions? And I ask you first, who made those decisions, you or Musk?
They were made, ultimately, we executed the decisions.
I know you executed them, but my question is...
Elon Musk gave us help in figuring out where there was waste, fraud, and abuse in the department. But it was up to me to make the decision. And there are many instances where I pushed back and said, we don't want to, that would hurt us to eliminate that group.
Let me ask you a question based upon that response. Was there an analysis of the consequences of these cuts and the reduction in force and elimination of programs? Was there an analysis that you can provide the committee that indicated those, as you concluded in your statement, would not harm people, would not undermine, frankly, the people who are being served, the health care not delivered, people not served, children not educated, research not accomplished, frankly, lives not saved? Is there an analysis that you can provide to this committee prior to us determining the budget that will show that, in fact, those cuts will not be harmful to those objectives?
Yeah, there were analysis. The simplest analysis was at the outset, the analysis that we're spending $2 trillion a year that we don't have.
Mr. Musk said he was going to cut
$2
trillion.
$2 trillion more than you have to make cuts. The other analysis that was more detailed is that
children or the Indians that you're so concerned about?
We didn't cut the Indians. We didn't cut the Indian services.
I'm asking you, you said we have to cut.
I made sure that those services were not cut. I made sure that Head Start was not cut. But the cuts that were done were cuts that were to duplication, to redundancy, to streamlining. We increased our workforce 70% in 4 years, so we were going back to the 2019 levels.
Mr. Reagan,
and I would ask.
Mr. Reagan said he was going to cut waste, fraud, and abuse. He increased the budget deficit by 189%, the highest of any president in history.
No analysis.
We're allotted 5 minutes, and I am trying to be lenient, instead of cutting somebody off in mid-sentence. But if y'all could be respectful to me so that we can sort of wrap up when I start tapping. So,
Markey.
Thank you. Mr. Secretary, all I've been hearing from you today is your defense of and advocacy for brutal cuts to Medicaid, brutal cuts to NIH research to find the cure for Alzheimer's and cancer and other diseases, brutal cuts to community health centers, brutal cuts to the CDC, the early warning system for diseases, and all to find the funding for tax cuts for billionaires and millionaires. That's all I've been hearing. And it is absolutely unbelievable that the Secretary of Health and Human Services can sit before the Health Committee and make such an argument. So Secretary Kennedy, for months I've been hearing from people about the impact that you and Donald Trump have had on them. And for months I've been sharing their stories, and I've compiled them here. And Mr. Chairman, I'd like to include my Make America Sick agenda.
Without objection.
Included in the record. Thank you. This is a set of stories that are being told to me that I would like to relate to you. Jennifer, who's from Massachusetts, is a stage 4 cancer patient. There is no cure for her diagnosis. Her life depends on federal investment in research and for clinical trials to continue uninterrupted to find a cure for Jennifer with NIH funding. She's right to be worried. I heard from Henry in Rhode Island, who wants a continued funding for cancer research where he works. He's worried about getting fired because the lab's NIH grants under new leadership were cut. He wants to work on cancer research to find the cure for Jennifer. You've already terminated $1.8 billion in NIH funding, which for Jennifer should really stand for National Institutes of Hope. She's losing hope. You're defending a 40% cut, Mr. Secretary, in research for Alzheimer's, for cancer, for stroke, for diabetes, for mental health. They're being slowed, they're being slashed. And I understand streamlining, but this is not streamlining. It is a bludgeoning of our health future and a giveaway of our global scientific leadership, and it will be people like Jennifer who will pay the price. Lou from Massachusetts, he wrote to me about his son who died of an overdose. He said his son Zach was, quote, a loving and loved family member who had the illness of addiction. He wants research to cure this disease, funding for treatment without stigma, support for health workers serving people with addiction to prevent any other family member from suffering from the same fate. Can you honestly tell us that, or tell him, actually, that you can cut $1 billion from the Substance Abuse and Mental Health Administration, including funding for programs to teach first responders how to use naloxone, to help to guarantee that other parents not lose their children? Can you honestly tell me that the cuts you have already made to addiction treatment across the country will make anyone healthier? How can you justify a $1 billion cut to substance abuse and mental health, Mr. Secretary?
Senator Markey, you weren't here when I was talking earlier, but one of the things that I've talked about is that the budget for my agency increased by 38% over the Biden administration, and Americans got sicker, and more Americans overdosed, and more Americans died from cancer, and we have now an epidemic of colorectal cancers in our children, and the chronic disease rate has now gone up to 60%. The autism rate has dropped to 1 in 31 children. And all that money that was supposed to cure those diseases or avert them, none of it worked. All we need is leadership and a new vision, and I'm bringing that to my agency. And I'm realigning my agency.
President Trump is negotiating with the Chinese about keeping fentanyl out of our country.
Well, that's a good thing, isn't it?
Well, in the meantime, we can't be cutting the programs for the people who are already suffering from opioid-related diseases. We can't cut the programs. Yes, it would be great if we could cut it. It would be great if we could reduce it. While we're waiting for that to happen, why would we cut $1 billion from the programs that go to the families that have the substance abuse issues right now? Why would we cut it now before we get a solution to the problem? They need
First of all,
now.
Most of the programs that support addiction, including naltrexone, Narcan, Suboxone, methadone, housing, we operate under SAMHSA 500 rehabs that give people access under Medicaid. We are keeping those intact. We have President Trump, because of his leadership, has dropped the fentanyl imports from this country because of his leadership at the border by 40%. So we're actually doing more with less, and we are going to continue to do that. And what I'm doing at my agency is I'm realigning all these perverse incentives that have driven up costs and driven down health. I'm realigning so that people can make money in this country and markets can make money.
Look at 80,000 people died last year. This is not about efficiency. This is about cruelty. Cutting these programs. These people are already addicted. These people already need help. You're slashing
Senator
the
Markey.
programs that families need right now.
Senator Markey.
Thank you, Mr. Chairman.
Oh, thank you, Mr. Chair, and Secretary Kennedy, thank you for being here. I'd like to start by talking about the current measles outbreak, which I know is a concern for all of us here today. 2 children in Texas have tragically died from measles this year, the first children to die from measles in our country in more than 20 years. Measles is almost completely preventable with the measles vaccine. As you know, it's critical that families hear directly and clearly from healthcare leaders about how they can best protect their children. So, Mr. Secretary, I'd like to give you an opportunity to say clearly here today to any parents who are watching that the best way to protect their children from measles is to vaccinate them.
Yeah, I've said that the best way to stop the spread of measles is through vaccination. But I would say this. We have handled this measles outbreak. We get a measles outbreak every year. We've handled this measles outbreak better than any other nation.
What I was interested in, I'm just, you can say, what I asked you to do was to say straight to the camera, as you did on social media, that it is your position that the best way for parents to prevent their kids from getting measles is to vaccinate them. And that is your statement today.
I said that too.
Right? All right, well, that is great, thank you. Now, you lead the nation's health department, so let me ask you a couple of questions. Do you think HHS should employ anyone who has endangered the health of children?
No.
You hired David Geyer to lead autism research at HHS, an individual who fraudulently posed as a doctor and gave dangerous medications and medical tests to children with autism. According to the state of Maryland's investigation, David Geyer, who has no medical license or training, gave hormone blocker injections to children with autism who were as young as 8 years old, which the Maryland Board of Medicine said poses a substantial risk of harm. Secretary Kennedy, yes or no, will you fire David Geyer?
First of all, what you're saying is not true. And we did not hire David Geyer to manage autism research at HHS.
So what is his job? What is his job then?
You just said some very defamatory
things
about a person who, by the way.
So let me just be clear for the record.
Those charges, Senator, I am going to correct the record on this. Let me
tell you what the record says, and then I will hear from you. Last week, when Mr. O'Neill was here in his confirmation hearing, I submitted for the record the charge that the state of Maryland laid out. Now, if you'd like also for me to submit to the record with unanimous consent today the findings of the state of Maryland, which fined him $10,000 for practicing medicine without a license. He does not have a medical license, and for providing and instructing and giving children hormone blockers. That is what the finding of the Maryland Department, the state of Maryland, its medical licensing board was. And I'll submit that for the record, I hope with unanimous consent.
I'm assuming that you don't know what I'm about to tell you, or you wouldn't say something that was so dishonest. You may or may not know that David Geyer sued the American.
I do know that. I do know that. That doesn't change the findings, nor does it change the experience of the parents who testified.
That finding was reversed by court, and he was awarded $5 million.
That is not true. Now let me ask. So I just want confirmation. David Geyer is still at HHS. I wrote you a letter about this a month ago, and you have not responded.
Well, I apologize for that. That's our bad, and I will respond. But David Geyer is not managing autism research.
So what is his job? What is his job at HHS? This is somebody who gave parents the impression that he was a doctor and gave hormone blockers to children as young as 8, telling them that hormone blockers would somehow magically help their kids with autism.
His father is
His father is a doctor, but he is not. And his father was
And
not
as
in
I
the
said,
room and did not, and he faked his father's signature according to the State Board of Medicine.
And that ruling was overturned by a court. So what you're saying is just wrong. It's just a lie. And they were actually, the court said that the Maryland Board of Physicians was guilty of actual malice in fabricating those charges against David Geyer.
Well, we will pursue this.
Yeah.
And I will submit for the record.
So do you want to know why we brought David Geyer in?
Sure.
Because it wasn't to run autism research. In 2002, the CDC runs a vaccine safety data link, which is supposed to be the vaccine information for the biggest HMOs that are supposed to allow CDC to have a surveillance system for vaccine injury. It's a backstop system. The CDC will not let any physicians in there to look at it or any scientists, independent scientists.
He's neither a scientist nor a physician.
Right. Congress ordered CDC to open it to the Geyers. So they are the only scientists who have ever been in there.
But again, Mr. Geyer is not a scientist. Thank you.
Independent scientists.
Okay, Senator Hessen's time's expired, but before we move on, did you have a unanimous consent request that I heard in there, Senator?
You, Senator Hawley, I did. A unanimous consent request for the printout of the website that shows Dr. Geyer is not Dr. Geyer, that's his father, Mr. Geyer, is employed, and also a unanimous consent request for the finding from the Board of Licensing in Maryland.
Without objection to both of those. And now, Mr. Kennedy, before we get to my time, do you want, if you'd like to finish your response, go ahead, and then I'll recognize myself.
David Geyer is the only living independent scientist who's seen the VSD inside. There's been a lot of monkey business with the VSD, including allegations of fraud. And he was hired by an independent contractor not as an HHS employee, but by an independent contractor to look at the documents that we were getting to the VSD to see if they conformed with what he saw between 2002 and 2016. And that's the only reason that he was brought in, to see if there was, there's so much information that has disappeared from that database. The only way we could find out what information disappeared was because he was the one guy who saw it.
And just let the record show he's not a scientist. Thank you very much.
All right.
Thank you, Mr. Kennedy. I want to ask you some questions about staff reduction and kind of the timing of it. You were confirmed by the Senate on February 13, so I'm sort of assuming that things happened before you were confirmed were other people's work. On January 28, the fork in the road letter came out to people across the federal employment space, widely attributed to OPM and Elon Musk and Doge, but that was before you were confirmed, so you had nothing to do with the fork in the road letter, correct?
Correct.
Okay. You were confirmed on February 13. On February 14, one day later, HHS announced that 3,500 probationary employees were going to be laid off. I know you're a hard worker, but am I right to assume that in the one day between your confirmation and the next day, you weren't the primary decision maker about laying off probationary employees at HHS?
I was aware of it, and I could have blocked it.
Yeah, you were aware of it, so you weren't the primary decision maker. Was that a decision that was made like OPM or Doge? And because it wasn't just HHS, it was all federal agencies who would lay off probationers. Do you know where that decision was?
I had my full upper staff in place before I got there.
Right, but did they make the decision, or was it White House and Doge to lay off probationary employees?
They made the decision. My staff made the decision, although Doge came in and Doge gave us information that we wouldn't otherwise have had access to.
Okay. Next, we go to April 1st.
I can also say this.
No, all I asked was if you made it, and you answered the question, and I appreciate it. April 1, HHS RIFs 10,000 employees effective June 2. Now, by this point, you had been secretary for about 6 weeks. A few days after that announcement, HHS staff briefed our staff, the Senate help staff, and basically, just here's some highlights. In that 10,000 RIFs, 467 staff at the Administration for Children and Families, 2,473 at the Centers for Disease Control, 322 at CMS, 400 at HRSA, 1,312 at National Institutes of Health, 197 at SAMHSA, 2,519 at the Food and Drug Administration. By now, you've been secretary for 6 weeks, so this was RIFs, not the forks, but you were involved in the decision about these 10,000 RIFs, correct?
Yes.
And in tandem with your leadership team, correct?
Yes. And as I said before, I pushed back on certain ones and canceled certain ones.
Yeah. I think yesterday, it may have been earlier today, you confirmed that 20,000 employees have been let go, at HHS, 10,000 RIFed and 10,000 forked. Do you know how many of the 20,000 were veterans?
No, I do not.
That is a fact that's very easy to determine from someone's personnel file. So I'm going to ask that question for the record. We are finding across the government that veterans are disproportionately being let go, A, because they're a higher percentage of the federal workforce, and B, they're a dramatically higher percentage of probationary employees because they leave military service after 10 or 25 years, and then they're probationary new employees when they join the civilian service. So I want to find the answer to that question. Where does the rubber meet the road on 20,000 RIFs and layoffs and forks? In people not getting cancer trials, and I appreciate your willingness to help Senator Murray's constituent, in state grants being canceled, in Virginia losing $425 million in funding to the Virginia Department of Health. But here's a small example. All of our offices do casework. All of them do casework. And we get requests from constituents all the time. CMS is the largest agency in the federal government. Its budget is nearly twice the size of the Pentagon. And people who depend on Medicaid, Medicare, and the SCHIP program really, really depend on it. And it's the most consistent in the top 3 or 4 in terms of constituent requests to my office. Answer this question about Medicare or Medicaid or the SCHIP program. In every administration I've served with, Obama, Trump 1, Biden, I get answers to questions on behalf of constituents. I may not get them as fast as I like, and sometimes I like the answer and sometimes I don't. But let me show you what CMS is now doing to answer constituent questions. I've omitted the name of the constituent, and I've omitted the name of my staffer. This was very recent. A hardworking retiree, patriotic taxpaying American who's on Medicare wrote to ask CMS a very simple question about Medicare. Couldn't get an answer. Asked us to reach out. We reached out to the Medicare Part C and D Congressional Liaison Office. And here was their answer to our basic question. Unfortunately, there is not an update to provide. With the recent change of administration, we are unable to provide any information related on matters related to Mr. X's request, Congressional Casework Team. I mean, if you're just an everyday, hardworking American retiree on Medicare, and you have a basic question about it, you ought to be able to get an answer. And I'm just going to say, I've shared this with my colleagues, and many of us are having the same experience where our constituents can't get a basic question answered. I wonder if 20,000 fewer employees is connected to this. I yield back, Mr. Chair.
Mr. Secretary, Madeline Dean, Suburban Philadelphia. Thank you for being here. I want to read the very first sentence of your written testimony, which you have submitted. The mission of the Department of Health and Human Services, HHS, is to enhance and protect the health and well-being of the American people. And we are here to analyze the 2026 budget request, as the chairman points out. But I also want to take a look at what the ranking member has taken a look at, which is the cuts going on right now to that which has already been appropriated. We have to really keep a clear line here between what's your proposal for 26 and what is going on right now against the legislation that we have passed and that has been signed into law. I have to tell you that I'm more interested in substance than slogans. I'm getting a little lost in the MAGA, the MAHA, now there's AHA. I don't know where we're going with this. I want to talk about the substance. And in this case, something very personal to me is the issue of addiction and mental health. And I know what you care deeply about these issues. I know you have been honest about your own recovery, your own struggle with addiction. In my family, my middle son, Harry, is now 12 and a half years in recovery from opioid addiction. It was a long road. It was a hard road. In active addiction, you know how difficult it is, and it's difficult to bring a family member back. I give Harry great credit. He now works in the area of addiction. That's why I'm very, very worried about what is going on with SAMHSA. If you take a look at the data, the numbers, we were getting somewhere. 2 years ago, 3 years ago, we were losing 110,000 people a year to overdose. That's 300 people a day. I call that a jetliner a day of souls crashing to this country. Just last year, the second half of 23 and the first half of 24, 12 months, that number went down 27% to 81,000 deaths of overdose. Don't let me minimize 81,000 deaths. That's still 220 people a day. Today, tomorrow, yesterday, 365 days a year. But a 27% reduction in overdose deaths in this country, overdose is still stealing a generation in this country. So why in God's name are we shuttering SAMHSA?
We are not shuttering SAMHSA, and I share your concerns, and I'm anxious to work with you on this problem. I'm fully committed to it. Because of my own history, I lost a brother to overdose. I lost one of my nieces during the pandemic to overdose. Like every family in this country has somebody that was lost. As you point out, we were losing, I think, 3 years ago, 106,000 American kids. It's double the number that we lost during the 20-year Vietnam War. And we ought to be applying the
Why
same
the cuts to
resources.
SAMHSA? And why are you shifting?
We are not
you've already
shuttering
cut.
SAMHSA. We are still running 500 addiction centers.
You've already
across-
cut SAMHSA, and the budget proposal is to shutter it and shift it to an AHA program, which I don't know what AHA means.
To shift it to the Administration for Healthy America. We're shifting a lot of the chronic disease programs out of CDC into a center that will address chronic
And you and I
disease.
agree that addiction is overdose is a public health epidemic in this country.
Yes.
Then why would we, when we are finally seeing some success, bury that success, put it in an AHA program, which, by the way, logically doesn't make any sense. We have to now rehire people and figure out what their roles will be within AHA. Why wouldn't we analyze the data that shows we just saved 20+ thousand lives in the course of 1 year? This matters in my district. I have buried way too many kids to overdose, to fentanyl poisoning, by the way. You don't have to be an addict. You can just be poisoned by fentanyl. Why in God's name are this administration wants to shutter it? We know that, and shift it into AHA. Why would you do that?
They don't want to shutter. What we want to do is we want to shift that function into a place where we're going to be able to administrate it more efficiently, and that's all.
What analysis was done? Can you show us the study that led you to the decision, shutter SAMHSA, shift it, we call that shift and shaft in my old days as an appropriator in Pennsylvania, shift it over here, throw it in a block grant program, and good luck. What's the analysis that you did that said, whatever SAMHSA was doing with harm reduction, by the way, with making naloxone available, with training for naloxone, I literally carry this with me every day. I want to normalize the life-saving capacity of naloxone, and you guys want to bury it in AHA.
Oh, we want to provide naloxone, Narcan. We want to make sure that addicts have every option.
You're eliminating the training for that.
Suboxone to methadone and to
Medicated
12-step programs to inpatient, outpatient.
You're
We run
zeroing
500
them out.
we run 500 addiction centers. We're not going to stop doing that. My agency will still do it.
Are you looking at?
It's shifting to a subdivision where we can operate it more efficiently with other chronic diseases.
But do you realize that
CDC is going to do infectious disease, which is why we created it. It had mission creep, and it was operating with
mission creep as it was saving lives?
mission
Mr.
creep.
Secretary, I beg of you, talk to these families. You know these families. You are these families. Help us save more lives. Don't shift it and shaft it.
Mr. Clyde.
Thank you, Mr. Chairman, and thank you, Mr. Secretary, for being with us this morning. I first want to address a comment that was made by the ranking member earlier as it relates to getting the president's budget out. Just a reminder that when President Biden was elected, he did not send out his first presidential budget until May 28th. of 2021. So giving some grace to a new administration, I think, is warranted. I want to take a minute to highlight the Oklahoma Medical Research Foundation, or for short, OMRF. OMRF was chartered nearly 79 years ago and started out with 18 scientists on staff. They now have more than 475 scientists.
At which?
It's the Oklahoma Medical Research Foundation, and I've actually given your team some information. Last month, I was proud to attend a ribbon cutting for their new Biomedical Data Sciences Center, which will provide computing and data analysis capabilities to support scientists in researching very important areas, including heart disease, cancer, and autoimmune diseases. This center cements OMRF as a leader in research methods and as a hub for collaboration in my district. It is important that OMRF continue their partnership with HHS in their research to expand life expectancy and healthcare outcomes across the nation. The impact that OMRF has had on Oklahoma and the country is really immeasurable. It ranged from certainly economic impacts to healthcare advancements, community engagement. The positive impacts are endless. And I want to mention them because, I want to make sure that we're investing in the right things. Like you and President Trump, I am focused on reducing the prevalence of chronic diseases. And the discoveries that they have made over the last many years have produced 3 life-changing drugs. Most recently, in 2019, the FDA approved the first targeted therapy to treat sickle cell disease. And this is based on discoveries by OMRF researchers. The point being here, Mr. Secretary, OMRF has been crucial in advancing research and treatment of chronic disease and rare diseases for millions. And they take pride in being one of 7 NIH autoimmune centers of excellence. And I hope you and your team will continue to work with OMRF so they can continue the positive impact in Oklahoma and across the country to make America healthy again. That being said, in order for the U.S. to maintain its lead in biotechnology, we need to ensure that the U.S. continues to be the country of choice for best and brightest in the field. What will HHS do to help attract biotech researchers?
Well, we spend already, at this juncture, 70% of the research funding in the world on biotech and biomedical research is coming from my agency. And we understand that it's our aspiration that the United States remain the hub of biotechnology around the globe. We need to change some of the FDA policies to make it, to give a faster track for biotechnologies to get approved. We're working on that now. We're trying to reform phase 3 studies, for example, which are the longest, the most expensive to do a lot of those functions by AI. We're phasing out most animal studies at NIH and FDA, which again is a very expensive part of the process. And because we can accomplish a lot of those goals on safety and efficacy with AI technologies. We brought the best AI developers in the country into HHS. Nothing like this has ever happened before. People walking away from billion-dollar concerns to come and work for us, to transform our agency into a central hub for AI on the globe. And a lot of that, those changes are designed to make it easier and faster to get, biotechnology to market.
Perfect. Can you talk a little bit about the changes at NIH in particular? I know that there's been a lot of conversation around that. Certainly streamlining is part of that. But can you talk a little bit more about what your vision is for NIH moving forward?
Well, NIH, when I was a kid, NIH was the premier gold standard scientific institution in the world. Over the years, it was captured by industry and by, I think, a kind of ossification that happened at NIH. Because of the longevity of some of the leadership there. And there was a tremendous amount of corruption. And, part of that corruption is we now have the CIA, the FBI, the Department of Energy, and the Department of State all saying that the COVID-19 pandemic came out of research that was then sent over to China, and that was the end point. We also have the sickest people in the world. NIH, with the best science, is supposed to be protecting. We should be the healthiest people in the world. We're switching the trajectory so that we're going to really focus narrowly on chronic disease, ending the chronic disease epidemic, and then we're going to make sure that the science cannot be corrupted. That every scientific study is replicated, that the raw data for those studies is published, that the peer review for those studies is published. And that we're going to focus on making sure that we get to younger scientists rather than the old boys network. And I could talk to you about scientific corruption all day long, about horror stories that we know have happened within NIH. One of those, probably the worst, is the amyloid plaque scandal. For 20 years, because of utter corruption and fraud, we were directing Alzheimer's research to one hypothesis, and any other hypothesis was shut down. We should have the cure for Alzheimer's today. We don't have it purely because of corruption at NIH.
Ms. Frankel.
We are going to have it quickly.
Ms.
Thank you,
Frankel.
Mr. Secretary.
Thank you, Mr. Chair.
Sanders for his opening statement.
Thank you, Mr. Chairman, and Mr. Secretary, thanks for being with us. Let me begin by quoting a sentence that came from your prepared remarks. You state, and I quote, "The United States remains the sickest developed nation, and we spend $4.5 trillion annually on health care, 2 to 3 times more per capita than comparable nations. Clearly, something is structurally wrong with our approach," end of quote. You're right. The current healthcare system is broken. It is wildly expensive. It is dysfunctional. So what do we do, Mr. Secretary, to address it? Maybe for a start, we do what every other major country on earth does and recognize that healthcare is a human right guaranteed to every man, woman, and child. Maybe we understand that the function of a rational healthcare system is not to make hundreds of billions of dollars in profit for insurance companies and drug companies who often engage in stock buybacks, pay their CEOs outrageous compensation packages. There was a guy from one of the major drug companies sitting exactly where you are sitting last year. A guy makes $50 million a year. Meanwhile, we don't have enough doctors, we don't have enough nurses, we don't have enough dentists, we don't have enough pharmacists, we don't have enough healthcare workers in general. You are right. The system is structurally broken. We spend far more, we have a shorter life expectancy than other countries. So this is an issue that I want to address with you. How, in fact, do we guarantee health care to all people and do it in an effective way? Let me say a word about prescription drugs. You and President Trump had a press conference earlier this week discussing an executive order that both of you claimed would make sure that the American people pay the lowest prices in the world for prescription drugs, not the highest. As you mentioned at your press conference, this is a concept that I personally strongly support. I think you are aware of that. But as President Trump and you should know, this executive order, like Trump's previous executive orders on the subject, will likely be thrown out by the courts, and we will be back to exactly where we are today, paying by far the highest prices in the world for prescription drugs. In my view, the way forward is through legislative action. So, if you and President Trump are serious about significantly lowering the outrageous price of prescription drugs in this country, as I hope you are, I would very much appreciate both of you working with me and other people on this committee and in the Senate on legislation that I will soon be introducing, which accomplishes exactly the same goal as you and the President talked about, making sure that we pay no more for prescription drugs than people in other major countries. So if we are serious about that, let's work together and let's make that happen. And in fact, if Republicans and Democrats come together on this, if we prioritize it, we can pass that legislation in a couple of weeks. Thirdly, Secretary Kennedy, all of us want to make the government more efficient and cost-effective, and few would deny that there is too much bureaucracy. But let me tell you also what we want and what the American people want. And that is, we want the federal government to play a major role in continuing its efforts to combat such terrible diseases as cancer, Alzheimer's, diabetes, heart disease, and other terrible illnesses that claim the lives of millions of Americans. In that regard, I must tell you that I have heard from citizens, patients, and doctors in Vermont and all over this country who are deeply concerned that under the leadership of you and Mr. Musk, the Trump administration has terminated at least $13.5 billion in health care funding, including more than 1,600 grants to conduct vital research into cancer prevention, Alzheimer's, diabetes, and cardiovascular disease, among many other medical research investments. In the first 3 months of this year, the National Institute of Health has been effectively cut by $2.7 billion, a 35% cut, reversing over a decade of investment in medical research. Under your leadership, cancer research has been slashed by 31%. Further, Secretary Kennedy, under your leadership, you have undermined the vital role vaccines play in preventing disease during the single largest measles outbreak in 25 years, which has led to over 1,000 cases of measles, over 125 hospitalizations, and 3 deaths. And let me say a word about USAID. Elon Musk, the richest man on earth, who has led the effort to cut health and nutrition programs for the poorest people on earth, has absurdly suggested that no one, quote unquote, no one, has died from the massive cuts to USAID. Mr. Musk is 100% wrong. According to independent researchers, nearly 200,000 people have already died throughout the world as a result of the massive cuts in funding to prevent malaria, tuberculosis, HIV, malnutrition, and other serious diseases. Further, as a result of the elimination of U.S. funding for a global vaccine program, it has been estimated that over 1 million children will die because of the cuts that will save taxpayers very, very little money. So let me just conclude by saying this. The United States of America is the wealthiest country on earth. We should have the best healthcare system in the world, not one of the worst. Given our purchasing power, we should be paying the lowest prices on earth for prescription drugs, not the highest. Instead of giving hundreds of billions of dollars in tax breaks to the richest people in this country, we should be proudly investing in coming up with cures for cancer, Alzheimer's disease, diabetes, and other terrible illnesses. That is what we should be doing. But I am afraid that in too many ways, we are doing exactly the opposite. Thank you, Mr. Chairman.
Thank you, Mr. Chairman. Mr. Secretary, nearly 7 million Americans are living with Alzheimer's disease, and caring for people with this devastating chronic disease costs us some $360 billion a year. I am the author of a law that's known as the BOLD Act. It takes a public health approach to Alzheimer's. It educates providers, promotes earlier diagnosis, it helps caregivers, and it also promotes lifestyle changes. I have worked very hard to make sure that HHS has the resources to carry out this law, which was just recently extended. I'm concerned that the reductions in force of approximately 10,000 staff across HHS will completely undermine this act. And this act, in many ways, is very consistent with your approach of looking at public health issues for chronic diseases. For example, the Healthy Aging Branch administers the BOLD Act for Alzheimer's. It has lost all of its staff. So how can you ensure that the CDC continues to implement the BOLD Act and the Alzheimer's programs under it when all of the staff responsible for that administration have either been placed on administrative leave or let go?
I don't know enough about that program, but I know that under that division has been folded into the Agency for Healthy America. And a lot of the reports that whole divisions have been liquidated were just wrong. They were divisions that were being reassigned under the reorg. Now, I'm under a constraint here because at 4 o'clock yesterday afternoon, we were told that a federal judge granted a TRO in our case on the reorg. And my attorneys have asked me not to talk about any details of the reorg today. But on that budget line, I will work with you. I'm committed. Alzheimer's is run in my family. As you know my cousin Maria Shriver, who's deeply involved in it. The NIH had a very, very checkered history on studying Alzheimer's because of the amyloid plaque scandal. And we have an opportunity now to do really good science and find a cure very quickly, and also find out, equally importantly, why so many people are getting Alzheimer's in this generation. I want to make that happen. I want to work with you, Senator, to make sure that that happens and that those programs continue.
Thank you. I chaired recently the first Appropriations Committee hearing of the year, and we focused on biomedical research and how important it is that America not lose its global edge in innovation that's producing life-saving and life-enhancing discoveries. As among the many issues that we covered, as you might expect, the hearing explored the 15% arbitrary one-size-fits-all % cap that NIH has imposed on indirect but still research-related costs for its grants. What we heard is that this cap will mean less basic research, fewer clinical trials, and that it will also cause our scientists and researchers to leave the United States and go to other countries. I believe strongly that this proposed cap is poorly thought out, that it's harmful, and I know that it violates current law because since 2018, we've included in the appropriations bill specific language that prevents NIH from imposing such a cap. So I know the system needs to be looked at, but are you reviewing how NIH's approach of this one-size-fits-all 15% cap on indirect costs would affect laboratories, whether they're private nonprofit labs or whether they're in universities, as far as doing crucial biomedical research?
Yeah, Senator, we are, and you and I have talked about this issue. And I think the impetus for the cap was that there were a lot of private universities with giant endowments like Stanford and Harvard that were getting indirect payments of 78%. What that means, if you get $1 million grant, NIH then has to pay you an extra $780,000 for administrative costs, and a lot of those costs weren't even going to anything to do with science. They were going to, the university budget. And in order to curb that abuse, we adopted a 15%, which is the industry standard. That's what the Gates Foundation or any other foundation would pay. But I understand the University of Maine, University of Alabama, many other universities, state universities, were not abusing it. We lost about $9 billion a year in those kind of costs. And And so we have a plan for how to address issues like what's happening at the University of Maine. I'm being gavelled out, so I will talk to you privately about that.
Thank you.
Secretary Kennedy, different subject, on a different subject. You and I have talked before, when you've been before this committee, and you and I have talked in person a number of times about mifepristone. I just want to follow up with you because since the last time you were before the committee and the last time you and I spoke, there's been a major study by the Ethics and Public Policy Center of 865,727 prescribed cases of mifepristone abortions, chemical abortions, between 2017 and 2023. Have you seen this study? Are you familiar with this? Do you know what I'm talking about?
Yes, I am.
You will remember then that this data shows the biggest study on mifepristone done, I think, ever, and it showed that nearly 11% of women experience very serious adverse health effects, to include sepsis, hemorrhaging, infection, of course, emergency room visits. Now, by the way, that's 22 times higher. That rate is 22 times higher than the FDA's current label, which says it's just 0.5, the incidence of serious adverse health events. So my question to you is this. You previously testified to the committee that you would do a top-to-bottom review of mifepristone. Mifepristone is subject to a REMS currently. You have said you'll do a top-to-bottom review. Do you continue to stand by that, and don't you think that this new data shows that the need to do a review is in fact very pressing?
I think the new data, first of all, it validates the CAS study, which is previously probably the most comprehensive data that we've seen on it, and it is, and it's alarming, and clearly it indicates that at very least the label should be changed. I've asked Marty McCary, who's the director of FDA, to do a complete review and to report back.
Good. Do you have any sense of timeline, Mr.
I do
Secretary,
not.
with that? It will be a top priority, though, for you. Is that safe to say? You say that it probably indicates the label needs to be changed. Do you think it's also important as part of your review to consider whether it's necessary now to put back in place the longstanding safety protocols that always accompanied mifepristone until the last administration? In-person dispensing, doctor visits, screening for ectopic pregnancies?
I know that Marty McCary will make a recommendation. I feel that the policy changes will ultimately go through the White House, through President Trump.
But you'll make a recommendation based on the data?
Yes.
Good. On a different subject, talking about the advertising that is routinely done by pharmaceutical companies, you have been a longtime critic of direct-to-consumer pharmaceutical advertising. You wrote, I think, in the Wall Street Journal a little over a year ago about the need to revisit guidelines around pharmaceutical advertising. Is that still your view? I mean, has your view changed?
Pharmaceutical advertising is particularly insidious because, commercial advertising has some level of First Amendment protection, not as great as political speech. It doesn't have the kind of strict scrutiny applied to political speech. It still has a level of protection. But pharmaceutical advertising is unique because if a company is advertising, for example, Coca-Cola, the consumer has a choice to whether to buy it, and then he's spending his own money on it, so he's got skin in the game. With pharmaceutical advertising, the consumer's purchasing the product, and it's usually the most expensive form of the product, so that they're usually advertising because they want to bury the existence and the availability of generic drugs that are much cheaper and equally effective. And the consumer is spending not his own money, but most often our money, taxpayer money. Furthermore, the pharmaceutical ad is getting tax deductions, so we are funding it.
I want to ask you just about that. Under current law, pharma companies can deduct their advertising costs as a business expense. Do you think it's time to change that?
Yeah, and I've actually have a call into Scott Besant about that, but I'm working very hard on this issue, and we expect to come out with a policy within the next few weeks.
Well, let me propose that we work together. Today, I'm introducing legislation to repeal the tax deductibility of these advertisements. It is a bipartisan bill with Senator Shaheen on the other side of the aisle here. It is a bicameral bill with both the Democrat and Republican sponsors in the House of Representatives. And my view is it's time to get rid of these tax breaks for these companies and to end this practice. Can you support that?
100% support it.
Fantastic. I look forward to working with you on that. All right, let the record reflect I'm giving up Senator Hickenlooper 15 seconds of my time.
Senator Sanders will also support that.
Absolutely, and I'll go further. The idea you
This
want
is
to do-
coming out of your time now,
All right.
John.
The answer is yes.
All right, Senator Hickenlooper.
Senator Scott.
Thank you, Mr. Chairman. Thank you, Secretary Kennedy, for being here with us today. I oftentimes hear you say the quote, happy to work with you. And I will say that you said it to Senator Kennedy, and as a person who's asked you to work on a number of topics, when you say happy to work with you, you've actually been a man of your word. And I truly appreciate that. We talked about the importance of sickle cell anemia and the research being done, and I invited you down to South Carolina, and you took me up on my offer. You came last month, and I really appreciate you taking the time and investing the energy to talk about an issue that's critical to so many folks, specifically African Americans. And as a guy that is thankful that we are working to eliminate diversity, equity, and inclusion in the federal government, I do not want some folks to think that all things racial are somehow DEI. And frankly, sickle cell anemia is a classic example of something that has a racial nexus, but it's not diversity, equity, and inclusion. It's just a basic fact that African Americans, 99.9% of the time, are the folks that are suffering through sickle cell anemia. And frankly, if you go beyond sickle cell anemia, you find other diseases that have a consistent presence in minority communities. And to that end, I think it's really important that we continue to work together on building on issues impacting minority and other communities. And I would love, Secretary Kennedy, as you move through this reorganization that you are currently going through, I would like for you to answer the question, will you commit that programs involving minority health will continue and not get tied unnecessarily and inappropriately to DEI?
Yeah, absolutely. We will continue. I think that one of the minority health programs has been terminated, and it was one that was deeply embedded with the DEI ideology, but there are 7 others that are going to continue. I want to thank you for inviting me down to South Carolina. That was a wonderful trip. It was really, I got to witness a microcosm, a template for how medicine ought to be working.
Yes.
You have brought together under your leadership hospital systems, pharmaceutical companies and the biotech companies that developed this new technology for treating sickle cell. And and patients. And they had all worked together to make it affordable so that South Carolina now has this extraordinary program where if you have sickle cell in South Carolina, you can get 100% funding with, I think it's 100% cure or close to it.
Very close to it. Thank you. I'll just ask the 2 questions as opposed to asking the preliminary to the questions. For all the parents of children with sickle cell, can you please just reassure them that the Administration of Health for America will work on sickle cell and addressing minority health issues? It's a simple yes or no. And will the full budget, and when it's released, reflect funding at AHA for both the Office of Minority Health and sickle cell activities that used to be housed in CDC?
Yeah, absolutely. My commitment. In fact, I had a company in this morning meeting with FDA that has a new technology that it seems as effective and may be even more economical. And I'm very, very excited, and I'm excited to show it to you if it proceeds, if it makes it through the traps at FDA.
Excellent.
But yeah, absolutely. I'm going to continue to make that a priority of this agency.
Great. Let me change topics quickly with my minute and 45 seconds left, since I was extended extra 30 seconds. Thank you, Mr. Chairman. I really appreciate the work that you're doing, frankly, as it relates to addressing how our food supply contributes to chronic diseases, including the phasing out of petroleum-based as part of your Make America Healthy movement. I'm really encouraged by the FDA's announcement last week approving 3 new natural color additive petitions. During your confirmation hearing process, I shared your passion for shaking up the food industry, and you are truly doing just what you said you were going to do as it relates to food additives. Because of your bold actions at HHS regarding petroleum-based food additives, the food industry responded by getting rid of these dyes in favor of natural alternatives. Thank you for your work in bringing healthier food options for our kids. Can you talk about how you will use your position to continue to build on your work eliminating artificial food dyes to further improve the quality of food sold to Americans in our quest to make Americans healthier?
Yeah, I mean, one of the big areas of neglect has been linking specific food additives and food processes to the chronic disease epidemic. The NIH has neglected that area of study. It is now the central focus of NIH. It's going to be looking at, and FDA, looking at ultra-processed foods, at sugars, and the 10,000 additives that are in our food that are in nobody else's food in the world, and looking at the impact so that we can put accurate labeling on, and when they're really dangerous, we can revoke their authorizations under GRAS.
Thank you, sir.
Thank you for being here, Mr. Secretary. Let me ask you a startup question. Do you know the #1 cause of preventable death in America today?
The #1 cause? Well, I know what the #1 cause of deaths is in this country. I'm not sure what you're talking about.
I'm talking about tobacco. You fired the head of the CDC's Office of Smoking and Health and eliminated their efforts from your budget. Hundreds of employees at FDA's Tobacco Center, including the director, have been let go. If we are genuinely concerned, and I believe you are, about the health of America and making it better, something as basic as the #1 preventable cause of death is not served by that kind of dismissal. Let me take you to another issue that I think is personal to me in a way. It reflects a tragic situation involving ALS. A friend of mine named Brian Wallach used to work in the Obama White House, and Brian met his wife-to-be, Sandra Abravaya, who was my press secretary. They married. When their second daughter was born, Sandra came home from the hospital to learn that her husband had ALS. Brian and Sandra have been fighting a battle now for 8 years. He's still alive. He can no longer walk or talk, but he has hope. He loves his family, and he's hoping that something will break through in ALS that gives him a chance for a future. Please explain to Brian and Sandra and their 2 young daughters why you've canceled ALS grants at institutions across this country and why you think research for diseases like ALS should be cut by 40% next year.
Senator, I don't know about those cuts. I will have to, I don't know if that's true. I don't know if those were part of the RIFs, in which case the people were not fired, but they were put on administrative leave. The issues that you're talking about are issues that are important to me: tobacco, ALS, and I know you have a passion for congenital heart disease as well. Those are all issues that I'm deeply concerned with, and I'm happy to meet with you at any time and talk about the programs and what we can do to make them better.
Of course, you're welcome, and I think the conversation is important. But I want to remind you, on April 1st, 10 laboratory heads at National Institute of Neurological Disorders and Strokes received their layoff notices. They were all PhDs and senior investigators. They're not administrators, whatever that might be. They were running intramural labs at NIH. If you have your way, they'll all be gone on June 2nd. Science Magazine reported 25 of 320 physician researchers at NIH's Internal Clinical Center are leaving, and the number of patients treated in the hospital has been reduced by 30%. 3 grants involving ALS and dementia work at Northwestern University in Illinois have been paused. One looking at how to stop the buildup of damaged proteins, another looking at cellular mechanisms that can be drug targets. Just last week, an ALS researcher at Harvard had his grant cut that was using AI to accelerate the reversal of ALS symptoms. Brian Wallach is waiting for a cure. He is not giving up. His source of hope is this research that you unfortunately are terminating. How can we possibly address his concerns and give hope to people across the country who are suffering for so many diseases when our government is cutting back on that research?
As I said, Senator, I do not know about any cuts to ALS research, and I'm happy to meet with you.
I just read them to you.
I will have to go and talk with Jay Bhattacharya and find out what the rationale was for those cuts. I just don't know about them until you told me about them at this moment.
There are many things that concern both of us about the state of public health in America. And questions you've raised, I think, are legitimate questions, many of them, that I want to follow through. I want to know the honest scientific answer to these questions. And I want to make this point. Cutting medical research is giving up on the future. You can't do that. These families are counting on you, Secretary, and counting on your department to do this research. It gives them hope to live another day. Just turning out the lights and saying you're doing it in the name of efficiency or DOGE or whatever it is no consolation to these families that are struggling. Thank you, Madam Chair.
Senator Moran.
Thank you, Chairman. Secretary, welcome.
Senator Kennedy.
Mr. Secretary, how many employees were there at HHS when you took over?
82,000.
How many do you have today?
62,000.
Okay.
It's about the level it was in 2019, right before COVID.
Is this the first time that an institution in America has ever downsized?
I don't think so. I think private and public institutions have
Microsoft just announced that they were going to reduce their workforce by 6,000 people. You think that'll be the end of Microsoft?
Senator, we wouldn't have reduced anybody.
You think that'll be the end of Microsoft?
I don't think so, Senator.
Meta, I still call them Facebook, just announced they're going to reduce their workforce by 3,000 people. You think that'll be the end of Meta?
I imagine it will not.
Yeah. Think maybe the people at Meta know what they're doing?
I think that they do. They make a lot of money, Senator.
Do you hate NIH?
I love NIH. I grew up with NIH. I visited when I was a boy. I loved science, and those were my favorite afternoons, visiting the labs.
Do you hate medical research?
No, I think we need to lead the world in medical research in this country.
In fact, isn't it true, Mr. Secretary, that you would like to see more money spent on medical research?
Obviously, I'm the secretary of this department. No secretary wants to see his budget cut.
Well, one way of doing that, it seems to me, would be to stop some of the stealing. And let me tell you what I mean by that. Let's suppose you give NIH gives a university $100 million to research, for medical research, to research a cure. And that university takes $30 million of it, doesn't spend it on the research. They use it to subsidize the rest of their university. Does that show a commitment to medical research?
No, and I mentioned before the example of Stanford, which was taking 78% in indirect costs, and we don't know what they were spending.
That's theft, isn't it?
It's not a good
in
way to
Louisiana,
spend
we call
federal
that stealing.
taxpayer dollars.
We call that stealing. Is there any doubt in your mind that a lot of universities are taking this NIH money, which is supposed to be spent on medical research, and using it to fund other parts of their university? Is there any doubt in your mind, Bobby?
Oh, and Senator, the other people who are writing grants, like the Gates Foundation, the Rockefeller Foundation, they paid 10% to 15% in indirect costs. We were paying 50, 60, 70%.
So, in fact, what you're doing is adding money to medical research.
We will be able to fund many, many, many more studies by eliminating that $9 billion, at least part of that $9 billion cost.
Okay. I want to ask you about LAHEAP. Are you familiar with this GAO report they did on LAHEAP? LAHEAP?
I am not, Senator.
They found, they audited 7 states. They found 11,000 dead people getting LIHEAP grants. You familiar with that?
No, but that is pretty typical of many of the other programs that we're working with.
They found prisoners getting grants, didn't they? Were they using the grants to heat their jail cell? They found 1,000 federal employees getting the grants with federal salaries that greatly exceeded the income limits. They found some of those folks living in million-dollar homes. I got 18 seconds. Why do we allow highly processed foods in America?
That's a complicated question, but it's driven by profits, but to a food industry that is making money by poisoning American kids, and they don't do it abroad. They make the same products for Canada and for Europe that do not contain many of those chemicals.
You understand, Mr. Secretary, there's nothing you can do that's going to make many of my Democratic colleagues happy. You get that, don't you?
I do understand. I'm coming to understand that, Senator.
Yes. Thank you.
Senator Murray, welcome. Nice to see you, and I'll turn it over to you for questions.
Thank you very much, Chair Capito, Senator Baldwin. I look forward to working with you both again in this Congress. Secretary Kennedy, things are not going well. It's clear what you are doing across HHS is devastating to children, families, seniors, millions of Americans that HHS programs support. Now, you were required to send us an operating plan detailing how you are spending funds that Congress provided for programs that families rely on. You sent us what you titled the, quote, Hill version, which had over 530 asterisks in place of the funding levels. Mr. Secretary, we need the real version with actual funding levels. This committee needs to know how you are spending taxpayer dollars right now and what programs you are cutting and which you are eliminating. You are blocking billions in funding that Congress appropriated from going out the door, including $3 billion at NIH, $1 billion in Head Start, and $3 billion in child care funding alone. And that's on top of all the other funding you have illegally ripped away. $11 billion from state and local health departments, $1 billion supporting local substance use and mental health programs, and $66 million in Title X funds for cancer screenings, birth control, and preventive care. We know you're dismantling HHS and throwing away generations of investments in our healthcare system and firing critical employees. We are talking about the people who administer Head Start, LIHEAP, Meals on Wheels, or entire teams who are working on preventing chronic disease and Alzheimer's, tracking IVF success rates and safety, maternal health, more. On top of all of this, you propose a budget now with truly devastating cuts that would leave America sicker and weaker. But you're not waiting to see whether Congress approves that budget proposal. This administration is starting to unilaterally implement it right now in defiance of Congress and the laws we passed. If you aren't already, you're sprinting down the road of illegally impounding billions in funding through intentional action and incompetence. So to my colleagues on this dais, we heard several weeks ago from experts across the country what we risk by ceding American leadership on biomedical research. If we bless these staffing and funding cuts across HHS, that means deciding that we are comfortable with China leading the future development of every drug, device, and vaccine. The supply chain challenges we faced during the pandemic will be the new normal. Our access to the latest treatments and cures will depend on other countries. It's time to stand up and assert Congress's authority. This committee has dedicated itself in a bipartisan manner over decades to make sure we are the global leader in research and development. And now all of us know this administration is now setting us back where it may take decades to regain that position. If we don't, decades of scientific breakthroughs and medical discovery and the bipartisan work to support them risks being burned to the ground, and it will be very, very hard for us to rebuild that. We should be setting this country up for failure. We have to do better. Now, Secretary Kennedy, listening to your testimony last week, frankly, left me pretty confused and concerned about what is happening at your department. You repeatedly claim that staffing and funding cuts that have been reported on publicly and even confirmed by your department staff are not happening. So either you're lying or you're not the one making the decisions. You said, and I quote, "I made sure that Head Start was not cut," later going on to say, "There should not be any delays, the funding is there." Well, Mr. Secretary, HHS is delaying billions in funding for Head Start and child care. These funding delays meant that a Head Start program in my state that serves more than 400 children had to close its doors and left parents scrambling. So let me ask you about another child care issue. Secretary Kennedy, whose decision was it to withhold child care and development block grant funding?
Senator, I want to point out that in 2021, at the beginning of his administration, President Biden submitted his budget on May. You know what? You made an accusation to me, and I'm going to answer it.
Okay, I appreciate
On May
that.
28th, he submitted his budget. So our budget. We're a new administration.
Okay, you can go
And I
down
also
that
want to
road.
point
I
out.
have just 2 minutes left. I asked you a specific
I want to point out something, Senator. You presided here, I think, for 32 years. You presided over the destruction of the health of the American people.
Well,
Our people are now the
Mr.
sickest people in the
Secretary,
world.
seriously.
Because you have
Mr.
not done your
Secretary,
job.
Seriously. That is an
What have you
amazing
done about it? What have you
Mr.
done about the
Secretary,
epidemic
I am here
of
to
chronic
ask-
disease?
Mr. Secretary,
What
you
have
are
you done
here in
about the epidemic
Mr.
of chronic
Secretary,
disease?
Seriously, Madam
Mr. Secretary,
Chairman.
I would ask you to hold back and let the senator ask the questions.
Mr. Secretary, I'm asking you a question about child care. I'm asking you who made the decision to withhold child care and development block grant funding.
That was made by my department.
Okay, and you said last week, quote, "We were not cutting thousands of scientists, we are not cutting clinical trials," but I want you to know in the last 4 months, you fired or pushed out nearly 5,000 NIH staff and terminated more than 1,600 NIH grants. That includes more than 240 clinical trials across the country. So whose decision was it to fire scientists and terminate these NIH grants and the clinical trials?
Senator, I don't trust your information with all due respect. You told me 3 days ago or 4 days ago that we had cut a clinical trial in your state, and what you said turned out to be completely untrue, and you knew it was untrue because you corresponded with Jay Bhattacharya before
Madam
that.
Chairman, I will answer that. It shouldn't take me, first of all, raising an issue with you face to make sure NIH is working its way through this. The woman that was in question, as I clarified to you at the last committee, was qualified for a clinical trial, unlike you stated. So
Untrue.
I will,
Untrue.
No, that is true.
Untrue. She qualified
Well,
this week. We shouldn't be talking about patients' private information
I agree.
anyway.
And let's leave that. And I will just say your staff didn't get back to me till 45 minutes ago.
We have the emails. We have the emails from your staff
Madam Secretary,
2 weeks ago. 2 weeks ago, you were corresponding. What you said you knew was untrue when you said it to me.
You came here to argue with me. I came here to ask you questions about your budget request. Your budget request is asking us to cut dramatically, but I am also making the point that Senator Baldwin made, that what you are doing right now is enacting your budget that Congress has not passed by cutting critical funding across the board. And I think this committee will find that to be very detrimental in the future. Thank you, Madam Chair.
Senator Hyde-Smith.
Thank you, Chair Capito and Ranking Member Baldwin for this meeting. Thank you, Chair Capito and Ranking Member Baldwin for this meeting, and thank you, Mr. Secretary, for being here. I'm going to get right to the point because I want to make the most of my time. I could not be more supportive of this administration's goals to improve mental and physical health of all Americans and to gain a better understanding of why our nation struggles in certain areas. However, I am deeply concerned with reports from reliable sources that's now appearing in the media that the Maha Commission's initial assessment, which is expected to be released this week, may unfairly target American agriculture, modern farming practices, and the crop protection tools that roughly 2% of our population relies on to help feed the remaining 98%. I trust these reports are not true and that this initial assessment prepared over the course of 3 months is not intended to serve any hidden agendas. Hidden agendas such as suggesting that products that have undergone the EPA pesticide approval process, which is widely considered to have the most rigorous standards in the world, are unsafe. Let me be clear, human health comes first, number one. It's a priority, and we certainly want that. But a vital component of human health relies on access to safe, affordable, and abundant food supply. If Americans lose confidence in the safety and integrity of our food supply due to the unfounded claims that mislead consumers, public health will be at risk. I've said this before, and it's worth saying again. Countries have gone to war over many things: politics, religion, race, trade, natural resources, oil, pride, you name it. But threaten a nation's food supply and allow people to go hungry, let's see what happens then. Mr. Secretary, 2 key provisions of the MAHA executive order stick out to me with respect of our exchange today. 1, subsection A of section 2 states, all federally funded health research should empower Americans through transparency and open source data and should avoid or eliminate conflicts of interest that skew outcomes and perpetrate distrust. And 2, subsection C of this section states, agencies shall work with farmers to ensure that the United States food is the healthiest, most abundant, and most affordable in the world. Mr. Secretary, with respect to the subsections that I just mentioned regarding conflicts of interest, skewing outcomes, and perpetuating distrust, do you think American farmers and ranchers will believe you're living up to this principle when they read your initial assessment later this week? And we all know with confirmation what confirmation bias is, and it's no secret that you were involved with pesticide litigation prior to becoming Secretary. Has your past or personal opinions influenced the initial assessment in any way? And regarding subsection C, how would you do things differently than what EPA and other federal regulators have already done? In the case of glyphosate, for instance, one of the most thoroughly studied products of its kind, we're talking about more than 1,500 studies and 50-plus years of review by the EPA and other leading global health authorities that have affirmed its safety when used as directed. Have you been able to refute thousands of studies and decades of scientific review in a matter of months? If you would answer those, and then I have some closing points.
Yeah, your information about the report is just simply wrong. The drafts that I've seen, there is not a single word in them that should worry the American farmer.
And you can prove that beyond a shadow of a doubt? That
You'll see the report. It's going to be released on Thursday. Everybody will see the report. And, you know, there's nobody that has a greater commitment to the American farmer than we do. The MAHA movement collapses if we can't partner with the American farmer in producing a safe, robust, and abundant food supply. And we understand that. I said during my campaign when I was running for president, and I've said repeatedly throughout this process, we cannot take any step that will put a single farmer in this country out of business.
Okay,
There's a million farmers who rely on glyphosate. There's a million farmers who rely on glyphosate. 100% of corn in this country relies on glyphosate, and we are not going to do anything to jeopardize that business model. We are.
But you're saying my comments are totally inaccurate. In today's
totally
world,
inaccurate.
There are people with impressive credentials, perhaps expert witnesses or organization with big names that are willing to say things that serve a particular interest or purpose, but what they don't say is that their feelings are premature or simply intended to satisfy a predetermined outcome desired by those seeking their opinion or validation. We have the Federal Insecticide, Fungicide, and Rodenticide Act, and the exhaustive review process in place for a reason. I've yet to hear the approval process is easy, but it's going to be a shame if the MAHA Commission issues a report suggesting without substantial facts and evidence that our government got things terribly wrong when it reviewed a number of crop protection tools and deemed them to be safe. So, Mr. Secretary, we have to get this right. You have to be 100% certain, and the MAHA Commission needs to be able to refute years and years of scientific evidence and thousands of studies from credible entities before you start suggesting an initial assessment that the methods in which the farmers provide our food is unsafe. I trust your report will be described, an initial assessment of things to be considered, but yet to be determined. Thank you, Madam Chair.
Thank you, Senator Shaheen.
Thank you, Madam Chairman. Mr.
Senator Kennedy.
Mr. Secretary, how many employees were there at HHS when you took over?
82,000.
How many do you have today?
62,000.
Okay.
It's about the level it was in 2019, right before COVID.
Is this the first time that an institution in America has ever downsized?
I don't think so. I think private and public institutions have history.
Microsoft just announced that they were going to reduce their workforce by 6,000 people. You think that'll be the end of Microsoft?
Senator, we wouldn't have reduced anybody.
You think that'll be the end of Microsoft?
I don't think so, Senator.
Meta, I still call them Facebook, just announced they're going to reduce their workforce by 3,000 people. You think that'll be the end of Meta?
I imagine it will not.
Yeah. Think maybe the people at Meta know what they're doing?
I think that they do. They make a lot of money, Senator.
Do you hate NIH?
I love NIH. I grew up with NIH. I visited when I was a boy. I love science, and those were my favorite afternoons, visiting the labs at NIH.
Do you hate medical research?
No, I think we need to lead the world in medical research in this country.
In fact, isn't it true, Mr. Secretary, that you would like to see more money spent on medical research?
Obviously, I'm the secretary of this department. No secretary wants to see his budget cut.
Well, one way of doing that, it seems to me, would be to stop some of the stealing. And let me tell you what I mean by that. Let's suppose you give NIH gives a university $100 million to research, for medical research, to research a cure. And that university takes $30 million of it, doesn't spend it on the research. They use it to subsidize the rest of their university. Does that show a commitment to medical research?
No, and I mentioned before the example of Stanford, which was taking 78% in indirect costs, and we don't know what they were spending.
That's theft, isn't it?
It's not a good
in
way to
Louisiana,
spend
we call
federal
that stealing.
taxpayer dollars.
We call that stealing. Is there any doubt in your mind that a lot of universities are taking this NIH money, which is supposed to be spent on medical research, and using it to fund other parts of their university? Is there any doubt in your mind, Bobby?
Oh, and Senator, the other people who are writing grants, like the Gates Foundation, the Rockefeller Foundation, they paid 10% to 15% in indirect costs. We were paying 50, 60, 70%.
So, in fact, what you're doing is adding money to medical research.
We will be able to fund many, many, many more studies by eliminating that $9 billion, at least part of that $9 billion cost.
Okay.
Mr. Secretary, and I am going to turn to the chair of the full committee, who we're honored to have here, as always, Senator Susan Collins, for 7 minutes for questioning.
Thank you. Thank you very much, Madam Chair, and I thank the Vice Chair as well. Welcome, Secretary Kennedy. Secretary Kennedy, the military services submit to Congress what is known as an unfunded priorities list. It includes funding requests that were not included in the president's budget, but oftentimes we take from that list and do fund what the military was unable to get into the president's budget. And just to give you some idea, the unfunded priorities list range from more battleships to better housing for our troops to weapons R&D. It really covers the map. Your department's budget has been sharply cut by 26% below the fiscal year 2025 level. If you were required, as our military services are, to submit an unfunded priorities list, what would you include on it?
That's a good question, Senator. I would include the research that has been neglected for the past 20 years on chronic disease and what's caused us to go from 3% of Americans of children having chronic disease when I was a little boy and my uncle was president to 60% today. I would want to look at the thousands, over 10,000 chemicals that are now in our food. Most of them have never been tested. I'd want to look at what's causing the infertility crisis. Why are girls in this country reaching puberty 6 years early? They're earlier than historically. Why do boys in this country have half the testosterone teenagers of a 68-year-old man, half the sperm count of a 60-year-old man? I would want to do research on why our bees are disappearing, why 90% hive collapse happened, which is a food issue. I would want to look at the microbiomes in the soil and how that's contributing to erosion and how chemicals that we're using in agriculture are sickening farmers in many cases, potentially, and are destroying the microbiome and creating a situation where soil is running off and where most agronomists believe that we only have 60 harvests left. And I would want to look at why we're having an explosion in Alzheimer's in this country, not just curing it, but what is causing it. And I think NIH has done a very good job at making cancer more survivable. For example, colorectal cancer, where there's been extraordinary science done at NIH. Why isn't NIH asking the question, why do we have colorectal cancer in children? This is something that's new to humanity. It was never known before. And now it's an epidemic in our children, and we need to have a balance where we're looking at cures for diseases, but we're also focusing on how to keep Americans healthy so that we can beat these ruinous healthcare costs and that we can have a healthy, productive society.
Thank you. I want to turn to a couple of other issues. First of all, the LAHI program, which we've talked about, is absolutely vital for thousands of older Mainers and low-income families. It helps them avoid the constant worry of having to choose between keeping warm, buying essential foods and medications and other basic necessities. Now, I was pleased to see the release of the rest of the fiscal year 2025 funds, but the administration's new budget seeks to eliminate what is truly a critical program. Will you work with this committee in trying to restore the LAHI program so that we can avoid literally seniors and low-income families not being able to keep warm in the winter?
Yeah, absolutely. And I'm from New England. Myself, my brother, for 40 years has run a Citizens Energy, which provides low-cost home heating oil to families in New England, and so many people have come to me over the years and said to me, thank you, your brother saved my life, because I didn't have to choose between food and heat. I was on the Navajo reservation 3 weeks ago, and Navajo President Boo Nygren said to me, if we cut LIHEAP, Navajo will die from it. So I understand the critical historical importance of this program. President Trump's rationale and OMB's rationale is that President Trump's energy policies are going to lower the cost of energy, so this program, so that everybody will get lower cost heating oil. And in that case, this program would simply be another subsidy to the fossil fuel industry. If that doesn't happen, then I would, and Congress chooses to appropriate the money, I, of course, will spend it. I've already directed the spending of $400 million in this year's budget to that, and I will work with you to make sure that those families do not suffer in that way.
Thank you. You and I've had many conversations about Alzheimer's disease and the BOLD Act. I do want to point out the CDC's cooperative agreements for the Healthy Brain Initiative and 3 dementia public health centers of excellence under the BOLD Act are set to expire at the end of September. We initially expected that the CDC would put out a notice encouraging applications early this year. Inexplicably, no such notice has been issued, even though we reauthorized the BOLD Act and funding is available under the appropriations measure that President Trump signed into law in March. How and when does HHS plan to issue this notice of funding opportunity so that we can continue what has been a very effective approach to the Healthy Brain Initiative and Centers of Excellence? It helps caregivers. It encourages early diagnosis. It really has been an important program, taking the kind of public health approach that you've generally supported.
Yeah, Senator, because of the TRO from the federal judge on this issue that was issued last week, I've been instructed by HHS and by White House attorneys that I can't speak directly to that part of the reorg. I have a strong personal commitment to, as I said before, to Alzheimer's, to dementia, and it's affected members of my family, and I understand how important these programs have been. And whatever happens, we will continue that research.
Senator Baldwin.
Thank you, Chair Cap, continuing our strong bipartisan work together. Secretary Kennedy, today we are here to talk about your fiscal year 2026 budget request to Congress. You run a department dedicated to improving the health and well-being of every American. And these programs that you are responsible for administering touch the lives of all Americans at a critical moment in their lives, from research for life-saving cures and treatments for devastating diseases, to maternal health care, to child care, to addressing substance use and mental health. You have repeatedly pledged that you would run the department with, I quote, radical transparency. While this is a great catchphrase, it could not be further from the reality that we're experiencing right now, as we talked about yesterday. As required by law, a few weeks ago, the department sent this committee a plan for how it will be spending appropriated funds this year under the CR. But instead of providing Congress and the American people with any information about how the department is spending tens of billions of taxpayer dollars, there are only asterisks in place of spending levels for over 530 programs. In no other job under the sun can you essentially leave blank how you are spending billions of dollars. This is flatly unacceptable when we are talking about taxpayer dollars, and the people I represent deserve better. You are undertaking a massive and disruptive overhaul of the department. You are shutting entire offices down and firing thousands of experts. Your plan for all of this that you've provided to Congress is little more than 1 page long. And that shows the chaos that this is creating. I'm assuming today you're going to reiterate talking points about how you are consolidating offices and eliminating duplicative functions. But Secretary Kennedy, this is a genuine request. Please sit down and talk to us in detail about what you are doing. Have your staff talk with our staff on both sides of the political aisle about your plans for the department and what you are doing right now. For a department this important, anything less is simply not acceptable. Let me turn to what it is that we do know about your budget request and what is happening at the Department of Health and Human Services. Your fiscal year 2026 budget to the National Institutes of Health of $18 billion. That would have a devastating impact on research into life-saving cures and treatments for devastating diseases, setting back medical innovations by decades. It would push the brightest scientific minds to work in other countries. It would cede our leadership in biomedical research to China. It would also take away hope from millions of American families. For the family receiving a devastating diagnosis of pediatric cancer, like Charlie and her mom, Emily, who spoke to this committee last month, it would mean less hope. For Jesse, a veteran and a father with ALS, and his son, Dewey, who wants his dad to see him graduate from high school, it would mean less hope and less time. This budget says a lot about the priorities of this administration. And normally I could, I guess, disregard it as only a request. But it provides insight into what you're doing right now in fiscal year 2025. At the same time you are submitting this request, you are actively stopping billions of dollars in NIH funding for life-saving research, including on cancer and Alzheimer's disease. You are implementing changes right now that are ripping away hope and life-saving cures from American families. If you aren't already, I think this administration is heading down the road of illegally impounding funding across HHS. Mr. Secretary, your budget request also cuts funding for CDC in half. Today, you will allude to consolidating programs into a new administration for Healthy America. But you can't just slash funding, fire everyone, slap a slogan on a new agency, and say that work will continue. In previous years, I would have called this only a proposal, reassured by the fact that Congress would reject it and rewrite our own. But this year, right now, you are dismantling CDC, seemingly in line with your budget request. Congress did not approve that. On a bipartisan basis, Congress funded the CDC to administer programs that provide critical public health support to states and local communities across the country. That includes the CDC Childhood Lead Poisoning Program. When the city of Milwaukee asked CDC for help addressing a lead crisis in schools, CDC should be able to provide support and assistance because Congress appropriated $51 million for CDC to do its job to address lead poisoning. Despite what you told me last week, that you have no intention of eliminating this program, you fired the entire office responsible for carrying it out. So CDC told Milwaukee Public Schools that they simply couldn't help. Your decision to fire staff and eliminate offices is endangering children, including thousands of children in Milwaukee. If you have a proposal to make these programs work better, present it and justify it. Mr. Secretary, you will say that you have that you have to fire thousands of employees and eliminate programs like LIHEAP because our deficit is too large. But you won't mention that at the same time this administration is proposing these cuts, it's proposing tax cuts for billionaires that will add trillions to our debt. You are cutting programs and firing staff with no plan and no understanding of what the department you are leading even does for the American people. And that's why you had to rehire staff working on the World Trade Center health program and screening coal miners for black lung disease. You fired everyone, and now you want to take credit for hiring them back? That's not how this works. Congress provided over $360 million on a bipartisan basis for NIH. You eliminated the entire Safe to Sleep program that the Eunice Kennedy Shriver Institute. Safe to Sleep is one of the most successful child safety campaigns in history that prevents 1,500 babies from dying each year, at a time when we are seeing rates of SIDS starting to climb. Without staff, these programs are meaningless, and this is happening across HHS. I could go on and on about how this administration's careless and reckless approach is hurting the people of Wisconsin and this country. These are just a few examples. Mr. Secretary, this committee has worked in a bipartisan manner to improve child care options for working families, address the substance use disorder crisis, support seniors and people with disabilities so that they can live in their communities, and to make the United States the leader in biomedical innovation. You're implementing changes right now that are dismantling our progress, and you're hiding it from Congress and the American people. We don't need to just reject this budget request. We need to reject what's happening at HHS right now. We need to do that before you have caused irreparable harm at the department and the programs it administers that millions of Americans rely on. I yield back.
Thank you. Secretary Kennedy, we welcome.
Gentleman yields. The chair now recognizes the ranking member of the full committee, Mr. Pallone, for 5 minutes for an opening statement.
Thank you, Mr. Chairman, and thank you, Mr. Secretary, for being here. And good to see Gary as well. Congratulations. For the past 6 months, the Trump administration has created chaos within our health system by canceling funding grants, rescinding billions of dollars in obligated funding, firing thousands of civil servants, and eliminating entire agencies and programs within HHS. Today's hearing is important because it finally provides us the opportunity to get some answers from Secretary Kennedy. But for months, we've been demanding answers on the administration's actions that seriously threaten the health and well-being of the American people. And many of these actions have been illegal, but Secretary Kennedy has refused to provide this committee any justifications for his actions, and I find that unacceptable. I express deep concerns with your nomination, Secretary Kennedy, and somehow, unfortunately, you've exceeded my expectations in the worst possible ways. You're actively undermining vaccines, the greatest public health achievement in modern history. Earlier this month, you unilaterally fired all 17 members of the Advisory Committee on Immunization Practices, the medical experts who developed vaccine recommendations, and appointed 8 anti-vaccine people. It's clear that you do not intend to uphold the commitments you made to the Senate during your confirmation process to not take away people's access to vaccines. Instead, I believe you intend to use your position to advance your dangerous pseudoscience agenda and put the lives of Americans, as especially children, at risk. The chaos has not been limited to vaccines. The Trump administration cut nearly $3.8 billion in grants from the National Institutes of Health, creating extreme uncertainty for medical researchers across the country and threatening future medical innovation. Things are so chaotic at NIH that more than 340 of its top scientists signed a letter to the NIH director detailing unprecedented waste, abuse, and illegality at NIH under the Trump administration. And this was an unprecedented action by these employees who must feel they have no other options at this point other than to go public. In addition to widespread grant cancellation, tens of thousands of civil servants have been fired across HHS. And Secretary, you've claimed that these staffing cuts have not interfered with program operations, but we know for a fact that that's not true. Entire offices and centers have been eliminated because there's no staff left to run them. Grantees and stakeholders can't get answers to their basic program questions. Staff at FDA and CDC have been brought back just to keep programs running, and deadlines at FDA are being missed. And these decisions have been made indiscriminately without any regard, in my opinion, for their impact on the health and well-being of the American people. And now, Secretary Kennedy, you've proposed a budget for the upcoming fiscal year that includes drastic and devastating cuts to our health agencies. The administration proposes a 54% cut to the CDC, threatening the agency's ability to protect the health of the American people. It proposes a 20% cut to NIH, which will seriously threaten our ability to conduct medical research into new life-saving treatments and cures. And it proposes an 11% cut to the FDA, decimating our ability to approve safe and effective drugs and medical products and keep our food supply safe. The Secretary has also proposed a reorganization of HHS that would not only eliminate important programs, but entire agencies like SAMHSA. And this action will seriously undermine our ability to continue to make progress against the opioid crisis. And all these actions decimate our public health infrastructure, and they come at the same time that Republicans are pushing their big, ugly bill that would take health care away from 16 million Americans so they can give giant tax breaks to their billionaire friends. The Republican bill is the largest health care cut in American history, ripping health care away from tens of millions of Americans, increasing costs on everyone else, and forcing the closure of hospitals and nursing homes. It'll have dire consequences for our entire healthcare system, and I believe people will die. Now, there's a lot to cover today at this budget hearing, but I just want to say I do believe the Secretary must appear here again very soon for an oversight hearing on the unprecedented and troubling chaos he's created at the vaccine panel and its impacts on people's access to life-saving vaccines. These disturbing actions warrant investigation. I hope Chairman Guthrie will join us in getting answers on behalf of the American people. I have about a half a minute left. Let me just say, I don't say any of these things, Mr. Secretary, out of any, not liking you in some way. And I know I probably shouldn't say this, but, President Kennedy was my hero when I was growing up. RFK, I worked on his campaign before he was assassinated. Joe Kennedy was my friend, had the office next to me when I was first elected. Patrick Kennedy, still a friend. The younger Joe Kennedy was a member of our committee. I thought did a great job. I admire you. I admire your family. I admire your work that you did on the environment. But it's just very upsetting at this point to me. Thank you, Mr. Chairman.
Gentlemen, I'm going to yield back and recognize the gentlelady from Colorado, Ranking Member DeGette, for 5 minutes of questioning.
Thank you, Mr. Chairman. Mr. Secretary, members of this subcommittee sent you letters seeking information on February 13th, February 28th, March 13th, March 20th, March 25th, April 1st, April 3rd, April 9th, April 10th, April 11th, April 28th, April 29th, May 28th, June 10th, June 11th, June 17th, June 22nd, and June 23rd, to which we have received no response from your agency whatsoever. Mr. Chairman, I'd like to enter these into the record, please.
Without objection.
Thank you. On June 16th, a federal judge ruled a large swath of NIH grant terminations illegal and void and vacated them, requiring that the grants resume. These grants deal with science that is disfavored by this administration, as we just heard from the witness. Judge William Young, a Reagan appointee, said that the administration's explanations for terminating the grants were, quote, bereft of reasoning virtually in their entirety, end quote. He added, quote, I've sat on this bench now for 40 years, and I've never seen government racial discrimination like this, end quote. Mr. Secretary, I have a yes or no question. Does the department intend to comply with Judge Young's ruling? Yes or no?
I will comply with
yes
the
or
law.
no, sir?
I'll comply with the law.
Thank you. As reported, in your opening statement, Mr. Secretary, you said that you're committed to reducing bureaucracy. But as reported in the Washington Post on April 17, 2025, HHS imposed a new layer of bureaucratic review by which every disbursement has to go through political appointments at HHS. Hospitals, universities, and community health organizations have told me and the other members lately that funds are stuck at HHS due to this so-called Defend the Spend initiative. I asked this about you about this in the April 23rd letter over 2 months ago, to which you have not responded, and I'd like some answers. Yes or no? Did HHS conduct a cost-benefit analysis on the defend the spend procedures?
I don't know anything
You
about
don't
that
know,
Washington
okay.
Post article.
In letters, you don't know whether you did a cost-benefit analysis, right?
I don't know. I know that. I don't
Okay.
know anything about that Washington Post article. I
No,
don't
do you
believe
know
it's
anything about the Defend the Spend initiative?
About what?
The Defend the Spend initiative
No.
that your agency has? You don't know about it. Mr. Chairman, I have an article here dated April 17th, 2025 about the Defend the Spend initiative. I'd like unanimous consent to enter it into the
Without objection.
Now, in Mr. Secretary, on June 9th, hundreds of NIH scientists sounded the alarm on how this administration has wasted millions of research dollars, injected politics into science, and damaged the public trust. 68 Nobel laureates signed this letter. On June 10th, we sent you a letter. Of course, we haven't gotten a response with our concerns that you or your staff might retaliate against them for telling the truth. So here's my question. Will you commit today that neither you or anyone else at HHS will take any retaliatory action against the brave scientists that work at NIH? This should be an easy answer because it's illegal.
I can commit that we are absolutely depoliticizing science at
Will
NIH
you
for the
commit
first
that
time.
you will not take any
Biden administration,
Excuse me.
Ms. Chairwoman, the Biden administration politicizes science, and I just gave you 3 of thousands of examples of how they did that.
Excuse me, sir. I asked you a simple question. Will you commit to not taking retaliatory action against the NIH scientists that signed the letter about the research dollars? Yes
I don't
or no?
know anything about that letter.
You don't know about the letter?
No,
Okay.
I don't know anything about that letter. This is the
Okay, well,
first
we'll
I've
put
heard
that,
of it.
we already put that, our question in the record. I'd like a response. Now, in my last few minutes, in our letters dated February 28th, April 1st, and May 28th, to which you did not respond, we have some questions about reductions in force. How many HHS employees received RIF notices since you were sworn in?
I think around 10,000.
10,000. Did you personally approve those layoff decisions?
Of each one, I approved of the policy.
Thank you. You approved the policy. Your NIH director, Jay Bhattacharya, told employees, quote, "I actually don't have any transparency into how those decisions were made, and I was quite upset about that. It would have been nice to have some say." I guess I'll follow up with more written questions, Mr. Chair.
Thank you. The gentlelady yields. Questioning Dr. Dunn.
Thank you very much, Mr. Chairman, and thank you, Secretary Kennedy, for being with us today. I want to begin by commending you for the work your department and the administration has done to make improvements in the health of the American people and to be responsible stewards of our tax dollars. Time and time again, we heard from the prior administration mismanagement across the department, but I'm particularly concerned about the damage inflicted to public trust in our health institutions. Unsurprisingly, when faced with sweeping mandates, the American public responded with skepticism and mistrust. I know you've already taken steps to restore public trust in our health institutions. Do you see those as being successful in the near future, or over what timeline?
We're going to restore public trust, Congressman, Vice Chairman, by restoring truth. We're going to tell the truth to the American people, and we're going to use evidence-based science, gold standard science. As I said, we're going to use replication. If I can take a minute just to respond to something that Congressman Pallone said, and I'll address you, Congressman Pallone. 15 years ago, you and I met. You were at that time a champion for people who had suffered injuries from vaccines. You were very adamant about it. You were the leading member of Congress on that issue. Since then, you've accepted $2 million from pharmaceutical companies in contribution, more than any other member of this committee. And your enthusiasm for supporting the old ACIP committee, which was completely rife and pervasive with pharmaceutical conflicts, seems to be an outcome of those contributions.
Mr. Chairman,
Thank you.
point of order. Point of order.
The chair recognizes
Point of order. The
Dr.
gentleman is impugning the reputation of a member of Congress.
Stop the clock.
Can you stop the clock for a second? Can you state the point of order?
Yeah. He was impugning Mr. Pallone's
Mr.
reputation.
Chairman, I didn't hear it. Did the
Oh,
gentleman?
you weren't paying attention, that's why.
Well, you know, it's hard to pay attention here when we're not getting any responses.
Okay,
My
okay.
understanding now is that the secretary said something about me taking money from pharmaceuticals? Is that what he said?
The secretary implied that Mr. Pallone would not fight for vaccine victims because he took money from the pharmaceutical industry.
You know,
He
again,
needs to take back those words.
you know,
Mr.
he
Okay,
needs to-
okay,
I
here
would
we go,
ask that
here
the
we go,
words
here
be
we go.
taken down.
This, Mr. Secretary, this is a valid point of order, I'm told. So I'd ask you if you would, please take back those words.
They're retracted.
Thank you, Mr. Secretary. Now, ladies and gentlemen, we're going to continue on with the decorum that I mentioned earlier in this hearing. And what we're going to do is to go to Dr. Dunn to finish up his time of questioning. Dr. Dunn is recognized.
Thank you very much, Mr. Chairman. So the department's fiscal year 26 proposed budget includes $750 million for strategic national stockpile as the Republican lead on the Pandemic and All Hazards Preparedness Act, PAPA, we call it. I believe that a strong national stockpile is critical to ensure we're prepared to respond to emergencies. Do you see this stockpile as being adequate, or $750 million budget being adequate for that, sir?
Well, I'm very, very gratified about congressional support for reappropriating PAPA, which is absolutely critical for our pandemic response. The stockpile, I think, has now $17 billion worth of inventory. I have to check those numbers, but I'm pretty sure that that's it. And we could be doing better. The stockpile did not distinguish itself during COVID. It didn't have many of the things that we needed during COVID, and we're doing a review of that right
Please
now
let
to
us
make
help you
sure
with
that the
that.
stockpile is adequately stocked.
Keep us informed, and we'll help you with that. Thank you, Mr. Secretary. You've long been an advocate of addressing mitochondrial health, kind of an interesting, edgy area that's illuminated earlier by the questions from Chairman Carter. The Haley VA Medical Center in Tampa has validated the compassionate use data for amyotrophic lateral sclerosis, Parkinson's disease, and has generated new positive data using mitochondrial transplantation for Alzheimer's. They've also entered into formal agreement with Walter Reed to use this experiment with this treatment for traumatic brain injuries. And now NASA is entering into a similar agreement to study mitochondrial health issues associated with space travel. Secretary Kennedy, do you intend to continue these efforts?
To study mitochondrial?
Yes, sir.
Yeah, I mean, that's going to be, mitochondrial dysfunction is the heart and soul of the chronic disease epidemic. And, you know, we now know that Alzheimer's disease, which was once thought to be, have a number of hypotheses about its etiology. But Alzheimer's disease is now characterized in the medical literature as type 3 diabetes, because it's recognized that mitochondrial dysfunction is not just causing disease in children, but it's also causing a disease in adults. And the cause of it is clearly our food. That's one of the principal causes, and we are absolutely laser focused.
I'm afraid our time has expired, but
Gentleman's
thank you
time has
very much for your
expired.
answers.
The chair now recognizes the gentleman from Ohio, Representative Balderson, for 5 minutes of questioning.
Thank you, Mr. Chairman. Thank you, Secretary Kennedy, for being here today. As the co-chair of the Digital Health Caucus, along with my friend and colleague, Representative Kelly, I believe digital tools can play a huge role in improving the health of Americans. However, for these tools to serve the American people, we must continue to ensure accessibility and statutory protections for consumer wellness technologies. Secretary Kennedy, my first question is that there is a tremendous amount of research that shows that greater engagement with one's health leads to better outcomes. In recent years, American innovators have created and improved wearable devices so that not only are consumers able to better engage with their health through monitoring data, but they are able to share that data with providers. I believe American consumers, in line with the 21st Century Cures Act, should be able to access these innovative wellness tools. Secretary Kennedy, do you agree that consumers should continue to have access to these tools?
Absolutely. In fact, we're about to launch one of the biggest advertising campaigns in HHS history to encourage Americans to use wearables. It's a way of people can take control over their own health. They can take responsibility. They can see, as you know, what food is doing to their glucose levels, their heart rates, and a number of other metrics as they eat it. And they can begin to make good judgments about their diet, about their physical activity, about the way that they live their lives. We think that wearables are a key to the MAHA agenda, making America healthy again, and we are going to, my vision is that every American is wearing a wearable within 4 years.
Thank you, Mr. Secretary. Following up on my previous questions, what steps will you take, and you just said that you're going to do a big announcement next week to access digital health tools to track, monitor, and improve their health, while also ensuring appropriate patient data privacy, security, and protections. In dealing with some of that, I have had questions come up when I've spoken to medical groups about wearables and the privacy. Do you have anything reassuring for that, or would that be part of the announcement?
Well, as I said, we're going to do a major advertising campaign encouraging Americans to wear wearables. I've personally had friends who've utterly changed their lives just from wearing a glucose meter. And they've lost weight, they've lost their diabetes, diagnoses, and you see this happen again and again. It really has a miraculous impact on health in our country. And, it's $80 a month. And, we're exploring ways of making sure that, that those costs can be paid for. The Ozempic is costing $1,300 a month. Right. If you can achieve the same thing with an $80 wearable, it's a lot better for the American people.
Great to hear. My office and I myself are also doing the same thing. I think we share the same belief that digital health tools, including telehealth and remote patient monitoring, are steps in the right direction in ensuring healthcare access. Specifically, I've been a strong advocate for the use and coverage of remote patient monitoring. During your time as Secretary, what progress do you hope to see in terms of access to and improvement of remote patient monitoring tools?
Remote patient monitoring, you mean like AI and AI nurses? Is that what?
Okay.
Yeah, we are working on that. As I said before, we've brought people into this agency who are the greatest technical expertise probably of any agency, except maybe the Defense Department, the CIA, and the United States government. I'm very encouraged by the caliber of people we've been able to attract to the agency, and that's one of the things we're doing. It's important. It keeps people out of emergency rooms. It's critically important for rural health care and for people who can't travel, for elderly Americans who can't leave their homes, but they can find out what's happening to their health without going to see a doctor or to go to an urgent care or an emergency room.
I agree with that, and I've been working with the federally qualified health centers doing some pilots with that. So, Mr. Chairman, thank you, Secretary Kennedy. Mr. Chairman, I yield back.
The chair now recognizes the gentlelady from Washington State, Dr. Schreier, for 5 minutes of questioning.
Secretary Kennedy, on May 27th, you posted a 60-second video on your X account unilaterally changing vaccine recommendations without consulting the customary panel of experts. As a pediatrician, I find that extremely alarming. So I thought we would talk a little bit about some vaccine-preventable diseases. Secretary Kennedy, and these are yes or no questions. Have you ever treated measles?
Do I what?
Have you ever treated measles?
No.
Well, I have. Let me tell you how miserable it is. These kids have high fevers, struggling to breathe, and they are crying. They suffer. Great news is that there is a vaccine to prevent it. Secretary Kennedy, again, a yes or no question. Have you ever treated bacterial meningitis?
No.
Well, I have. These babies are so sick. They come into the ER with high fevers, they are floppy, and we have to figure out why. Do you know how we figure out if a baby has meningitis?
Excuse me?
Do you know how we figure out if a baby has spinal meningitis?
How many babies?
I'm going to explain how we figure out and determine if a baby has meningitis.
Okay.
We insert a needle between vertebrae until the fluid that surrounds the spinal cord drips out into a test tube. It's called a spinal tap. We used to do lots of them. Fortunately, we don't have to do very many of these anymore because we have 3 vaccines that prevent childhood meningitis. These are miracles. Secretary Kennedy, yes or no, have you ever treated pertussis or whooping cough?
No, I've had it.
Well, I have. And in infants, in fact, the one I treated, weeks old, came in because the baby just stopped breathing and turned blue. Let me tell you how scared those parents were. And I've treated a bunch of older kids with it. They cough so hard, they vomit. They run out of air. They break ribs. And if you don't catch it before 2 weeks, antibiotics don't even work. They cough for months with broken ribs, and that is why it is called a 100-day cough. But you know what's great? There's a vaccine that prevents this. Of course, here's the thing. Vaccines only work if you actually give them. And we know your record on this. We rely on the Advisory Committee on Immunization Practices, a panel of experts to recommend which vaccines people should get at which ages and the like. Now, I know Senator Cassidy had concerns about your views on this, and so when he voted to confirm you as Secretary of HHS on February 4th, he explained that decision by saying on the Senate floor that, quote, if confirmed, you will maintain the CDC's Advisory Committee on Immunization Practices without changes. But then 2 weeks ago, you fired all 17 experts on that very committee. Mr. Secretary, question for you. Did you lie to Senator Cassidy when you told him you would not change this panel of experts?
I never made that agreement.
So are you saying that Senator Cassidy lied when he was on the Senate floor, lied to the American people?
I didn't see that statement by Senator Cassidy. I've only heard it from you, but if he said that I agreed to it, it would be inaccurate. I made an agreement with him. I made an agreement with him, and he and I have talked many times about that agreement.
My time. I just want to tell you that for most of us sitting here right now, we believe Senator Cassidy more than we trust you when it comes to vaccinations. It sounds to me like you gave him the answer he needed to hear in order to get his confirmation vote, and then as soon as you were Secretary, you turned around and did whatever you want. You fired all 17 members.
I'm complying with all the agreements that I made with
Secretary,
Senator Cassidy.
You're now on the record. You lied to Senator Cassidy. You have lied to the American people. You have lied to parents about vaccines for 20 years. And I also want to be clear that I will lay all responsibility for every death from a vaccine-preventable illness at your feet. I yield back.
The gentlelady yields.
Thank you so much, Mr. Chairman, and thank you, Secretary Kennedy, for being here today. It's actually not our first time meeting. We met a very, very long time ago when I was 9 years old in Westchester Putnam County at a Riverkeeper event. And I remember back then you talking about the importance of science and environmental action at that time. Listening to a lot of your discussion and a lot of the messages that you provide to people. You talk a lot about corporate influence and corruption in government. And this is an area that's very important to me, and it's an area that I do a lot of work in. I am, as a public servant, completely financially divested of any conflicts of interest with any healthcare companies, any stocks, any lawsuits that I would financially benefit from. Are you?
Yes.
You're completely divested.
Yes.
You have no financial interest in any lawsuit, crypto, none of that.
No. Oh, okay. Crypto? I own Bitcoin.
Okay. And do you have any other securities or assets?
I don't. I mean, I had to go through this with the Office of Government Ethics, and I had a few interests that were very minor that I divested.
Okay, just checking. I'd always like to.
It's a good question.
I always like to know
what
the field is before I enter conversations. So thank you for that. In the healthcare space, something that we've both spoken to is that some of the worst actors are in the for-profit medical space. Are in for-profit health insurance, big pharma, et cetera. And one of the worst companies actually is United Healthcare in this respect. United Healthcare is the largest health insurance company in the country. They are the largest employer of doctors and own thousands of pharmacies, clinics, surgery centers, and home health agencies, as well as hospice providers. Secretary Kennedy, are you aware that President Trump's Department of Justice is reportedly investigating United Healthcare for criminal insurance fraud in some of their for-profit health insurance plans, like Medicare Advantage?
I'm not aware of that investigation.
You are not aware that the Trump Department of Justice is investigating the largest insurance company in America that
I'm not aware of.
For fraud in Medicare Advantage?
No, I'm not aware of that.
That you have jurisdiction over?
It doesn't surprise me.
Okay. In your submitted testimony, you said HHS takes seriously our role as responsible stewards of taxpayer dollars. Are you aware that for-profit insurance corporations like United Healthcare have been found to be defrauding public dollars of more than $80 billion a year?
I'm not aware of that number, but
You're
I'm
not
aware
aware
that
of
there's
that?
fraud across the for-profit sector.
Respectfully, Secretary Kennedy, if we're making decisions around waste, fraud, and abuse, this is the largest source of waste, fraud, and abuse of public dollars in the public insurance space.
You say $80 million?
$80 billion a year.
80, did you say 80 million or 80 billion?
80 with a B, billion.
With a B,
yeah. If that's the case, why did you nearly double the rate that taxpayer dollars give for-profit insurance companies like United next year, if you don't know those things?
Double the rate? How did I do that?
So your agency nearly doubled the taxpayer dollars that for-profit insurance corporations like United will be paid next year, meaning these companies, the largest of whom is under investigation, criminal investigation by the Trump administration, will be receiving an additional $25 billion from your agency.
How is that happening?
I would be happy to submit to the congressional record evidence of this. I will enter the CMS press release from April 7th of 2025 into the record, which states that Medicare Advantage corporations will now receive a 5.06% increase in payments next year under your jurisdiction, Mr. Secretary. This is up from 2.2%.
I mean, we're raising
Without
which was
objection.
proposed from the Biden administration. You are doubling the rate that the Biden
The gentlelady's
these
time has
criminally
expired.
investigated companies.
The gentlelady's time has
receiving.
expired. The chair now recognizes the gentleman.
Thank you, Mr. Chairman. Earlier, Secretary Kennedy, you said you wanted to instill trust using truth, evidence-based, gold standard science. But Mr. Kennedy, in late May, the so-called, quote, Presidential Commission to Make America Healthy Again released what HHS described as a, quote, groundbreaking assessment that purported to identify the key drivers behind childhood chronic disease. Improving the health of America's children is a goal I share, and I recognize this is a passion of yours, Mr. Secretary. That is why I was struck to learn that the report was riddled with mistakes, misconstruing and intentionally or not misstating key references, data, and evidence that either do not exist or are not accurately reflected in the report. When journalists reached out to many of the authors of the studies included in the MAHA assessment, numerous researchers and academics stated that they never wrote the papers as cited, or the papers cited didn't even exist altogether. Mr. Chairman, I want to submit these 3 news reports on these miscited documents from notice from May 29th and May 30th.
Without objection.
Ms. Secretary Kennedy, you're listed as the chair of the commission. Did you read the report and fact-check its sources prior to publication?
All of the factual
Did you read
sources-
the reports, and did you yourself fact-check them, sir?
I did not fact-check.
You did not fact-check. So why then, as has
All of
been
the
widely reported,
foundational
excuse me, sir, I'm
assertions
speaking. Why then did the report include a citation to sources that don't even exist? How does that happen under your leadership, sir?
All of the foundational assertions in that report are accurate.
They did not
Some of them-
exist. How can they be
some-
accurate if they did not
I said
exist, sir?
Some of the citations
You know, in
were-
fact, my understanding
the
is that
citations
even
were
once
messed
the
up for
report,
one day,
even once the report was updated, more authors and researchers came forward stating that their research was misconstrued. This is quite unbelievable, sir. In fact, I was a pre-med at UCLA. They have a great pre-med program. If somebody turned this in as an undergrad to their professor at UCLA, they would have received an F, sir, an F for the misinterpretation, the falsehoods, the denials, and also citing references that don't even exist. That's lying and dishonest, sir. My concern here
The citations
my
were
concern
corrected in
here
one
is
day.
that you and this administration are undertaking vast changes to our federal public health system and using purported facts and gold standard evidence that you claim to have as justifications for your decisions, actions, and frankly, your decimation of our nation's public health infrastructure. Yet, what you are relying upon isn't real. It isn't data-driven, and it isn't based in fact, science, or reality. Sir, it's wrong. As a secretary of one of the most consequential departments within our federal government, mischaracterizing data is not just some typos in a report that gets put on a shelf. Instead, your words and your words of your department carry significant weight. Do you agree?
The
Does it carry
citations in that
significant weight?
report were wrong.
The
That was a mistake. They were corrected within 24 hours.
Yeah, but there were wrong still even after that, and they're wrong still today.
There were no
So do you
erroneous
believe that
factual
your
assertions,
words
Congressman.
carry significant weight?
There were no erroneous
Do you
factual
believe your
assertions.
words carry significant weight?
There were no erroneous
Do
factual
you
assertions.
believe that the Secretary of the Department of Health and Human Services plays an important role in upholding scientific integrity?
Yes.
Okay, so then, in fact, what is most striking about this is that you've also threatened to bar governmental scientists and researchers from publishing in top medical journals. You've barred them from publishing in top reputable medical journals and instead proposed, quote, creating our own journals in-house. The idea that we would limit
want me to
the
answer that
ability for
question,
federal
Congressman?
researchers to publish in the most preeminent medical journals and instead have HHS just publish more reports like their MAHA failed assessment, lacking the scientific rigor, accuracy, or peer-reviewed criteria that are required by leading journals should worry us all for the future of medicine and innovation. Sir, you mentioned that building trust was a priority number 7. You have failed already in building that trust. How can we trust you when in your report, under your leadership, when you're the chair of this report, has false information and makes up research that didn't even exist? So, Chairman,
You left me
I
no time to
yield
answer
back
the question.
the remainder of my time.
Gentleman yields. The chair now recognizes the ranking member of the full committee, Representative Pallone, for 5 minutes of questioning.
Thank you, Mr. Chairman. Secretary Kennedy, quite frankly, I think you're trying to defend the indefensible. There's no way that this budget or the actions you have taken thus far as Secretary are going to make this country healthier. And you keep talking about waste at the agency, but I mentioned in my opening, there are 340 top scientists who signed a letter to the NIH director detailing unprecedented waste, abuse, and illegality at NIH under the Trump administration. And you know, the thing that really disturbs me the most is this anti-science agenda. That I think it's clear to me that the vast majority of scientists and medical professionals, you know, think your views on vaccines are dangerous, are not supported by scientific evidence. I'd like to ask the chairman, I'd like to ask unanimous consent to enter into the record a letter from 63 medical and public health groups and a letter from the American Academy of Family Physicians, American Academy of Pediatrics, American College of Obstetricians and Gynecologists, and the American College of Physicians, all raising grave concerns, Mr. Chairman, about the Secretary's actions to undermine vaccines.
Can you tell me the date of that letter, Congressman?
No, I'm not asking a question. I have something to ask.
Okay, because I think that letter was sent
I'm just asking
about a week after I got in
Mr.
here.
Chairman, I haven't gotten my questions. I'm just asking unanimous consent to enter these into the record.
Without objection.
Thank you. The Secretary, Mr. Secretary, the science is not on your side. I just really think that people are going to die as a result of your actions and congressional Republicans' actions. But you keep mentioning transparency during your testimony. You said it over and over again. But you promote, I consider, unfounded and unscientific therapies and conspiracy theories without data or evidence. And all of this has been done behind closed doors without any public engagement, despite your pledge to lead with, I think you called it, radical transparency. So let me ask you about, yes or no, though, about this radical transparency that you say you espouse. Do you believe that keeping Congress informed of your decisions and promptly answering inquiries from members of Congress fits within your promise for radical transparency? Just yes or yes?
Yes.
Okay, thank you. Now, since you became Secretary, I have sent you 10 letters on a variety of topics, including the devastating workforce and program cuts at HHS. You've answered none, and your staff have given no indication that you intend to answer, despite being asked repeatedly. And this, in my opinion, is the opposite of radical transparency. I call it radical obstruction of congressional oversight. So again, yes or no, do you commit to providing a written, substantive response to all questions posed in each of these letters no later than August 1st? And if not, give me a date.
We've gotten an unprecedented number of letters from Congress, literally thousands upon thousands.
Okay, but I'm only asking for a date. Can you
and
answer
we are
by
answering
August
them
1st?
as fast as we can, and all those letters will be answered.
I haven't gotten a single answer to any of them, Mr. Secretary.
Oh, there, like I said, we have gotten thousands
All right, I'm
and
just
thousands
asking
of
you,
letters from Congress.
you said that you want to be transparent. You've said that Congress in responding to us is important. So can you give me a date? If not, I'm going to assume I'm never going to hear back. I said August 1st. August 15th? Tell me.
I'm not going to tell you a date.
Well, then I don't think I'm ever going to get a response, and I think your suggestion that somehow you're being transparent is simply not true. Now, one last question. You have made a number of major decisions about vaccines, and again, there's been no public comment process or public accountability on that either. What are you afraid of? I mean, with regard to vaccines, are you just afraid of receiving public comments on proposals? Or you just think these are fringe views that are contrary to the views of most scientists, and that the public comments will reflect this? You say you want transparency, but there's been no public process for any of this.
We have a public process for regulating vaccines. It's called the ACIP committee, and it's a public meeting. There will be public comment at that meeting.
You fired the ACIP.
I fired people who had conflicts with the pharmaceutical industry.
Oh, I mean, that's...
That industry, that... committee has been a template for medical malpractice for 30 years.
I can't, the bottom line is here, we have no transparency, we have you feel no responsibility to Congress whatsoever, and you just continue this ideology that's anti-science, anti-vaccine. That's all I see. I see nothing else, and I don't think I'm ever going to get a response, and so I'm going to have to ask...
Will the gentleman yield?
My time is
Well,
up.
this is, Mr. Chairman, This is the committee of jurisdiction.
Gentlemen, the gentleman has yielded. The chair now recognizes the vice chair of the committee. The chair now recognizes the gentlelady from Texas, Representative Fletcher, for 5 minutes of questioning.
Thank you, Mr. Chairman. Secretary Kennedy, do you know the requirements for hospitals under the Emergency Medical Treatment and Labor Act, which is commonly called by its shortened name, EMTALA?
Yes, I do.
And just generally, what do you know EMTALA to require of hospitals?
That every hospital has to treat anybody who comes to the emergency room.
And they have to provide stabilizing care regardless of their ability to pay and regardless of the type of care required, correct?
Exactly.
And Secretary Kennedy, you understand that American College of Obstetricians and Gynecologists, the American Medical Association, and the Society for Maternal Fetal Medicine, in certain circumstances, necessary stabilizing care for the purposes of fulfilling a hospital's obligation under EMTALA could be providing abortion care, correct?
In cases, for example, ectopic pregnancies and botched abortions and in miscarriages, those hospitals are required to provide care. Elective abortions, they're not.
But they are required to provide abortion care if that is the care that a physician treating the patient determines in their medical judgment is the care necessary to stabilize the patient and to protect their life and health, correct?
And because there were confusion about that, I sent out a letter to every hospital in America restating that in those conditions they must provide care.
Okay, and I think that that's consistent with what we have heard from emergency physicians, obstetricians, other treating physicians that have made clear that in certain circumstances, clinically recognized, evidence-based, necessary medical treatment in various circumstances, including but not limited to the ones you just listed, abortion care is the necessary stabilizing care or some kind of care that may end a pregnancy. So in those cases, you would agree with me that EMTALA requires the hospitals to provide that care?
Yes.
And
that's what President Trump believes.
And you just mentioned that you issued some guidance to all the hospitals and care providers across the country, rescinding some guidance from the prior administration and making clear that that is the requirement. Now, the guidance that you rescinded was issued shortly after the Dobbs decision, which was announced 3 years ago today, and created some confusion. And so I think one thing that's important, one thing that I hear from doctors in states like mine, is that this kind of guidance and clarity is very, very important to giving the practicing physicians the comfort that they need to do their jobs. And so I think it's really important that you continue, and I hope that you'll continue to make as clear as you have today in this hearing, that EMTALA ensures and protects pregnant women in all 50 states.
I will continue to do that, Congresswoman.
And with the time I have left, on one other note, in response to some questions from Mr. Pallone earlier, he talked about, as I believe Ranking Member DeGette has as well, several of the letters that our committee has sent, or members of our committee have sent to you with concerns about actions being taken at HHS. And certainly, I agree with a lot of those concerns. I represent Houston, Texas, and we have an incredible amount of research going on through National Institutes of Health, incredible development of all kinds of transformative therapies and treatments. And so we have a lot of concerns. I know you mentioned that you have gotten thousands of letters from members of Congress, and I can appreciate that. But I would ask that, recognizing that this committee, the House Energy and Commerce Committee, has jurisdiction and is the committee of jurisdiction over HHS, that the requests that come from the ranking member, that come from the Energy and Commerce Committee get prioritized by your staff in terms of looking at congressional responses. I think it would be very important because we have jurisdiction, and you've indicated you'll work with a lot of folks here on a lot of different issues, and getting those answers and being able to work to address the concerns that we have is really important. So I just ask that you prioritize those responses.
You have my commitment to do that, Congresswoman. And I would also say this, and it's the same thing that I said to Congresswoman Dingell. It's not our intention to cut anything that is the kind of research that you're talking about, which is critical research. We need to keep America the hub of that kind of research. And there was some malicious compliance. There was some mistakes made.
Thank you, Mr. Secretary. My time has expired, and so I will go back.
Contact us, and we will redress them.
The chair now recognizes, the gentleman yields. The chair now recognizes the gentlelady from Massachusetts, Representative Trahan, for 5 minutes of questioning.
Thank you. Mr. Secretary, during your confirmation, you told Senator Barrasso that rural hospitals are closing at an extraordinary rate. You called them economic drivers, lifelines in our communities, and you gave your word to protect them. Republicans on this committee also promised they wouldn't support a bill that led to more closures. Yet here we are. The Republican tax bill slashes Medicaid and the ACA by over $1 trillion, leaving 16 million more people uninsured and driving up uncompensated care. At the same time, it cuts provider taxes and state-directed payments, the few tools that states have to keep hospitals afloat. Cutting coverage and cutting payments, well, that's a perfect storm for closures, Mr. Secretary. So yes or no, with Republicans in Congress set to cut more than $1 trillion and counting from our healthcare system, will hospitals be forced to cut services or close altogether?
We're not cutting coverage for any American patient.
Well, it sounds like you don't want to admit the reality that your department
I'm happy to
is creating.
explain if you want to give me a chance.
Well, it's part of my next question. I want to hear what your funding mechanism looks like, because hospitals across the country have warned that this bill is what they referred to as a death knell, even before Republicans in the Senate doubled the cuts in provider taxes and state-directed payments, bringing estimates of hospital uncompensated care alone to more than $443 billion. Hospitals are raising a huge warning flag that the big ugly bill will result in closures and service reductions across the country in all our communities. I ask unanimous consent to enter into the record several of their statements and analyses. Mr. Secretary, if you claim the hospitals in our districts that are already operating in the red and serving mostly Medicaid and Medicare patients are going to survive, then where exactly is that money going to come from? What is your plan to keep them open and deliver the same level of service?
Well, the issue of state-directed payments, I think, as you understand, is a complicated one, because the essential agreement under Medicare is that the states will pay a certain amount and the federal government will pay a certain amount. The states have learned to game that, some states have learned to game that system, so the federal government
If you could
is
just
paying
get to the
100%.
part where when that revenue stream
Excuse
is
me?
cut, how are you going to ensure that services aren't cut and hospitals don't close? I mean, many times there's just no alternative on the table for a funding mechanism, so what's your plan?
Well, that is a decision ultimately that's got to come from Congress. So that's going to be up to you. But what I would say to you is that I would like to work with you on this, because it's a complicated issue. It's not just that, it's not that simple. Are we going to?
I'm happy to work with you on this, Mr. Secretary, but this is going to happen in the next couple of weeks. And if there isn't a funding mechanism in place, if there isn't an act of Congress to replace that revenue stream, hospitals are going to close. People are going to die. When hospitals are pushed to the brink, they cut maternity wards, they cut mental health, they cut emergency rooms. That's who they cut first. This isn't hypothetical, it's already happening. From 2011 to 23, dozens of hospitals in states like Iowa and Texas eliminated obstetrics entirely. These are Medicaid department services, and under Donald Trump's bill, they're the first to go. And it's not just rural hospitals. We're seeing it in my district, too. The only maternity ward in north central Massachusetts shut down last year. Then the collapse of Steward forced 2 more hospitals to close, including one that served thousands of families. Boston Children's, one of the best in the country, is also at risk. Your budget slashes Medicaid, which covers over 40% of kids, and eliminates programs that trains most pediatricians. Hospitals are already bracing. They're pausing projects, they're canceling expansions, they're shelving cost-saving investments. The chaos that your budget creates, including decimating NIH, is driving up costs.
We're not cutting Medicaid. There's no cuts to Medicaid. There's simply restrictions in the growth of Medicaid over the next decade.
People are going to lose their coverage. Uncompensated care is going to rise. Hospitals are not prepared for that reality. Look, here's the truth. People are going to die. These hospitals are going to close. Labor and delivery units are going to disappear. If mental health services are stripped away, that's the consequence of your policies. And look, you've already shown that you don't have a grip on your department. You don't know basic things that are on your website or programs that are closing.
Gentlelady's time has expired. The chair now recognizes the general.
Thank you, Chairman Carter. And thank you, Vice Chairman Dunn. Thank you, Ranking Member DeGette, and members of the committee. I'm honored to appear before you today to present the Department of Health and Human Services fiscal year budget for 2026. Debilitating disease, contaminated food, toxic environments, addiction, mental illness affect families across every race, class, and political belief. When my team and I took the helm at HHS, we set out with clear goals. First, to make America healthy again with a special focus on ending chronic disease epidemic. Second, we committed to delivering more efficient, responsive, and effective service to over 100 million Americans who rely on Medicare, Medicaid, and other HHS programs. Third, to achieve these goals while cutting costs for taxpayers, we intend to do more, a lot more, with less. The budget I'm presenting today supports these goals and reflects two enduring American values: compassion and responsibility. I invite the committee to unite around these ideals with me. The United States remains the sickest developed nation, and yet we spend $4.5 trillion annually on healthcare, 2 to 3 times more per capita to comparable nations. Clearly, something is structurally wrong with our approach. Furthermore, healthcare costs are steadily increasing at a rate of 2% greater than the economy. This is unsustainable. If we don't staunch this trend, we will ransom our children to bankruptcy, servitude, and disastrous health consequences. Yes, an exploding debt is a social determinant of health. We won't solve this problem by throwing more money at it. We must spend smarter. We will shift funding away from bureaucracy toward direct impact. Some things at HHS will not change. We will preserve the legacy programs like Medicare and Medicaid and the foundation of the MAHA agenda. Vulnerable populations, seniors, and veterans deserve consistent access to care, and I will make sure they receive it. Today, 83 million Americans, urban and rural, lack adequate access to primary care physicians. We will prioritize these families, especially Native Americans and Alaskan communities. We will protect IHS funding, streamline its operations, and give the tribes more autonomy in managing their resources. Let me be clear, we intend to make the Trump HHS not only the most effective, but also the most compassionate in U.S. history. While our official budget statement outlines many priorities, I want to highlight a few. First, we will consolidate programs to better tackle mental health and addiction. These issues now rival chronic disease in their impact. HHS will aggressively combat the opioid crisis, especially the spread of synthetic drugs like fentanyl. We will empower state, local, and tribal leaders to create effective solutions. Second, we will address nutrition, physical activity, and healthy lifestyles. The President's budget requests $94 billion in discretionary funds to support these priorities, including the Administration for a Healthy America. AHA will oversee initiatives such as Prevention Innovation Program, which targets chronic disease and childhood obesity through access to nutrition service and physical activity and reducing dependence on medication. Third, we will equip FDA to expand its food safety efforts through research, regulation, inspection, and education, to remove harmful chemicals from food and packaging and explore how to close the generally recognized as safe with a grass loophole. Fourth, we will fund cutting-edge research at the NIH while cutting risky or non-essential studies. That includes ending gain-of-function experiments and research based upon radical gender ideology. At the CDC, we will return to core missions, tracking diseases, investigating outbreaks, and sustaining public health infrastructure while cutting waste. Fifth, we will eliminate DEI funding and redirect resources toward real poverty reduction. We will move beyond lip service to communities of color and take meaningful action to address their needs. Six, we will strengthen cybersecurity and health IT. The AI revolution has arrived, and we are using this technology already at HHS to manage healthcare data more efficiently, securely, and to increase the speed of drug approvals. Finally, we will rebuild public trust that eroded through the years of industry capture, waste, and misplaced priorities. We will launch a new era of transparency and public service, creating an honest, science-driven HHS that answers to the President, to Congress, and to the American people. I look forward to working with Congress to pursue this mission together as a bipartisan cause. Let's work side by side to make America healthy again. Thank you, Mr. Chairman.
Thank you. The gentleman.
Thank you, Mr. Chairman, and thank you, Secretary Kennedy, for appearing before our committee. I'm pleased to see a focus on food as medicine and the well-being of all Americans in the FY26 budget, an issue of mutual interest and concern. I'm deeply troubled, however, by so many things happening at HHS under your leadership, especially your ill-informed decision to reverse existing recommendations for pregnant women and healthy children to receive the COVID-19 vaccine. The chair of the American Academy of Pediatrics Committee on Infectious Diseases described your decision as really concerning and taking away choice. The American College of Obstetricians and Gynecologists and the March of Dimes have also opposed your decision. Chairman, I have two items to insert into the record. ACOG's statement on HHS recommendations regarding the COVID-19 vaccine during pregnancy, or the COVID vaccine during pregnancy, and also RFK Jr. says COVID shots no longer recommended for kids and pregnant women.
Without objection.
Thank you. Due to my limited time, I ask that you please respond to my questions with a yes or no. Mr. Secretary, does HHS COVID-19 vaccine webpage reflect the department's view on COVID-19 vaccines? Yes or no?
First of all, what you said was wrong. We're not depriving anybody of choice. If a pregnant woman wants the COVID-19 vaccine, she can get it. We're no longer recommending it because there was no science supporting that recommendation. There's study after study that shows adverse events. One study, 27 adverse events during pregnancy from that campaign.
I'm going to interrupt you because I need to reclaim my
Another
time,
study shows an increase in miscarriage. There's no safety data for it, so we're not going to recommend it.
Not true.
We don't have safety
We have a pediatrician that is on this committee. Not true. I'll go back to, does HHS COVID-19 vaccine webpage reflect the department's viewpoint on COVID-19 vaccines? Please, yes or no?
I didn't understand the question. You're asking if
the HHS's COVID-19 vaccine webpage reflect the department's viewpoint on COVID-19 vaccines.
I imagine it does. I haven't seen the website.
You haven't seen HHS's COVID-19 vaccine?
No, I haven't read the entire
Well, it's kind of
website.
troubling that you're unaware of what your own department's website states on the safety and efficacy of the vaccination. Let me read it directly to you. COVID-19 vaccines are safe and effective, and COVID-19 vaccines are available to everyone 6 months and older. Getting vaccinated is the best way to help protect people from COVID-19. Get vaccinated if you haven't. Chairman, I have the paper copy of the website to insert into the record, COVID vaccine 19, excuse me.
Without objection?
Okay. And again, yes or no?
As I said,
Yes or no, within the past 45 days, has the CDC recommended COVID vaccinations for people at high risk? Yes or no?
for people at
I don't
high
have a lot
risk,
of time.
yes.
So in fact, on May 12, 2025, CDC stated in its interim clinical considerations for the use of COVID-19 vaccines in the United States, and I quote, COVID-19 vaccination is recommended for everyone aged 6 months and older in the U.S. CDC goes on to state that vaccination is especially important for a number of certain groups of people, including pregnant women, in order to protect themselves and their infants. Also, I'm inserting into the record the following copy of the
Congressman, we
website.
don't recommend COVID vaccines for pregnant women or for children.
Excuse me?
We do not recommend it for pregnant women or children.
I think I just read, especially important for a number of certain groups of people, including pregnant women, in order to protect themselves and their infants. I'm inserting into the record the following copy of the website, May 12, 2025, COVID-19 vaccines and vaccinations, Mr. Chairman.
Without objection.
It appears CDC was not consulted, given that it took days for them to update their immunization schedule to reflect your new policy. I'd like to insert into the record a Washington Post story reiterating this. CDC blindsided as RFK Jr. changes COVID-19 vaccine recommendations.
Without objection.
Okay, once again, yes or no? Did you consult CDC before changing vaccine policy related to COVID-19 vaccine as it relates to pregnancy?
We absolutely consult CDC on every policy regarding vaccination.
Okay, it's different than what, I yield back.
Gentlelady yields for 5 minutes of question.
Good afternoon, Secretary. You've emphasized throughout your career concerns about corruption and conflicts of interest in healthcare, yes?
About corruption in healthcare?
Yes.
Yeah.
And you've pledged during your confirmation hearing and then again today, quote, radical transparency, yes?
Yes.
Yes. And you explained to my colleague from New York that you divested yourself, yes?
Yes.
And you fired the 17 members of ACIP because you think they have conflicts of interest, yes?
Yes.
And do you think that everybody within Health and Human Services at a senior level should hold themselves to a standard of radical transparency and divestment?
Well, I'm going to hold them to that standard, but...
So not everybody should hold themselves to a standard of
yeah,
radical
everybody, and OGE makes them all divest.
So everybody should divest and everybody should be radically transparent. Who works for you?
Yes.
Yes. And does that include people who have involvement in Health and Human Services policymaking, even if they're not in your department? Would you want them to be radically transparent as well?
I don't have any control over anybody except those in my department.
Well, I think you do. Let's talk, though, about how radically transparent you have been to date, because I want to ensure for the American public that they're getting what you pledged. Mr. Kelly Means is a special government employee. He's also a White House advisor. You know him well. He actually introduced you to Donald Trump. And he's the founder and the owner of TrueMed. Now, TrueMed is a company that sells saunas and supplements and maybe medical devices that you described to people with using pre-tax dollars. And he has described his mission as routing federal funds away from health insurance programs towards these health savings accounts. Now, Mr. Means has tremendous influence over Medicare and Medicaid based on the executive order on Making America Healthy Again and the One Big Beautiful Bill, which both call for the expansion of HSA usage for these wellness and supplement products. So that's a direct revenue stream for his company while he's working in the government. So my question is, would you require Mr. Means to sign the financial disclosure forms that you're very familiar with?
I have no power to do that, but I find it interesting that you bring that up.
I'm going to reclaim my time.
Pharmaceutical companies have been in the White House for generations.
This is
none of you
my time,
about
Secretary, my time. Would you require, in keeping with radical transparency, that this individual who you're very close with, who has a major role in shaping MAHA agenda, and you have said so yourself publicly and many times, would you require him, before working on the MAHA agenda, that he sign those disclosure forms?
I have no power to require that. I can require people in my agency, and I've done that.
Will you continue to work with him if he does not sign those forms?
To
with Mr. Means? Will you continue working with him if he does not sign those forms?
I work with everybody, including all the pharmaceutical
Do you
companies.
think that he should? Do you think that he should respond
And
to
the
the letter that
insurance
I wrote?
companies.
Do you think that he should respond to the letter that I wrote, requiring him or asking him, I should say, to be transparent about potential conflicts of interest between TrueMed and CMS and the MAHA agenda? Is that something that he should do, in your opinion, in keeping with divestment? I mean, because you've said, sir.
You wrote me a letter?
He said, sir. You said
Are
before.
you saying you wrote me a letter?
I wrote Mr. Means a letter asking him to respond. Do you think he should respond?
That's between you and him. As I said, there's been pharmaceutical companies
you
for
said,
generations in the White
Secretary-
House, and nobody complained about it.
Secretary, you said that everybody who works on health policy should follow high standards of radical transparency and divestment. So I've asked him questions about whether he's done that. Should he, in keeping with what you just said at the top of this, should he be radically transparent?
Let me ask you this. Have you accepted $400,000 from pharmaceutical companies?
The reason you know that is because I have financial disclosure forms, and I'm asking him to submit the same thing. So should he do the same thing? Because when he doesn't, let's talk about what happened. Let's talk about Mr. Brad
Should you
Smith.
be prevented from accepting money from pharmaceutical companies? Because it says here you've accepted $400,000.
Mr. Kennedy, you asked Ms. Ocasio-Cortez, how did I do that when she talked about the higher rates given to the Medicare Advantage organizations? I actually have an answer for you. How did that happen? The answer is Mr. Brad Smith. So he was in charge of Doge Healthcare, and his biggest investors at his company, Main Street Health, are the Medicare Advantage organizations, the 5 biggest health insurance corporations in America. They're his investors. He owns this company. They own him. And while he was there, he set the rules and reimbursements for CMS to hook up his investors. So I'm going to answer the question that you asked Ms. Ocasio-Cortez. It is because of conflicts of interest. Do you think that CMS should continue to do business with Main Street Health under your watch? Is that radically transparent?
Are you saying that we should cut Medicare Advantage?
Do you think that Main Street Health should continue to do business with Medicare and Medicaid given the conflicts of
Are you
interest?
saying we should cut Medicare Advantage?
Mr. Kennedy, your dissembling and diversion distracts from the fact that you refuse to be radically transparent with
He
either
didn't give
Mr.
any
Means or Mr. Smith. I'm going to enter for the record now documents.
You didn't give any money to
substantiate these
United.
claims. Auchincloss oversight letters to Means and the Board of TrueMed and Main Street.
Without
Secretary's
objection,
All submitted.
the gentleman's time has expired. The chair now.
Secretary of Health and Human Services, Robert F. Kennedy Jr. And Mr. Kennedy, Mr. Secretary, you may make your opening statement at this time.
Thank you, Chairman Crapo, and thank you, Ranking Member Wyden, for the invitation to appear before the committee today. Before I summarize what we've accomplished this year at HHS, I want to express my deepest condolence to the family of DeKalb County Police Officer David Rose, who gave his life to stop the gunfire attack on the CDC on August 8th. Officer Rose was a veteran. He was a husband and the father of 2 children. Officer Rose's widow, whom I visited, is expecting their 3rd child. I'd like Officer Rose's family to know that he remains in our prayers and that he will continue to be in our thoughts. Let me start with the big picture. Under President Trump's leadership, we at HHS are enacting a once-in-a-generation shift from a sick care system to a true healthcare system that tackles the root causes of chronic disease. Chronic disease has reached crisis proportions in our country. And finally, we have an administration that is taking action. The MAHA report assessment, which the White House released in May, was the first government analysis of the key drivers of childhood chronic disease: ultra-processed foods, chemical exposures, physical inactivity, and over-medicalization. This month, we will follow with the MAHA report strategy, the Trump administration's solution for addressing each cause. At HHS, we haven't just been writing reports. We have been the busiest, most proactive administration in HHS history. In just half a year, we've taken on food dyes, baby formula contamination, the grass loophole, fluoride in our drinking water, gas station heroin, electronic cigarettes, drug prices, prior authorization, information blocking.
The committee will come to order. I apologize to you for that outburst, Secretary Kennedy. I would notify everyone else in the audience. Comments from the audience are inappropriate. If there are any further disruptions, the committee will recess until the police can restore order. Mr. Secretary, please proceed.
As I was saying, prior authorization, information blocking, and healthcare interoperability. We are ending gain-of-function research, child mutilation, and reducing animal testing. We are addressing cell phone use in schools, excessive screen time for youth, the lack of nutrition education in our medical schools, sickle cell anemia, hepatitis C, the East Palestine chemical spill, and many, many others. At FDA, we are now on track to approve more drugs this year than at any time in history. I'm also proud to say that HHS under President Trump is doing more with less. We have taken measures to fight waste, fraud, and abuse. Just by eliminating duplicative enrollments in CMS, we are saving taxpayers $14 billion a year. Meanwhile, we are expanding access for people who need it. We are ending racist diversity, equity, and inclusion practices and instead focusing on aiding low-income and vulnerable families, regardless of their race, which was the original intent of Title X. We're also pouring $1 billion into Head Start and the Administration for Children and Families. Compassion need not be the casualty of efficiency. I'd like to highlight some issues that have not gotten media attention. First, we are doing our part to fulfill the President's commitment to stop human trafficking, especially of children. We inherited a terrible humanitarian crisis from the previous administration with its open border policies, which allowed the appalling loss of 476,000 unaccompanied children. We have implemented policies now to ensure that that appalling tragedy can never happen again. We have knocked on 82,000 doors and located 22,000 of those children. I promise you that we will do more in the next 3 years. We are also addressing the disastrous health conditions in tribal communities on Native American reservations. I've met face-to-face with tribal leaders in dozens of communities and tribes in Alaska, Arizona, Idaho, New Mexico, and elsewhere. And I look forward to making HHS resources more available to those communities. One of the most significant initiatives under President Trump is the Rural Health Transformation Fund, part of the President's Big Beautiful Bill, which will provide the greatest investment of federal money into rural health care in history.
Senator Bennett.
Mr. Secretary, in June, you fired every member. Mr. Secretary, are you? Mr. Secretary, may I have my time back, Mr. Chairman? Thank you. Mr. Secretary, thank you for your attention. In June, you fired every member of the well-qualified panel that was charged with recommending vaccines to the CDC. No one in your job has ever fired every committee member all at once. That month, you told the American people that you were, quote, going to bring great people onto the ACIP panel, not anti-vaxxers. Are you aware that one of the people you put on the panel, Dr. Robert Malone, claimed that the commonly used mRNA vaccine, quote, causes a form of AIDS and can damage children's, quote, brains, their heart, their immune system, and their ability to have children in the future? Yes or no, Mr. Kennedy?
And Dr. Malone is one of the inventors.
Yes or no? Yes or no? Were you aware that he had that view when you appointed him to this panel?
Dr. Malone is one of the inventors. As I said, Dr. Malone is one of the inventors of the mRNA vaccine, so he knows a lot more about it than I do.
Mr. Chairman, that statement is not true that Dr. Malone made, just as it wasn't true when you wrote that, quote, African AIDS is entirely different from Western AIDS. Are you aware that another one of these new members, Dr. Levy, wrote that, quote, evidence is mounting and indisputable that mRNA vaccines cause serious harm, including death, especially among young people? Yes or no? Are you aware that he said that?
I wasn't aware he said it, but I think I agree with it.
You agree with it. It's not true. It wasn't true when he said it, and it's not true when you said it. Secretary Kennedy, later this month, your new panel will meet to consider changing vaccine recommendations for American children. In addition to the COVID-19 vaccines, they are set to review recommendations for the hepatitis B vaccine, for measles, for mumps, for rubella and varicella vaccine, and the RSV vaccine. These are common back-to-school vaccinations for children all over the industrialized world. If you change that, you owe parents in Colorado and across the country the benefit of some transparency, I think. If your panel recommends changing the vaccine schedule for children, do you anticipate that fewer children will receive these common vaccinations, yes or no?
What I would say, Senator,
the obvious answer is yes. Should parents and schools of Colorado be prepared for more measles outbreaks as a result of that, Mr. Secretary?
Senator,
how about more mumps outbreaks?
I do not anticipate a change in the MMR vaccine. ACIP is an independent panel. So,
well, it's a panel you just put those folks on. Far from what you said, they're people with ideas that are completely outside the mainstream.
You mean out of the pharmaceutical paradigm?
Let me just say, Mr. Secretary, all these vaccines that we're talking about today are free and accessible to parents today in America who have the freedom to be able to make that choice for their children. Will that be true after your handpicked panel makes their judgments about these vaccines?
I think that parents should be free to...
I know you said that before. I do too.
To make their own choices.
So will they be just as free after these?
I assume they will be.
I will hold you to that, Secretary Kennedy, because this is not a podcast. It is the American people's health that's on the line here. This is the last thing, by the way, our parents need when their kids are going back to school, is to have the kind of confusion and expense and scarcity that you're creating as a result of your ideology. I think it's critical for you to share the evidence that this panel will rely on. Will you give the American people 6 months or 6 weeks in advance the record that they're going to rely on to make these decisions? Will you make it transparent for the American people?
All the evidence is transparent.
Will you make it in advance transparent for the American people so they can comment on it?
All the evidence is transparent for the first time in history, and you were never there complaining when the pharmaceutical companies were picking those people and then running their products through with no safety testing.
You can characterize it any way you want. I quoted them today. What I said was accurate. What you said were lies. You described people moving the Titanic.
Are you saying that the mRNA vaccine has never been associated with myocarditis or pericarditis in teenagers?
I am simply.
Is that what you're trying to tell us?
I am simply trying to say that the people that you have put on that panel, after firing the entire.
You're evading the question.
No, I'm asking the questions here,
You're
Mr. Kennedy.
evading that question.
I'm asking the questions,
I asked
Mr. Kennedy.
You a question.
I'm asking the questions for Mr. Kennedy on behalf of parents and schools and teachers all over the United States of America who deserve so much better than your leadership. That's what this conversation is about, Mr. Chairman.
Senator, they deserve the truth, and that's what we're going to give them for the first time in the history of that agency.
Senator White.
Thank you very much, Mr. Chairman. I've made it clear. I think that Secretary Kennedy is dead set on making it harder for children to get vaccines and that kids are going to die because of it. And Mr. Chairman, I'd like to put in the record today an op-ed written by Susan Monarez, who was fired by Mr. Kennedy.
Without objection.
So what we know, and Dr. Monarez, was approved by Republicans. She wrote an op-ed today in the Wall Street Journal, which I've just put in the record, and I quote her. She said, I was told to pre-approve the recommendations of a vaccine advisory panel newly filled with people who have publicly expressed anti-vaccine rhetoric. So this is not some liberal philosopher or something. This is the CDC director who tells the Wall Street Journal, which is not exactly interested in progressive, theories and the like, that she was told to pre-approve the recommendations of a vaccine advisory panel filled with people who've publicly expressed anti-vaccine rhetoric. So my first question, Mr. Secretary, is did you in fact do what Director Moneris said you did, which is tell her to just go along with vaccine recommendations even if she didn't think such recommendations aligned with scientific evidence? That is
No, I did not.
That's a yes or no. So you have an opportunity to call her a liar if you say that you didn't do it, but I'd like to see you respond to this.
No, I did not say that to her. And I never had a private meeting with her. So there are witnesses to every meeting that we have, and all of those witnesses will say, I never said that.
So she's lying today to the American people in the Wall Street Journal?
Yes, sir.
Okay. Let's talk now about what's coming up, because I've made it clear what I've thought about the 203 days with my colleague, Senator Also Brooks. In 2 weeks, CDC's Advisory Committee on Immunization Practices will meet to make decisions about critical vaccines that protect us against hepatitis B, measles, and more. The committee's got a profound impact on vaccine access, but these aren't ordinary meetings. You've stacked the deck to ensure the panel bends to your views. In June, you fired all 17 committee members who are respected scientists and doctors. You replaced them with non-experts, vaccine skeptics, and conspiracy theorists. As a result, this critical advisory panel has lost scientific credibility. After years, colleagues, we spend so much time not looking at this as Democrats and Republicans, but as good science and scientific credibility. And now the American Academy of Pediatrics has warned that the committee is being politicized at the expense of children's health. American Academy of Pediatrics, you think they're lying too?
I think the American Academy of Pediatrics is gravely conflicted. They get, for their biggest contributors are the 4 largest vaccine makers. They run a journal, Pediatrics, which they make a lot of money on, that is completely dependent on pharmaceutical companies. So I wouldn't put a big stake in what they say that benefits pharmaceutical interests. Senator, I didn't politicize ACIP. I depoliticized it. The Congress has been investigating ACIP.
All over the country, Mr. Secretary, scientists and doctors are saying otherwise. They're all wrong, too. They're all lying, according to you.
The scientists and doctors are supporting me all over the country. There is division on opinion.
I don't get letters from thousands of people who are not political saying that this set of changes is going to damage American healthcare, and particularly these healthcare agencies, for decades to come. I don't get any letters from people saying, hey, this is going to make a big difference forever.
Maybe you're listening to a selective group of people.
Well, you get me.
Yeah, and I will.
Fine.
I will tell you what, Senator. I will put my mailbag against your mailbag any day of the week.
I got 30 seconds. Dangerous respiratory viruses like RSV are on the agenda for the next advisory meeting. Countless parents have been awakened in the dead of night by a wheezing kid gasping for air, forced to rush their little one to the ER. There's no worse heart-wrenching fear. The RSV vaccine offers these kids protection against the worst effects of the virus. But now it looks like you're on a crusade to make infants and babies more vulnerable to the terrible illness. That's what we're doing with the COVID changes.
And please make your answer brief, Mr. Secretary.
I've said that
position is indefensible. I think it's possible.
Congress has been investigating that committee for 23 years because it is pervaded with conflicts of interest. What we did is we got rid of the conflicts of interest and we depoliticized it and put great scientists on it. from a very diverse group.
Let me close with,
very pro-vaccine.
Let me close with this, because like Senator Crapo, I'm a few seconds over. I don't think, Mr. Secretary, this is about you and me. This is about kids being pushed in harm's way by reckless and repeated decisions to get scientists and doctors out of the way and allow conspiracy theories to dictate this country's health policy. I don't see any evidence that you have any regrets about anything you've done or plans to change it. And my last comment is, I hope that you will tell the American people how many preventable child deaths are an acceptable sacrifice for enacting an agenda that I think is fundamentally cruel and defies common sense. Thank you, Mr. Chairman.
Do I get a reply? Or, Senator, you've sat in that chair for how long? 20, 25 years, while the chronic disease in our children went up to 76%. And you said nothing. You never asked the question why it's happening. Why is this happening? Today, for the first time in 20 years, we learned that infant mortality has increased in our country. It's not because I came in here. It's because of what happened during the Biden administration that we're going to end.
I'm going to let Senator Wyden respond briefly to that, and then we're not going to go over like we just did.
Defend this committee on a bipartisan basis. Colleagues, my cabinet secretary says that we have no interest in chronic care. Mr. Secretary,
Mr. Chairman, could we have regular order, please?
We are in the process of turning around the Medicare program with the chronic care bill that Chairman Hatch, when he was chairman, and this committee put together on a bipartisan basis.
All right, we're going to proceed. And I just want the rest of the members to know, I gave Senator Wyden as ranking member some leeway there, but we're going to stick to the 5 minutes.
Let me go back to policy for a couple, so maybe we can lower the temperature a little bit. I got a bipartisan bill that would be a systemic fix, not a vote-buying mechanism when Medicaid's getting cut, what was put in on the rural hospitals. One of the things we could do, Mr. Secretary, is make sure that the folks who work in rural hospitals get an 80% reimbursement of what folks get in more urban centers. Would you support that legislation?
Are you talking about the area wage index?
I'm talking about the area wage index and moving that up to 80%. So there is actually ability to get rural providers.
President Trump supports that, and we support.
Do you support? You support? Good. So you will work with us to get that passed.
Yes.
That will increase costs on both Medicaid and Medicare. So you are committed to that. I appreciate that. What about Senator Wyden and I've got a bill because across America.
What about what?
Hospitals are shutting down on their OBGYN services. Try to have a baby. I don't know about in all of my other friend states, but in Southside Virginia, you can't find a hospital. Will you work with us to make sure that before OBGYN services are taken out of a rural hospital, there has to be a process and procedure?
I'm happy to work with you on that, Senator, meet with you and see if we can work with you on it. I don't know exactly what the issue is.
Well, again, the Secretary of Health and Human Services, who has said he doesn't know how many people died from COVID, doesn't know if the vaccine saved lives, doesn't understand the issue that OBGYN doctors are fleeing rural America because they can't afford it. And with the cuts that are coming up, it's going to be exponentially worse. I would invite you, sir, to come with me to a community health center in Virginia and hear what is on people's mind. They want to get healthier? Absolutely. Count me in. But they also don't want their basic health care removed. Thank you, Mr. Chairman.
Thank you, Mr. Chairman. So last November, while you were under consideration to become Secretary of Health and Human Services, Mr. Kennedy, you said, quote, if vaccines are working for somebody, I'm not going to take them away. No exceptions, no ifs, ands, or buts. You would not take away vaccines from anyone who wanted them. Then last week, you announced that the COVID-19 vaccine is no longer approved for healthy people under the age of 65. In announcing the change, you said the vaccine will be available for anyone who wants it. Now, obviously, both things cannot be true at the same moment. So let's clear this up right now, Secretary Kennedy. Will you tell America that all adults and all children over 6 months of age are eligible to get a COVID booster at their local pharmacy today?
Anybody can get the booster.
I'm sorry?
Anybody can get it, Senator.
Anybody. So you're saying that is now the official rule of HHS. Anybody is eligible to get a booster by just walking into the pharmacy.
It's not recommended for healthy people.
No. If you don't recommend, then the consequence of that in many states is that you can't walk into a pharmacy and get one. It means insurance companies don't have to cover the $200 or so cost. As Senator Dr. Cassidy said, you are effectively denying people vaccines.
We're not going to recommend a product for which there's no clinical data for that indication. Is that what I should be doing?
What you should be doing is honoring your promise that you made when you were looking to get confirmed in this job.
You're going like this.
And that is, you promised that you would not take away vaccines from anyone who wanted them. You just changed the classification of the COVID vaccine.
I'm not taking them away from people, Senator.
It takes it away if you can't get it from your pharmacist.
Well, most Americans are going to be able to get it from their pharmacy for free. Most Americans will be able to get it from their pharmacy for free.
The question is everyone who wants it. That was your promise,
No, I didn't. I never promised that I was going to recommend products with which there is no indication.
When you said...
And I know you've taken $855,000 from pharmaceutical companies, Senator.
Did you hold up a big sign saying that you were lying when you said that? Because you are the one who said you would not take them away. Now, Senator Kennedy,
I'm not taking them away from anybody.
Secretary,
you want me to indicate a product for which there is no clinical data?
Senator,
is that what you want?
Secretary Kennedy, you said you wouldn't, and now you did.
I'm not taking them away. Everybody can get access to them.
No, they can't walk into a pharmacy the way they could last month and get access to
It depends on the states.
A year ago,
but they can still get it. Everybody can get it. Everybody can get it, Senator.
So look, let's move on. You clearly are taking away vaccines. I've seen the list for what's coming up next, and that is the agenda for the next CDC vaccine panel. And first up is ratifying your COVID actions. Second is hepatitis B is on the agenda. So should Americans expect you to take away hepatitis vaccine access as well, even though you promised not to?
As I said, I'm not taking vaccines away from anybody.
Okay, same answer, right? You're just going to deny that when people can't get access, that you're not taking it away. Then let me ask you, is that the same game you're going to play with measles,
you want me to recommend every product in the world so that without any clinical trial data?
Through on your promises.
Yeah, my promise was to give.
A month ago, we could get COVID vaccines by just walking.
You can still get COVID vaccines, Senator.
You are taking that away.
No, you are you can still get the COVID vaccines, and Medicare will still pay for them, and Medicaid will still pay for them.
Tell the head of the CDC that if she refused to sign off on your changes to the childhood vaccine schedule, that she had to resign.
No, I told her that she had to resign because I asked her, are you a trustworthy person? And she said no. So if you had an employee who told you they weren't trustworthy, would you ask them to resign, Senator?
So I'm sorry, but this is not what she has said publicly. She has said
I'm not surprised about that.
So you're saying she's lying?
Yes. Every conversation I had with her, there were
witnesses. Let me get this straight. This is the same person that less than a month earlier, you stood next to her and described her as unimpeachable, and you had full confidence in her, and that you had full confidence in her scientific credentials. And in a month, she became a liar?
Yeah, you should ask her what changed. And by the way, a month ago, you were voting against her. Oh, because you thought she was either incompetent, ineligible, or unsuited to the task.
I voted against her because I was afraid she was going to bend the knee to you and Donald Trump. And it looks like she didn't bend the knee, so you fired her. Look, you're putting America's babies' health at risk, America's seniors' health at risk, all Americans' health at risk, and you should resign.
Senator Sanders.
President Trump
who I don't usually agree with, called COVID vaccines, quote, one of the greatest miracles in the history of modern-day medicine that saved tens of millions of lives worldwide. Scientific community agrees with Trump. Lancet study found that it prevented almost 20 million deaths during their first year of use. Secretary Kennedy, are President Trump and the medical community right, or do you still believe that the COVID vaccine was, quote, the deadliest vaccine ever made?
No, first of all, I didn't say that. Oh, I said that in terms of affairs reports a while ago. I've said today, I think that President Trump should get the Nobel Prize.
So who's right? Is Trump in the medical community right, or are you right?
President Trump did an extraordinary piece of leadership.
Is he right or wrong? Did COVID save millions of lives?
As I said, he got Americans back to work. At that time, that particular vaccine was perfectly matched to the virus that was circulating then. And I have no idea how many lives it saved, but it saved quite a few.
You know, what I find a little bit weird in this discussion, I'm hearing it over and over again this morning, Mr. Chairman, is we've got the entire medical community on one side. You got the AMA representing hundreds of thousands of doctors, the American Academy of Pediatrics, the American Public Health Association. All of these organizations are telling us that COVID vaccine and vaccines in general are safe and effective. You are casting doubt on that. Who are the organizations that are agreeing with you and casting aspersions on vaccines?
The primary advisors are Marty McCary, Jay Bhattacharya, Dr. Oz, Vinay Prasad.
So you got a few doctors who agree with you, and I'm giving you the name.
Not a few doctors. What you're talking about is there's a big difference, Senator, between established science and the scientific establishment, which has been co-opted by the pharmaceutical industry.
So you're telling the American people that the American Medical Association, representing hundreds of thousands of people, have been co-opted and that they should not trust their doctors.
And
the American Academy of Pediatrics, and by the way, just for the record, every single Republican, I don't mean to be political here, Mr. Chairman, has received PAC money from the pharmaceutical industry. Are they all corrupt as well?
And I'm telling you, the American Heart Association has been co-opted by the food
Everybody but you, Senator. But you know what? When you ran for president, you know, we have a corrupt campaign finance system. Maybe you will agree with me on that. Okay, you were running for president, you got a billionaire behind it. You received $300,000 from people, not from the industry, people in it, as I did, from individuals. You corrupt. President Trump got $3 million. Every Republican got corporate PAC money for the pharmaceutical industry. Democrats as well. Everybody is corrupt, but you? Is that what we're looking at? I don't think so. And I think the issue now...
I don't even know what you're talking about.
Well, I think you do know what I'm talking about.
I don't know what you're talking about.
The issue is every time anyone disagrees with you...
Are you saying the pharmaceutical industry was supporting my presidential campaign?
I'm saying,
I don't think so.
I'm not saying that. I'm saying that the pharmaceutical industry is a greedy institution which is charging us the highest prices in the world. They are pervasive. But to suggest that every institution, the AMA, the pediatrics people, is corrupt because they disagree with you is an insult to the American people.
Listen, people disagree with me all the time. I have arguments in my agency, heated arguments every day with Jay Bhattacharya, with Marty McCary, with Dr. Oz.
You have given the names of a few people. I have given you the names of organizations representing hundreds of thousands of doctors and scientists. I yield, Mr. President.
Senator Tillis. Senator Lujan.
Thank you, Mr. Chairman. Secretary Kennedy, Dr. Daskalakis, who recently resigned as director of the National Center for Immunization and Respiratory Diseases, his resignation letter stated he and his team were never allowed to brief you. I'm curious who you're listening to, since it's clear you're not listening to qualified experts like Dr. Daskalakis. Can you give the committee the name of the person?
I don't consider Dr. Daskalakis.
Mr. Secretary, the question that I have for you is, can you give the committee a name of who you're getting briefed by?
I'm getting briefed all the time by CDC.
Just a name.
Dr. William Thompson's one name.
Thank you very much, sir.
Now, but I can get you a whole list of other, it's on my schedule.
Mr. Secretary, that's not a hard question. You know a lot of answers.
I'm not being evasive.
Okay, then you answered it. Let's go on. Now, you said that you're soon going to release a study claiming to reveal the cause of autism, timed unsurprisingly with the upcoming ACIP meeting to justify taking vaccines from Americans. Now, as you know, autism affects millions of children. So I guess you'd have the nation's top medical experts working on this. Mr. Kennedy, you hired a man named David Geyer to conduct this study. Is that correct?
No.
Is Mr. David Geyer working for HHS?
He's a contractor, but he's not conducting a study.
He's a contractor?
He's a contractor.
Do you know who works for you, Mr. Kennedy?
Yeah.
Do you know that Mr. Geyer is listed as a HHS on the employee directory as a senior data analyst, not a contractor?
He's a contractor. He's not an SGE.
So is your website wrong?
He's not an SGE. I don't know what.
I'm going to pull up the website for you.
He's a contractor.
If the website says he is a senior data analyst, will you at least admit to the committee?
Well, I don't know if
wrong?
a contractor can be classified as a senior data analyst or not.
Is Mr. Geyer a doctor?
No.
Did you know he never went to medical school?
He's not practicing medicine.
Did you know that he got caught in Maryland and was charged for practicing medicine without a medical license?
He was charged by a medical board, he sued the medical board, and the medical board was found to have acted in actual malice and was fined $2.6 million by a judge in Maryland for doing that.
See, so you choose to know a lot when you want to know a lot. It's incredible, Mr. Kennedy.
Senator, you're ridiculous.
So here's the question I have. You brought him in to do this study. I think there's no question about it.
I told you he's not doing a study.
Is he participating in the study?
No.
Is he doing any analysis in regards to this study?
No. What he's doing is getting access to the Vaccine Safety Data Link, which is the biggest repository for vaccine information that your friend would not give us for 7 months.
Mr. Secretary, let me ask you this question, just because you know the answer. What is Mr. Geyer doing?
He is the only one, because Congress ordered CDC to open up the VSD to him in 2002. He's the only outsider who's ever seen it. So because CDC will not give us, they have
Mr. Secretary, is he participating in this then?
No.
You just said he's the only dude that knows what's going on here.
Do you want me to explain it to you, Senator, or do you just want to showboat?
I'll submit this.
You just want to showboat for your ads, or do you want to hear a real answer to your question?
Mr. Secretary, you choose to know answers to questions with some colleagues. And
I'm willing to give you the answer. I'm willing to give you the answer.
Mr. Secretary, someone should have asked you, maybe President Trump should have asked you, are you a trustworthy person? And we should have waited for an answer then. Let's move on.
I don't even know what you're talking about. You're talking gibberish.
Mr. Secretary, let me speak slowly and clearly so that you can understand me through my New Mexico accent.
And then give me a chance to answer.
Does this help? Can you understand me?
Yes.
Appreciate that. Mr. Secretary, yes or no, did you hire Mr. Geyer to do this study?
No.
Mr. Chairman, well, let me ask, maybe we'll just get a good answer here. Mr. Secretary, will you commit to sharing the protocols used for the autism study with Congress and to the public?
They're public.
Will you commit to giving it to this committee by the end of the week?
No, not because that's not the way it works.
Will you
don't even know what you're talking about.
Mr. Secretary, will you commit to sharing the protocols for the study by the end of the month?
We already have put out.
You just said it's public.
We put out the notice of funding opportunities, and then the scientists from all over the world.
You're not understanding me. Let me
No, you're not understanding how the world works.
Do you understand what the protocols are? Do you understand what they are?
The scientists who are doing the studies submit the protocol.
Okay, so you know what they are.
That's not coming from us.
So will you commit to sharing those protocols with this committee?
Well, anybody can get a hold of the protocol. It's published with the study.
Mr. Chairman, what I'd like to ask is for your commitment here. I'll send a letter to the Secretary. I'll ask for support from the leadership of this committee to ask for those protocols. If those protocols are not given to this
Anybody
committee,
can get the protocols.
Mr. Secretary, I'm not talking to you. Mr. Chairman, what I'm asking...
If the protocols are public, we can work with you to
What I'm
get
asking,
access to.
Mr. Chairman, is that if those protocols are not given to this committee, I'm asking for your agreement that we follow through with the subpoena to get them.
No, I will not agree to subpoena anything. Let's see what
But
happens.
Mr. Chairman, you'll help me get them if they're available publicly?
Yes.
I appreciate that, Mr. Chairman. Mr. Kennedy, with all the questions here today, people just want to know the truth.
I don't think so.
Mr. Secretary, you don't think so? Thank you.
I don't think so.
I hope everyone recording that got that, because there explains the Secretary's tenure here. Look, 2 young ladies in Las Cruces, New Mexico at a town hall recently gave me this starfish pin. I was going to give it to you today, but after your questioning today, I don't think you deserve it, because what this represents is to remember that every one of us can make a difference, sir, to something as small as a starfish on a beach that maybe got washed up, you throw it back in the ocean. You might not save them all, but you can save one. I'm sorry that you're not worthy of this nice little pin, sir, as a nice reminder. I'm going to pray for you, Secretary Kennedy. I hope we do better. I want you to do better. But today was a failure for you, man. I yield back.
Still paid for them, and Medicaid will still pay for them.
Tell the head of the CDC that if she refused to sign off on your changes to the childhood vaccine schedule, that she had to resign?
No, I told her that she had to resign because I asked her, are you a trustworthy person? And she said no. So if you had an employee who told you they weren't trustworthy, would you ask them to resign, Senator?
So I'm sorry, but this is not what she has said publicly. She has said
I'm
she
not
was
surprised about that.
So you're saying she's lying?
Yes. Every conversation I had with her, there were
And let me get
witnesses.
this straight. This is the same person that less than a month earlier, you stood next to her and described her as unimpeachable, and you had full confidence in her, and that you had full confidence in her scientific credentials. And in a month, she became a liar?
Yeah, you should ask her what changed. And by the way, a month ago, you were voting against her. Oh, because you thought she was either incompetent, ineligible, or unsuited to the task.
I voted
Now I
against her
agree
because
with
I was afraid she was going to bend the knee to you and Donald Trump. And it looks like she didn't bend the knee, so you fired her. Look, you're putting America's babies' health at risk, America's seniors' health at risk, all Americans' health at risk, and you should resign.
Senator Sanders.
Just want to pick up on Senator Warren's point. Are you telling us that the former head of CDC went to you, you asked her, are you a trustworthy person? And she said, no, I am not a trustworthy person?
She didn't say, no, I'm not a trustworthy person. She said, no. I'm giving a quote. And I asked her twice.
No, 1 second. And you're also repeating now that she is a liar, correct? What she wrote in the Wall Street Journal.
If she wrote that I fired her because she refused to sign on in advance for the ASIP committee, no, that's not accurate.
All right, so you're calling her a liar, and I look forward to her coming before the Help Committee.